Good morning, everyone. Welcome to the Sacramento County Board of Supervisors. Today's date is November 2, 2021, and it's 9:30 a.m. This meeting is hereby called to order. And at this time, our clerk will call the roll and establish quorum and read the Metro Cable.
Good morning, Supervisors Desmond,
Here.
Kennedy,
Here.
Natoli,
Here.
Cerna,
Here.
Frost,
Here.
and you have a quorum. This meeting of the Sacramento County Board of Supervisors is cablecast live on Metro Cable 14, the local government affairs channel on the Comcast, Consolidated Communications, and AT&T UVerse cable systems. The meeting is closed caption and is webcast at metro14live.saccounty.net. Today's meeting will be repeated Friday, November 5th at 6 p.m. on Channel 14.
Thank you. And I'm going to invite my friend and colleague, Supervisor Desmond, to please lead us in the Pledge of Allegiance.
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you, Supervisor Desmond. This morning, I wanted to open with a statement of gratitude to many people in Sacramento County who were there, present, and accounted for to respond to the October storms, which, while some of us were comfortable in our homes as the rain was pouring down, there were a lot of folks that were disrupted, and a lot was going on around the county. And I just want to acknowledge the county staff who worked so hard during that time. Ben Lemira in finance, Ben Marin, SCEMSA, Brian McKenzie in general services, logistics, Dan Donnelly, sheriff law operations, Dave Kafalu, DTech and IT and planning. Sorry if I'm pronouncing names wrong. David Geiselman, SAC OES administrative support. David Villanueva, SAC County CEO office. David White in general services, logistics and procurement. Ethan Dye, human assistance. Actually, Ethan Dye, I want to especially give you a shout out for opening the DHA lobbies early and for staying until midnight, I think 1 or 2 nights. And so Ethan went the extra mile. Frank Mendez of General Services with logistics. George Booth, water resources, flood technical specialist. Jana Hines, Sac County Public Information Officer. Jason D'Alicio of SAC OES, Mass Care and Shelter. Jeffrey Lamb, OARS, Radio Communications. John Lundgren, Sustainability Plans and Intel Chief. John Wilson, Sheriff, Law Operations. Joseph Caldera, General Services, Logistics. Josh Freeman, Consumnes Fire District, Fire Operations. Kamal Atwa, Transportation, Roads and Bridges. Kevin Smith, Sac County EMD, Health Hazmat. Kim Nava, Sacramento County Public Information Officer. Kim, thank you for all your hard work in making sure everyone is informed on where to go next and what to do and what's happening. Lane Rudick of Human Resources, Care and Shelter. Lou Lee of Transportation and Roads and Bridges. Lupe Rodriguez, Transportation, Roads and Bridges. Lynn Pesley, SAC OES SMRC, Volunteer Coordination. Mark Aspezi, Finance, Financial Support Staff. Mark Barcelos, EMD, Care and Shelter, Environment Health. Mary Jo Flynn Nevins of SAC OES, our EOC Director. I want to thank you, Mary Jo, for opening our emergency opening everything up early for everyone. Matt Burton, Sheriff, Law Operations. Matt Robinson of Water Resources and Transportation, Public Information Officer. Matthew Hawkins of SAC OES EOC Coordinator, Michael Doan, Animal Care Shelter, Michael Johnson, Water Resources, Flood Technical Specialist, Michael Meany, DWR, Flood Technical Specialist, Nancy Springer, Building Plans and Intel Chief, Patrick Ellis of PG&E Liaison, Peggy Marty of Finance and Administration, Robert Cady of DTech, IT and Planning, Emily Halkin, who worked overnight, an overnight shift in the respite care, which Emily is a woman after my own heart, working the shelters. Thank you, Emily. Sarah Clark, DTech, IT Planning. Scott Bragg, DTech, IT Planning. Steve Brooks, SMUD Liaison. Todd Peterson, Water Resources, Flood Technical Specialist. I wanted to acknowledge all of these folks, and I want to thank our county executive for helping me pull together, and her team for helping me pull together a list that would give everyone an idea of how much goes on in a state of emergency, or when something happens at the county. Everybody comes together to try to help those folks that are in need, and a lot of people wonder where to go, and it takes people to deliver services. And so I wanted to point out that at the county, a lot of the services, most of the services we offer are delivered by people. And so administrative support and the staff are what delivers the services at the county. And I wanted to thank our county executive for your leadership in organizing all of that. And I want to thank everyone for being there through that time. And I'm thankful to God, or whatever, the rain gods, for giving us that beautiful rain, which we needed so badly. And I'm thrilled that we were able to even get rain over the past couple days, and hope it continues. So that's my opening statement. I'm going to go ahead and read my meeting announcement. We have a lot of work today. We're going to be here till this evening into the night. And so let's get to work. The Board of Supervisors encourages public participation during the meeting in person, telephonically, or in writing. In compliance with directives of the county, state, and Centers for Disease Control and Prevention, this meeting is broadcast live and open to the in-person attendance. The county requires a face mask or face shield while inside the county's administration building, which includes the board's chambers and hearing rooms, and recommends social distancing. Meeting procedures are subject to change based on recommended public health and safety guidelines. Public comments will be taken in the order of in-person comments and then comments by phone. If you're making a public comment in person, a face mask or face shield is required, and social distancing is recommended while inside the chambers or hearing rooms 1 and 2. Seating is limited and available on a first-come, first-served basis inside the chambers, and overflow seating is available in the hearing rooms 1 and 2. If there are no seats available inside the chambers or overflow room, please form a line in the designated area and wait for your turn to a public comment. Please complete a speaker request form and give it to the clerk staff. A separate speaker request form is required for each agenda item or topic that is not on the posted agenda. When I open the public comments, I will call 3 names at a time. When you hear your name, please start walking towards the podium inside the chambers and wait for your turn to make a comment. If you're making a public comment by phone, dial 916-875-2500 and follow the prompts to be placed in the queue for a specific agenda item or off-agenda matter. Please refer to the agenda and/or watch the meeting to follow along and determine when is the best time to call and be placed in the queue to make your public comment. You may be on hold for up to an extended period of time, and your patience is appreciated. I will ask the clerk to transfer the calls into the meeting accordingly. Each agenda item queue will remain open until the public comment period is closed for that specific item. Members of the public will be given 2 minutes to make a comment and are limited to making 1 public comment per agenda item or off-agenda matter. Please be mindful of the public comment procedures to avoid being interrupted or disconnected while making your comment. If you need an accommodation pursuant to Americans with Disabilities Act or for a medical or other reasons, please see the clerk's staff to assist you or contact the clerk's office at 916-874-5451 or by email at boardclerk@saccounty.net. You may send written comments by email to boardclerk@saccounty.net. Your comment will be routed to the board and filed in the record. Thank you in advance for your courtesy and understanding these meeting procedures. And at this time, I'll ask the clerk if she'll please read her announcements for consent.
Okay, for your consent matters, items 1 through 33. For item number 2, you are adopting an ordinance amending section 2.115.265, Title II, relating to the primary election period, and amending sections 2.115.300 and 2.115.310, relating to contribution limits for on-election years pursuant to the review of the biennial contribution limit adjustments. You waived reading on this on October 19th, and the ordinance that you're adopting today does include the adjustments that we made in session, so it is not adjusting the aggregate limit. And then that concludes my notes for your consent matters.
Okay, thank you. And at this time, we have board members who may have comments on consent, and I will first call on Supervisor Cerna.
Great, thank you, Chair. I had a question during my briefing about item 19.
Yes, let me pull that up. Item 19 is the contract AC overlay project SB1 2022 Phase 2. Bids to be received on December 9th, 2021, and the environmental document is a categorical exemption.
Great, I see Ron Vicari in the audience and he's making his way down. Morning.
Good morning.
So a general question, just noted on the location of the overlays, and it's my understanding these overlays are going to be paid for with purely with SB1?
No, it's a combination. Sorry, Ron Vicari, Director, Sacramento County Department of Transportation. It's a combination of SB1 money as well as the general fund money that was allocated to these projects.
So I guess my question, Ron, is just noting the number. I don't know how to measure it, whether it's lane mileage or square footage or what, but it's noticeable to me that the amount of overlay that's scheduled per the board letter and with the attached maps in the South Oak Park area is fairly minimal. And is there, knowing that area as well as I do, I know that there's a great need for overlay in addition to the locations that are cited on the map. But what's the rationale behind limiting it to just those two streets or those two stretches of streets?
Yeah, so how we decide or determine where the money actually is allocated, it's based on what we approved years ago with basically a 75% population, 25% road miles split. I think, so there is an allocation. We track it to make sure that the supervisorial districts are all receiving their fair share allocation of funding. I do think one of the reasons why the 5 projects shown today maybe seem light is that the next 2 projects going out that we're supposed to be part of this item but are waiting until SACOG can allocate the funding that we receive from SACOG are basically going to go later on. As soon as it's available, we'll move those forward. And in District 1, we have Watt Avenue shared with District 3, which is A Street to Don Julio. And then we also have Fruit Ridge, which is Highway 99 to Stockton Boulevard, which is shared with District 2 and the city of Sacramento. So those projects, are going to be at $1.8 million for Watt Avenue and then $799 for Fruit Ridge. So we do track it. We certainly show as we start to work through what overlays go out each year. We certainly can show how the split is and how each district is tracking.
I think that would be helpful. And I'll just note too that, and I think you and your staff are well aware of this, in that particular part of District 1, there's been a considerable amount of joint trench work lately with various utilities, PG&E, SMUD, and others. And the condition that's left behind, as we all can note in our respective districts when that occurs, it makes it even more treacherous for vehicles. So I would like to, at some point, maybe have you and your appropriate staff with my chief of staff sit down and talk about maybe how we look at whatever the next, availability of funding or scheduled work for District 1, how that could be focused on those local streets that have actually been disrupted with that kind of work, because they are sorely needed. I can tell you, driving a fairly large vehicle, even in those areas where the speed limit is very, very limited, local streets, we're dodging potholes and dips in the road, again, mostly due to a lot of that utility work. So just want to make note of that. I thought it was appropriate given the nature of this item.
I understand.
Thank you.
Madam Chair, if I could just weigh in, I want to talk
Certainly.
just on this item. Ron, I'm going to comment on a couple of the other items that are related to road paving, but I would just say, using the example that Supervisor Cerna was alluding to here, that we've had neighborhoods that, and I'll be, frank, I think that have been long neglected as it relates to some of the reinvestment that's so important. And part of that's the curb appeal that comes with the rights of way that we maintain and recognizing the struggles, and we've made a significant commitment. But when, you look at a neighborhood, and just using the example on this one, and I don't know, maybe you're going to do the other streets, but you got this division between where the city and county boundary falls here, and it's, that's common throughout certainly good portions of South Sacramento and elsewhere. But to the question I want to ask, then, are you in the next package you bring forward, are you going to include portions of Mendocino Boulevard, Siskiyou Avenue, 23rd Avenue, Del Norte Boulevard? I haven't driven those recently. They're certainly in Supervisor Cerna's district. But again, when you get this trenching work on top of overall deterioration, and I think this lack of investment by the county, not because you wouldn't pave every road in the county if you had the money, but I think it's really important. And you just do a small segment. You do, basically, that's probably a couple blocks long there on 22nd, and you get around the corner on 23rd, and that's it. And, when do we revisit that? And I bet you it's been 30, 40 years before we've done anything significant in those neighborhoods. And again, I'm going to offer some compliments in a moment about some of the items in District 5, but I guess I'm just curious. So in looking at this, and I know I spend a lot of time talking with DOT about the allocation district and trying to part and parcel the dollars out in a way that at least shows to a broad community, both suburban, urban, and rural, that we're serious about making this investment in our infrastructure and catching up where 20, 30 years, 40 years of very little investment is now showing, and then you get the trench cuts and such, and I think that may be something we need to visit as well. Yeah. We have this prohibition on trench cuts unless it's something of an absolute necessity, a water line breaks or something like that. I don't know how clearly that's adhered to, but I can imagine over time that those streets, since the last time they were paved in some of these neighborhoods, the trench cuts have come and gone, and they give you this patchwork quilt of unevenness. And once you penetrate the pavement surface, it's never the same. So I guess I'm curious, just in this particular neighborhood, you responded to him, but are you to Supervisor Cerna? But are you looking at trying to get in that neighborhood and get it done, and not keep revisiting a little bit and piece every time there's some more money?
So there's definitely a balance that we're looking at, and I do recognize what's been said both by Supervisor Cerna and Supervisor Natoli. In the trench cut details, we've struggled with that for many years, and The nexus that requires utility companies, what they're required to do is oftentimes not sufficient for what we need on the roadway, meaning that sometimes in certain cases they'll be required to address half the roadway. So there's absolutely the opportunity to partner with utilities. We are always looking to partner with utilities, but we to take advantage of what they're required to do and to be able to maybe supplement some money to get what's actually needed for the roadway. However, we do balance that with the needs that we have on other roadways. And so if that pavement really isn't in our priorities, then oftentimes we have that frustration of only half the road being addressed, or maybe we get to a limit and people don't recognize, well, why'd we stop there? Why didn't we continue? And the issue is because we have so many projects. I will say, in my career of 19 years here at the county, this is the best day for transportation, right? We have 50, because of the board's allocation of funding towards overlays, we're going to have $55 million of overlays going out. And that is absolutely significant. We're excited about it. We're very thankful for it at transportation. But as you know, we have an $800 million backlog. And so we do still struggle because those dollars are so critical and there's so many needs. So determining exactly making the best use of every single dollar we have is very important. So we do look at that. I recognize that we want to partner with utilities, but we can't always do that. We have done it in many cases, but it's not always a possibility.
Well, and just on that point, I know that in the District 5 allocation is in item 18, we're doing slurry in Rosemont in some areas in Butterfield Riviera because they only do half the street. And that's all they're required to do. And again, I certainly kudos to you and your staff and Lupia Rodriguez and others for trying to coordinate that. But then, if we don't get around to it, and so that's going to be probably about $1 million out of District 5 allocation just to go in and make up the difference, and not even overlay. It's basically a slurry to match up, and it's not just the aesthetic. You get this unevenness in the pavement cuts. But, some years ago we took this on with regards to pavement cuts, and certainly the utilities have the right to work in those rights of way and so forth, but the restoration, but I think the coordination, if nothing else, this is highlights for me that continued focus on when work is planned, and whether it's PG&E or it's one of the communication networks or anybody else, that, we work not only with the supervisor of the district, but certainly, to get money so that when it doesn't look like a halfway job when they're done, because again, in some of these neighborhoods, we haven't visited those streets for ages, and utilities are in and out of there, and we get this uneven mix. And you drive the system, and you're familiar with it, and we're familiar with our districts, and this is a good day. But again, I'm back to this neighborhood. So is there more plotted for this neighborhood? I mean, the supervisor certainly he'll carry the ball, but I'm just curious: is this it? We're going to do that section, and that's it?
And we got Fruit Ridge.
Fruit Ridge, the main arch. But I'm talking about the neighborhood streets where we don't get into the neighborhood, because those major streets wear out because of the volume and the traffic and so forth, and so their cycle is much more frequent. And meanwhile, we don't get to the neighborhoods for 30, 40, 50 years in some cases. I can show you roads that haven't been paved in 50 years in this county.
Yeah, so this last year, as well as subsequent years, we'll all look at. So we'll look at what the pavement management system is determining is the highest priority roadways. We'll also discuss, and I know in both of your districts, the utility trench cutting has been a major issue, and we've talked about that in briefings as we selected these roadways. So we'll definitely have the numbers for what it will take to try to bring that up to a reasonable level, but it's absolutely a consideration in every district. It just, it's a frustrating thing, but again, it's the balance between certainly, leaving a road half slurried with only a half a slurry seal, because that's what's required by the nexus for utility companies, is frustrating. But also sometimes it's hard to address that road when you have a road adjacent to it or in the similar neighborhood that's far worse conditions. So again, we're balancing those things, and we'll continue to try to do the best we can with every dollar and work with you guys, with you as we select these roads.
Yeah, can I make a suggestion, Ron?
Yes.
That when we have the dedicated discussion here in open session about priorities and in terms of future overlay projects, is it possible to incorporate into that discussion with maps, understanding of where trench work has occurred and where there's going to be enough confidence that the work that was done is not going to happen again for some time, so it's not a sunk, it's not a sunk cost, or it's not efficient use of funds to, overlay something that's just going to be torn up again in a couple of years. I think it would be helpful to actually see on a map in each of our respective districts where that circumstance applies, so that we can weigh that against, other considerations, including just kind of natural wear and tear, or the PCI, or whatever, that we typically use to assess where to best spend money, scarce money on roadway improvements. I know, again, given the circumstance in this neighborhood, that would be helpful, and I suspect it would be in other parts of the county.
Absolutely, we have that information for planned utility cuts, so we can definitely get that to you. I should also mention what we've really done in the last couple of years, that we've really strengthened. Hopefully, it begins to work to help and be noticeable. Is the coordination with the utility companies. We work with them to try to let them know when we're coming in to do an overlay, to try to let them get their utility stuff out of the way. One, if they have a moratorium after we've done an overlay, so it keeps them from doing the work. But we've been trying to coordinate with them so that we can get all their work done. And so that we don't have roadways, at least some of our newer roadways that are being trenched. And so the coordination effort, we've stepped up, and hopefully that also relieves some of this frustration.
Thank you.
Have you completed your statements?
Well, yeah, just comment on the item that he pulled. I wanted to talk, I have 3 items I wanted
You still have the
okay, well, I'll take them kind of out of order. Item 18, since
okay.
Ron's up there, so.
Yeah, no problem. Let me get to that. So that's contract for the AC Overlay Project SB 1 2022 Phase 1B, bids to be received on December 9th. The environmental document is a categorical exemption.
Great, thank you. Well, I did, Ron, want to be sure to note, and I know we have 6 different items today that related to AC overlay, and appreciate the work. I know your staff is, in addition to the normal workload, has been very diligent in pulling together the contracts, and you noted that this year different than any other year that I can remember. I think even in my career, this is the most money being put aside for overlays throughout the county and road work that's badly needed. And so again, certainly thank you to you, certainly to our county executive, through the budgetary process, and certainly board members who obviously have supported this. I wanted to compliment you as well, in addition to bringing this, certainly for the force account work done in District 5. I know that a good deal of the work that's done throughout the county is, not just chasing potholes, but doing base repairs, and certainly paving some shorter segments of roads where the occasion warrants it. But I wanted to thank you for the work that was done this season, and you worked again along with some of the still COVID restrictions, and I think some of the supply issues. Got a good deal of work done, and I've driven most of those locations, and as we see the repairs coming to both in the rural and suburban setting, others take note that how come not my street, but I think that's at least they're recognizing that the work is going on. And I wanted to compliment you. I know you've actually visited locations. We talked yesterday about a location where we did some drainage work and an overlay, but we still had problems a week ago Monday with regards to some of the flooding. And but all in all, again, I know our crews, certainly the force account crews, are professional in their work, and they work with their residents when they're out there. And again, it was noted in any number of conversations that I've had from folks and calls in my office. I try to transmit those to you as well, the good work and appreciation for that. So I wanted to thank you for that. And then I just wanted to note that, oddly enough, the contract work that we put out earlier this year, at least in District 5, has been pushed back because of some of the other work that got in front of it, not the county end of it, but maybe with some of the other contracts they had. And I think that's really unfortunate because, again, it was work that we bid out to the private sector, and I trust it'll get done right when it gets done. But the season for paving is closing rapidly here, and I don't know whether we're getting enough break in weather just going to allow us to see some of those areas. Again, where the roads have deteriorated, continue to deteriorate, we've kept them together, awaiting, obviously, the paving contract. So I wanted to ask the question, what assurances do we have in these contracts that's going to make sure that our work doesn't get bumped for work that, whether it's on the freeway system or in some other jurisdiction that, actually, when we're talking about bidding out millions and millions of dollars and they get, delay days if there's rain and inclement weather, what's going to provide the assurance that next season for the work that didn't get done in this year, if it doesn't get done, not because we didn't put it out to bid and we have a contract to have the work done, but secondly, with these, that we're going to make sure that this gets done next season?
So with the projects that are in front of you today, they're basically what we're targeting is having them ready to go in April. So there won't be as much of an issue. I recognize what you're saying and what your concerns are. Most likely they'll be you set the working days so that you restrict the window in which the contractor can work, and then starts liquidated damages. For the projects that we're strategically moving forward in April, my guess is by the time they got to anywhere near this time of year, they would be so far into liquidated damages, we're not going to run that risk. However, the two projects that I mentioned that we're waiting for SACOG to release the funding, so that is definitely a concern of ours. We are, the later that it goes into the year that we get the funding and put these things out to bid, you start to push that window of weather. And so we'll be looking at that, what we can do to make sure that those projects don't go into the winter months. With the projects in front of you today, we will minimize the working days that are allowed so that we make sure we don't hit the window of the winter.
Yeah, because the staff report says that you contemplate all this work being done. I think it says a couple of different reports by October of 2022. Yes. And the work that I was referring to that hasn't yet got done, they pushed the date till next Monday, but with colder nights and rainy weather, it's doubtful. I'm hopeful, but it's doubtful that work's going to get done. And we awarded those bids in July, if I'm not mistaken, right when we came back after the summer break. If it wasn't, it might have been even in June, and contracts obviously don't get executed for several days. But yeah, and that's just unfortunate. So now we have a whole other season of rain and inclement weather, and we've patched, and I think you actually did some base repair in some of those areas, preparing for the work that would be done under contract. And maybe that wasn't an issue elsewhere in the county. Maybe they got to some of those contracts, but for the ones certainly in D5. They're not done yet, and I'm concerned about that. So
and despite trying to take advantage of everything we can to prevent that from happening, we do have 8 projects, several, but still 8 projects left with punch list items. Many times they're the overlay, and it's just trying to get them in before we hit the winter. For those projects that were either built late or we knew would be really difficult to build in one construction season, we run on it. This time of year is always the time that we're pushing contractors to be their highest priority to get these things wrapped up so we don't go into the winter. So we'll definitely make sure that we put.
Well, I think it needs to be clear again, because I don't, as much as the other work's appreciated, whether it's on the freeways or on other city streets or elsewhere in the region. Again, it's important to the folks in the unincorporated areas where we're making these improvements and investments to get it done and not to have months, if not even lose a season or two, and in some cases. And so, again, I compliment you for getting this to us early, in the fall, and I'm confident that people are going to see a lot of dust flying and tractors moving in their neighborhoods and certainly in their business districts next year. But I want to be sure that the county doesn't keep getting their work pushed back because others have bigger contracts or somehow they leverage their emphasis in their contracts. So I just want to be sure that we make sure that we get to the top of the list and get the work done that we promised folks. And put them on good use. But again, thanks to you and your crews, and certainly to the Force account. That's all I had on that. I had a couple other items, but that's all I don't know if anybody else wanted to speak on transportation before we leave this, though.
Would anyone else have any? No one else seems to have any comments.
I'll chime in just really briefly.
Thank you.
I also want to just extend my thanks to you and your team, Ron. I mean, there's a lot of great projects to meet the needs in District 3. Obviously, we still need more, but I really appreciate the work of the board here, also recognizing the need to make a dent in that maintenance backlog. I also want to echo the comments of Supervisor Cerna and Supervisor Natoli. In my conversations with you and your staff about prioritizing roadways in District 3, certainly it would be it'll be helpful in the future to understand where these trenching projects are going to be and how we might want to prioritize things, taking that into consideration, and maybe coming up with some new ideas for how we may be able to get leverage more from the utilities and realize some cost savings by doing things at the same time where they're doing the trenching. So just appreciate your efforts and looking forward to continuing on this path. Thank you.
Thank you. Thank you.
Yeah,
Thank you, Ron. And next up we have, were you?
No, I had a couple other items. I went to that item first. Thank you, Madam Chair. Be brief. Item number 3, please.
Sure. Item 3 is to approve a salary resolution amendment adding 5 limited-term positions in the Office of Budget and Debt Management, Department of Finance, and Office of Homeless Initiatives, and approve an appropriation adjustment request in the amount of $1,648,230 to fund the implementation and administration of American Rescue Plan funded projects.
Thank you, Madam Clerk. I wanted to offer a comment on this, and I talked with Ann in my briefing yesterday that I'm supportive of this. Obviously, this falls on the conversation we had and conversation we're going to have later today, broader discussion about the allocations for the American Rescue Plan Act monies. But I just, again, I know that in the report that we're going to hear later this morning, there's discussion about administrative costs and so forth. I understand these are important. They're going to be important to carrying the workload that obviously is already, we're beginning to feel that. But I think a tracking of certainly the dollars as it relates to administration and what percentage we may allocate in our discussions is not, in my view, is not predetermined by this item. This is, again, would only make up a relatively small percentage of that. And again, it's measured over time. These are limited term positions, and I understand the need. So I support this, but I also wanted to reference it because it comes as a consent item. We're going to have a broader discussion and then more detailed follow-on discussions about how we will choose to allocate those dollars based upon community priorities and all the things that are going to be a part of that mix. But so I intend to support this, but I also intend to keep a kind of close eye on what we're going to allocate for administrative costs as a part of this. And we've already spent money on contract. These will be positions that will be under the county executive's umbrella and her offices. But I wanted to note that, Madam Chair. So again, I'm not pulling off consent. I intend to support it, but I wanted to reference it because I will make some comments later today about administrative costs. So.
Okay, thank you, Supervisor Natoli.
All right, and then I just had one last item, if I could, Madam Chair, and that's item 11.
Item 11, okay. Item 11 is to authorize the execution of a sales and purchase agreement, assignment and assumption of agreement for use of telecommunications tower and grant deed with the Cosumnes Community Services District for the sale of county-owned real property known as the Elk Grove Regional Park, located at 9950 Elk Grove, Florin Road in the city of Elk Grove. The environmental document is exempt.
Okay, thank you. I want to thank first our staff, certainly Ms. Edwards, but Liz Bellis from County Parks and Jeff Gassaway from our General Services, David Villanueva and others from Real Estate and or County Council's office that helped negotiate this. I think this is certainly a good thing from a community standpoint, and the park is an asset that's well over 100 years old in that community, and the county has been the steward of that park for many, many decades, and the improvements there and the assets that relate to community activities are diverse and certainly well utilized. One only needs to go to that park certainly any given weekend, but any day of the week and see the use. And so this makes sense, and I'm pleased that we were able to come to agreement with the Community Services District. But the point I wanted to make beyond thanking our staff is that we realized from this transaction, once it's completed, $4.4 million that comes to the county, and it states in the staff report that it's going to go into the county general fund. And I recognize that general fund dollars over the years, not entirely but largely, went to both capital improvements, but also maintenance of that park through county parks. And then more recently, we had a lease agreement with the Community Services District for the last 15 plus years. The point I want to make, and I would include it as a part of the motion on the consent calendar, assuming there was support for it, is that I'm very interested in seeing the $4.4 million reinvested in parks. We had a lot of conversation during budget this past year about the backlog there, and both in the capital improvement program, but certainly some of the deficiencies and facilities and needs. And again, these are one-time monies to be realized. And my experience, we did this with Mather a few years ago, where the sale of their land, the $3 million, and $2 million went in, well, all of it went in the general fund. This board, by its subsequent action, took $1 million and put it to Mather Veterans Village, but and the rest of it just got blended in with the budget. I think that this is important enough that it was Parks dollars, that it stays in the Parks Department. This board could have a conversation about how that gets reinvested within the Parks framework, and whether it's in the Parkway or out the Mather Conservation Preserve. We have an obligation at this point in time, and we haven't really solved it as a board, to have an endowment for the long-term preservation and restoration of the vernal pools. We've got ranch properties, park properties up and down the Parkway and throughout the county. And I think it's imperative that this board retain those dollars in the Parks Department. We can work with our county executive, with our Parks Director and others, and come back at a subsequent time once the sale is consummated. But I'm frankly not interested in seeing it go back to the general fund and then somehow get part and parceled out. I think it may get lost in that transaction. So I would ask, and certainly, Ann, you can weigh in on this, but that we set aside the dollars when it's received, and we had a subsequent discussion as a board about how we want to reinvest this in parks throughout the county.
Ann, would you like to weigh in?
That is certainly something that you all could decide. Typically, in a situation like this, the money does go to the general fund, and you would decide how to allocate it in the June budget next year. But it is absolutely up to the majority of the board.
I would be supportive of that, but would we need to vote on it today or at a later time?
I'm going to actually turn to Ms. Travis to ask that question.
I believe you can make a motion to that effect today.
Okay. And I would certainly support that as well, Supervisor Natoli. I think that's a very good idea to set that money aside for this purpose.
Okay. All right. So, Madam Chair, when time comes on the consent calendar, I would include that as part, make a motion, or at least have whoever makes the motion to include that. Thanks. That's all I had. Thanks again.
Thank you, Supervisor Natoli. Supervisor Kennedy.
Thank you, Chair. On item number 9, clerk, that's an extremely long title, so I'm going to ask that you not read it.
Yes.
I'm not going to be asking any questions. I just wanted to make a brief comment that, this using a detention basin for parks purposes and for athletic fields and so forth was once outside the box thinking. It's now become a standard in Sacramento County. This is at least the third one in District 2's unincorporated area, plus there's several in the city portion of the district, and it is a fantastic dual use of being able to provide for the community's safety and also health and entertainment. And so I just want to thank staff for making this so routine that it's on a consent item, as long as the title may be. Thank you.
Thank you, Supervisor Kennedy. And at this time, I do not see any other board members in the queue to speak, and so we'll go to public comment, and we'll start with our in-person. This is public comment on consent. We have one public comment in the chambers. I don't know if we have any people on the phone.
At this time, we do not have any public comments for consent matters. We do for off agenda, but not consent.
Okay, great. Okay, so I will call to the podium Ted Samara, please, on agenda item 4.
Good morning, Supervisors.
Good morning.
So I've sent you all, again, via email, some concerns in regards to the hiring of Dr. Sylvester Fidel. I see he's in the audience. It's my understanding that more than likely there's a 99% chance you're all going to appoint him here today. And with that said, the concerns still have not faded away, nor will be forgotten. I challenge this board here to direct your staff to work with my organization. We represent roughly around 3,800 county employees. A lot of those employees that have filed complaints in years past have ran into those potholes we talked about on Fruit Ridge Road, have ran into those parks that were not fixed in regards to trying to get some sort of fair and reasonable resolution to their complaints without being stonewalled by Department of Personnel Services. It's time to make change. And if you five here cannot make that change, then who can? You have an obligation not only to your constituents, but to your employees to provide them safe and non-hostile work environments, to provide them a fair and due process when they go to Department of Personnel Services to be heard, to be taken serious, to have thorough investigations be held. So once again, I challenge you to direct your staff, be it Ms. Edwards or Mr. Villanueva, to work with my organization so we can establish best practices, so that we can revise their processes, so that your employees, my members, could have their day. You owe that to them as an employer, and it should not be lost on you. Right now, I am aware of at least 3 lawsuits from my members that have been filed against this county, and their path that they try to take to get it resolved went through DPS.
You have 15 seconds.
But because they couldn't get no resolution, they had to seek it outside. So do the right thing. You owe it to your employees for all that they've done through this pandemic, through this storm. You mentioned a lot of high-level management, Ms. Frost, but you forgot to mention those workers that were actually out there cleaning those drains. Don't forget about them, because I won't allow you to forget. Thank you.
Thank you.
Thanks, Ted.
And Supervisor Cerna had some comments.
Thank you. So I appreciate Mr. Samara scrutinizing this appointment. I think every appointment needs to be carefully understood, not just by our executive team, but certainly our labor, all of our labor organizations deserve to have the ability to contribute their input. And I don't think it's a heavy lift to have our executive and her team to treat this as a new day in terms of having a fresh start with the new Director of Personnel Services. And I think he makes a very good point that we ought to look at it that way. And there's been, some history of disagreement on various grievances involving different bargaining units. But I would, to his point, in terms of directing staff to really emphasize with this appointment, should it happen, looking at this as a fresh start, I would really encourage Ms. Edwards to do that. And I don't know if others feel the same way, but it's not a point lost on this supervisor. So I appreciate it. Thank you.
Okay, I'm going to,
I don't know if Ann wants to respond first.
I think I'm going to let the county executive chime in, and then we have a couple of other board members who have comments.
Thank you, Chair Frost. I just want to totally concur with what Supervisor Cerna just said, and I have spoken to Mr. Samara, and we are absolutely on board with working with Mr. Samara and his team to look at practices in DPS. Mr. Fadal is very committed to that as well. And it is a new day, and we are also in the process of looking at all of the processes around investigations in DPS. We've hired a consultant to help us with that. That will help Mr. Fadal have a roadmap on how to move forward in concert with labor organizations.
Great.
Thank you, Ann. And thank you, Supervisor Cerna. Supervisor Natoli.
Yeah, thank you, Madam Chair. And certainly I would echo the comments that Supervisor Cerna made, and I appreciate Ann's response. Obviously, she echoed them as well. I would just say, too, that as a part of this consideration, that there been obviously transmittal of certain information has been shared and it's matter of public record. But I think, looking to the days to come, that's important that not only that we look at our internal practices, but that we do our best, certainly on the side of as the employer of records from the County of Sacramento, and our employees, our workforce, value what they do. And I think obviously, Chair Frost, you cited any number of folks that just a few days ago. And there was probably a much larger complement of folks that rose to the occasion, and when emergency arose. But day to day, the work that gets done by the nearly 12,000 county employees is vital to what goes on in this community. It's essential in many ways, and I think how we administer our personnel policies, there may be differences at times, but I think fairness and certainly responsiveness are important, and if at all possible, not avoid the need to litigate, or people feeling the need to litigate. I think that as folks who are part of the same team, so to speak, that we have the opportunity with the leadership and certainly through direction this board gives. But I think Ann and folks that are employed to carry out both the policy framework, but to respond to issues that arise in the workplace or working conditions and or other issues. And so it's very important. And I think that mutual respect and the open lines of communication and the evaluation of our the work that county employees carry out is key to that. And so I hope that and going forward, that that's what we establish from not as we fill positions, but also that we make it really clear, and our actions will be the judge of that, I'm sure. So I trust that we're going to make progress in this realm. But I appreciate Mr. Samara's comments, and I know it's probably shared by others that represent bargaining units here in the county and represent our county employees. So thanks.
Thank you, Supervisor Natoli. I couldn't agree more with both of you, and also. You're right, Mr. Samora. I did leave out some people. I know there were probably so many more, and I also know there were some nonprofits who were working really hard and afterwards are still working hard now to collect blankets and figure out how to get situated with a lot of their local homeless people. So thanks for bringing that up. I appreciate it. Sorry I might have left some people out. And at this time, Supervisor Desmond would like to speak.
Thank you, Madam Chair. I echo some of the sentiments from my colleagues up here, and I also thank you, Mr. Samara, for talking. I couldn't agree more with everything you said. Having come from an organization that really prided itself on very good labor relations at the state level and being involved in it directly, I know how important that is. And like Supervisor Natoli said, there may be times we disagree, but your members and all the employees need to understand how valued and appreciated they are. And our job is to ensure that when it comes to labor relations, every employee is treated with respect, with value, with good communication and fairness. And I think I really appreciate the comments that came in about this item, put us on notice about some of the issues and concerns. And I think I also appreciate the efforts of the county exec to really put a lot more scrutiny on this selection as a result. And I think another result of that will be is we will all be paying very close attention, right? Because of your comments, your concerns that you've brought to us. So I'll be supporting this today, but also support you and your efforts and your sentiments you expressed today. And thank you for that.
Thank you, Supervisor Desmond. At this time, we are ready to call for a vote on consent. We have one change in consent, and that would be on item 11 to authorize the sale proceeds to remain in the parks budget. And so at this time, I'll call for a motion on consent.
So moved.
We have a motion by Supervisor Natoli and a second by Supervisor Kennedy. Please vote.
Unanimous vote.
Okay, and at this time, it gives me great pleasure to introduce Mr. Fadal, our new Director of Personnel Services. And I wonder, Mr. Fadal, if you'd like to make some public comments. Welcome to the county. We're excited to have you here. How do you do?
Thanks. I'm doing great. Good morning, and thank you, Madam Chair and members of the board. I really want to express my appreciation for you ratifying my contract and appointing me as the new Director of Personnel Services. I'm truly excited, and I'm looking forward to joining the county. I want to express my very deep gratitude to Ann Richards and David Villanueva for your trust in me, and for your willingness to bring me on board. And I'm hoping to come in and do the best I can to try and implement some very positive changes here in collaboration with my team. I want to express my strong appreciation for Candice Mabra, who essentially led the recruitment process, working in concert with some of the division directors that took time off on their very busy day to participate in the interview process. I truly have sincere respect for the process that has been followed, and I'm looking forward to getting on board. And last but not the least, I am looking forward to meeting with the union executives and the union leaders. I am hoping to foster a strong relationship that is going to be based on trust, respect, and good faith discussions, and I'll be doing that immediately once I get on board. And I'm hoping to actually bring some of the changes you all have been seeking. So I'm excited. I am looking forward to bringing my almost 29 years experience in the field of human resources to the county of Sacramento. So once again, thank you for giving me this opportunity, and I'll be on board in a few weeks.
Congratulations.
Thank you very much. And I know you are a doctor, PhD, but I'm curious about your title.
I have a doctorate in business administration, a master's, an MPA, a master's in public administration, and a bachelor's degree. But I simply go by Sylvester Fadal.
Okay, you're a humble
No
soul.
one calls me doctor, except in most of the documents here at the county. I lectured for almost 20 years. I stopped lecturing, I believe, in 2018, and I have been fully focused in doing what I do professionally, and that's just finding ways to improve the field of human resources and build collaborations with people who depend on us for change.
Thank you. Well, we're excited to have you. Welcome to Sacramento County, and we'll look forward to working with you.
Thank you, Madam Chair. I appreciate it.
Okay, thank you very much. And at this time, we are ready for our off-agenda public comments, and we have several who are in the chambers, and I'll begin by reading 3 at a time, and if you can begin to approach the podium as your names are called. And first we'll begin with Courtney Hansen, followed by Mark Wilson, followed by Corinne McIntosh Seiko. Good morning, Courtney.
Good morning. It's been a minute. We know each other. Hi, Courtney Hansen with Decarcerate Sacramento, and I'm here to speak with other community members about a COVID-19 outbreak that is currently sweeping through Sacramento jails as of last week, with at least 75 people testing positive. We have reason to believe that these numbers are much, much higher given the dire lack of basic medical attention, under testing. As you know, we are regularly in touch with dozens of people inside both jails. And while the Sheriff's Department reports 0 COVID-related deaths, we know the SACB reported one yesterday from the 25th. We are hearing reports of a separate death of somebody who actually passed inside the jail and was found stiff dead in their cell on the 21st, who was exhibiting COVID-19 symptoms. We know you have limited power, but you do have power. We know the DA has power. They could not be filing charges when public safety is truly not a risk. We know the sheriff has power to not bring people into the jail. And we are asking you today, the board, as well as anybody else listening who has the ability to pull on these levers like we did last summer when we lowered the population by 30%. I want to use the rest of my time to read a statement from Jasmine Stevens, whose husband, William Francis Stevens, of 16 years, passed in the jail on February 16th. On a phone call before his death, he told her he had asked for basic medical attention, including information about his own condition, over 10 times in the jail with no response. On February 16th, my husband, William Francis Stevens, died in the Sacramento County Jail. The coroner is trying to say that my husband died from complications to his heart, which I feel is a complete lie. He died from COVID-19, which gave him complications with his heart. I know for a fact that my husband tested positive and he was not having his medical conditions met in that horrible place. The story begins with the guards putting an inmate in the room with my husband who had tested positive for COVID. To my understanding, these people were supposed to be kept separated. They did this deliberately. I don't know why, but I think it's disgusting to knowingly put someone's health at risk, and it is a complete violation of all human decency. And my husband wasn't the only one. That place was infested with an outbreak of COVID-19, and it's unconscionable how these people try to cover it up. I am asking you today to shine a light. And I just ask again that you get creative, because if you were talking to this woman reminiscing about her husband of 16 years or helping her clean out his garage and belongings, you would try to get creative about raising your voices about what's going on in that building right there. Thank you.
Thank you. Supervisor Kennedy, did you have comments?
Real briefly, as this is not agendized, I will make them very, very brief, but I was going to bring this up at the end of the meeting, but I'll take the opportunity now. I would like to publicly ask for the Inspector General to once again look at this specific issue at the jail when it comes to COVID-19. I'd like to know specifically what the procedures for intake are, what the separation procedures are when an inmate is determined to test positive, what the tracing activities take place when that happens, and what the policy is for reporting deaths and COVID-related and other health-related data at the jail when it comes to inmates.
I would like to add to that, what is the protocol for early treatment? Because there are treatments that can eliminate hospitalizations and deaths. And what are we doing with early treatment to all parties? Supervisor Cerna.
Thank you.
By just so we're clear on what that, so by early treatments, are you talking about vaccines?
No, I'm talking about there are medications that treat COVID-19 and other viruses. There are treatments that can reduce hospitalizations and save lives. I'm wondering what our protocol is for treating people who are diagnosed with COVID-19, whether they've had a vaccine or not. A vaccine doesn't necessarily keep you from getting COVID-19. We know that now.
Thank you. Thank you for the clarification.
Supervisor Cerna.
Thank you. I just want to make sure, and I see our Director of Health Services is here, as well as Bruce Wagstaff, that when we receive the COVID-19 update later today, that this will be addressed in great detail. And I'm seeing nodding heads. Great. Thank you.
I'm sorry. I was having trouble hearing. I'm sorry. Can you repeat that quickly?
I think it's a plexiglass, but
I don't think it's. I think it's my 65-year-old ears. But if you don't mind.
Yeah. So I just was asking I was confirming that we're going to have some detailed information about the subject that the Decarcerate Sacramento representative has brought to the attention of the board today as an off-agenda item. Just want to make sure that it's going to be addressed thoroughly when we receive the COVID-19 update later today.
Oh, thank you. Thank you, Supervisor Cerna.
Madam Chair, so that's in reference to the potential second death? Is it Phil?
All deaths.
Yeah, all deaths. I know, but we had the one that was basically reported yesterday, but Courtney's comments alluded to potentially a second one.
Yeah, and I've actually had a conversation with our county executive, because I have been, it's not the first time I've heard that. I heard that as recently as last week. So. Okay, no, but that's what you're asking for information-wise, because I concur with that. That's why I wanted to know.
Okay, thank you. And our next public comment is from Mark Wilson, please. followed by Corinne McIntosh Seiko.
Oh, that might be Matt.
Oh, Mac, I'm sorry. Sorry.
Mackenzie.
I apologize.
I didn't know. Perfect.
Good morning, Board. It's been a while.
Yes, it is.
Whew, my name is Mackenzie Wilson, and I am an organizer with the Incarcerated Sacramento. We come today to shine light on a few horrifying truths. COVID-19 is sweeping through our jail. We know of at least 75 people who have tested positive, and we say at least because with the sheriff's track record, we know his lies run rampant, and we know from inside reports and the culture of law enforcement inside, folks are being under-tested and deprived of basic cleaning supplies and medical care. When 82% of the population in our jails is pretrial and legally innocent, a death sentence is beyond inhumane. To hear that the jail has made its way up to an average of 3,700 people a night after this county and advocates worked so hard to reduce the population by a third of its population is horrific. It also highlights the sham that is the probation's pretrial program. We give millions of dollars to probation, and we spend hundreds of millions of dollars housing folks against their will inside of this jail. I dare you to dream with me what it would look like to spend $300 million on affordable housing, on parks, after-school programs, community gardens, just to make sure that our neighbors aren't hungry. That's a later conversation that we hope to have with you, so now is simple. We ask that you use your platform and your power to support the immediate release of folks inside of the jail. We ask that you tell the district attorney to stop the spread and save lives by choosing not to file charges. We hope that you will tell the Sheriff's Department to stop the spread and order those emergency releases. We hope that you're going to tell that May's Plaintiff Council and County Council to file for those releases as well, and to tell the Sacramento Superior Court and the presiding judge to approve such measures. We ask that you use your platform and your power to shine a light on this very urgent and life-threatening crisis, which is affecting thousands of incarcerated constituents and their families. And just by ripple effects, that's thousands and thousands of our community members that are being affected by this. And you have a power to do something.
You have 10 seconds.
That's it, actually. That was all I was
you're
really gonna say.
good.
So, yeah, I hope y'all do that. Thank you very much, and have a great day.
Thank you.
See you next time.
Corinne McIntosh Seiko. Followed by Caitlin Esparza.
Good morning, Supervisors. I'm usually staring at you through my laptop and calling in, so it's a pleasure to be in person with you all. My name is Dr. Corinne McIntosh Sacco. I'm a licensed clinical psychologist in independent practice, and I'm also a community mental health advocate. Let's talk about the public health epidemic that is the Sacramento County jail system, operated under the Sheriff's Department. They fail to provide constitutionally required mental health and medical care to people in jail. They employ harsh and extreme forms of solitary confinement. They fail to implement essential suicide prevention measures, and they discriminate against people with disabilities. All this is well documented, as you know, in the May's consent decree, on which this board will be having a closed session with legal counsel this afternoon. According to the most recent monitoring report, the county continues to be out of compliance in many of the major areas of concern. So, of course, there's another COVID outbreak between the two jail facilities. I want to ask each of you, how much more inhumane treatment, human rights violations, and physical and psychological distress are you willing to condone on your watch? We lock up people with mental health problems when we should really be treating them in the community, their community. Many individuals who are incarcerated have pre-existing mental health issues. In fact, according to the most recent data from the sheriff, 89% of the total jail population are individuals with mental health conditions that are pretrial. Pretrial means they're awaiting trial and still legally innocent. It's not appropriate, and it goes against the consent decree to leave individuals in jail with a mental illness waiting years to receive appropriate services in an appropriate setting. While these people remain caged, their loved ones suffer negative effects on their physical and mental health. Lost my place, sorry. Like higher rates of heart attacks, strokes, asthma, and high cholesterol. Having a loved one incarcerated increases a person's chance of experiencing homelessness and even raises one's likelihood to experience alcohol and drug dependency. So any impacts that the criminal punishment system has on our neighbors, it has on us as well, because this death-making institution negatively impacts our overall community health. You, board, have more power than you seem to believe. You have the power to insist on how the consent decree is met. We should be providing easy access to varied, culturally appropriate, community-based services as needed. The cost of providing community housing for people and providing them with mental health services is actually lower than cycling them through the jails. The May's consent decree calls for ongoing treatment of people in jail with mental illness in the least restrictive setting. You must look at an additional release plan for detainees with mental health concerns who can be placed in a living space in the community. The county can establish a contract for placement for those individuals whose needs exceed the services that can be provided at the jail with inpatient care in the community. If you're serious in your resolution to declare racism a public health crisis, if you're serious in your intent to meet the consent decree requirements you agreed to at the time of settlement,
you have 10 seconds.
You will use your power and platform to shine a light on this urgent and life-threatening crisis which is affecting Sacramento County residents. Thank you.
Thank you. Caitlin Esparza, followed by Nikki Coop. Hope I can read that right.
Yeah, Caitlin had to go to work.
Okay, Nikki. Followed by Mackenzie. Mackenzie, did you
It's okay, no, thank you.
do 2 cards?
Yeah, I just didn't know that somebody did it for me. So
All right, okay, got it.
Oh, sweet.
Hello.
Yeah, hi. We're back here, and we were really, obviously, it's been a long time, trying to talk with y'all, trying to express the urgency of the ongoing crisis that is the jail for a long time now. In meetings, in phone calls, in campaigns that involve the community. And we're so sad and disappointed that we are here over a year and a half into this pandemic, and that these kind of outbreaks, they were not inevitable, but we did know about the risk. We've known about the risk. We've known about the risk so much that the court took emergency action last year and released a third of the population. The courts went to 0 bail. It was an emergency last year. What's the difference right now? Is there a difference in the death rates? Oh yeah, there is. They're higher. Is there a difference in the emergency? Yeah, we've forgotten about it behind the jail, because that's what a jail is for. It's to hide our social problems. It's to put them away in a box and to pretend like those people's lives don't matter. We are here to tell you they matter, they deserve to be out. All planning around the May's consent decree should be around how you are getting people out of that jail. And instead, you are looking and you are trying to build more space to cage more family members, and it is disgusting. We need our loved ones out of the cages that are threatening to kill them, okay? Sometimes it's just that the cages are torture. But right now, it's that the cages are a death sentence, and you over there, County Council, all very important. You have a responsibility and an opportunity to save people's lives. We expect you to do just that. Nothing less is appropriate. You all already have blood on your hands because it has been a year and a half. And my final thought is that the sheriff and the County Correctional Health Department will lie through their teeth to tell you they are doing everything they can. And we are here to tell you that they are not, and that you need to step in, and that we need to find strategies for real accountability for those people. Santi Damiano, for Scott Jones. Without real accountability for those people, our folks inside will continue to face death while they're awaiting trial.
Thank you. J.L. Barnes? I'm sorry if I mispronounced that. Good morning.
Hi, Jim.
Hello.
Hi, Jim.
I just wanted to discuss the much needed information surrounding COVID-19 and our friends and family on the inside. Now, we all know the severity of COVID-19 for those of us on the outside, so imagine how serious it is for our loved ones on the inside, pretrial or sentenced. The conditions are horrific. I mean, despite what we are being told, there is no real plan to keep these folks safe. And let's remember that at the end of the day, there are jail staff coming in and out of the jail, bringing the virus to their families, to random people they encounter, etc. So if it wasn't your concern before, it should be now. I have advocated for people most of my life. Since my husband was arrested May 17th, 2019, I found myself in a different advocacy work. He has been in the Sac County Jail for 2.5 years. He hasn't been to court since Halloween 2019. It's not that he hasn't had a court date, but he's had tons of those. But once the time approaches, they change the date. My husband went into the facility with perfect health, but now has asthma, which he has put in dozens of kites in order to use his asthma pump. He's now contracted COVID not once, but twice. And contrary to what we've been told, he's actually vaccinated and is still sick due to his breathing problems and lack of care. Despite the fact that he has been there so long, he was housed in the intake pod where people are coming in and out of. He had to almost beg to be tested, and when he finally was in fact, he was tested positive and was moved to 8 East, which I later found out is solitary confinement. He stayed there over 24 hours, and from there he was moved to 4 East, where they are now housing people with COVID. When he arrived, he asked the officer for a mattress, and he was told no because they didn't want him to contaminate any more beds. They are very often without cleaning products and have to reuse their mask. This pod is a place where jail staff doesn't make it there often, so it's scary to think what could happen to him or any of our loved ones in there. Our 5-year-old son said to me just recently, "I hope my dad doesn't die in there." When I was 5 years old, the most thing I had to worry about was, did I want syrup on my pancakes? My husband is not the only person going through this turmoil, and it pains me to know that. I have been in contact with dozens of people on the inside and their families, and they are all scared that it just might be a death sentence for their loved ones. I mean, just last night there was a report saying that a 76-year-old gentleman died of COVID, but failed to mention the person who died around 1 a.m. on the 21st. From my conversation with people in the jail, this person really was sick and was found dead in his cell by pod workers. Devastating, right? Yet we are not hearing the raw and uncut version of what is really happening in the jail. I'm asking that you all take what myself and the rest of the Decarcerate team has said today and help us in this fight to keep these people safe. Thank you.
Thank you. Okay, at this time we have some calls on the phone. Phone calls.
Hi, please transfer the first caller. Hi, caller. Please start with your comments. You have 2 minutes.
Hi, my name is Sarah Dudley. I live in the Spyglass neighborhood on Sand Dollar Way. I'm directing my comments. I'm in the 3rd Supervisorial District. I'm directing my comments to Supervisor Rich Desmond. Supervisor Desmond, I'm a constituent of yours. I sent you an email on the 15th, and again following up on around the 20th, and again following up 2 days ago to draw your attention to a problem that the neighbors and I are having regarding a construction project by AT&T. The email that we sent you and the follow-ups contain details about our problem. We did meet with your staff 2 weeks ago that unfortunately our issues were not addressed or resolved, and we're trying to get in touch with you so we can schedule an in-person meeting. And that's why I've come to this meeting, because I haven't heard from you in response to my emails.
Thank
and that's
you.
my comment.
Thank you. I recommend that you, one more time, email Supervisor Desmond, and I'm sure he will. Do you have a comment, Supervisor Desmond?
Yeah, thank you,
I know
Madam
we
Chair.
can't respond on
Right, we
off agenda,
are
but
aware of this, and my staff is actually reaching out to Ms. Dudley to schedule a meeting in my office. So thank you.
thank you.
All right. Thank you very much, Supervisor.
Okay, please send the next caller. Hi, caller. Please start with your comments. You have 2 minutes.
Hi, my name is Sue Rooney. I'm fifth generation Sacramento, same as you, Mr. Desmond, as well as part of the Spyglass neighborhood located on Sand Dollar Way. And I want to let you know I'm appalled and frustrated at the amount of noise, dust, air pollution, not to mention dirty water coming from my pipes for the past 5 months due to P31 construction working for AT&T. Our streets and sidewalks have been repeatedly torn up and patched, torn up and patched, torn up and patched. It currently looks like a war zone here. Most recently, we had our water shut off for 4 hours due to the workers not knowing what they're doing from P31. And our water pipe was broke in this neighborhood. Before that, we've had to endure internet disruption, which is really, really difficult when you're trying to teach from home. Our neighbors have had trucks parked in front of their driveway. I have as well. We've had to numerous times tell them to move their trucks so we could get in and out of our driveways. Our main purpose for calling is that we would like Mr. Desmond to come out and even look at this neighborhood. It looks horrible. If our streets, we were told our streets would only be patched if where they have dug. We are looking at having our entire neighborhood redone. We want it repaved. We want our sidewalks back to where we can walk without
You have 15
stumbling
seconds.
over. And we would really, really like A&T to pay for this. We need the county to put on pressure to get our streets repaved. We will have our water tested. If there are any harmful chemicals in it, I will be contacting Rich Desmond again. Again, this is Sue Rooney, fifth generation, appalled at the lack of oversight.
Can you please wrap up
that
your comments?
AT&T has had for P31. Thank you. Goodbye.
Thank you.
Please send the next caller. Hi, caller. Please start with your comments. You have 2 minutes.
Hi, thanks very much. I just want to say that I am horrified to see the continuation of medical neglect, the sustained endangering of public health, and the inhumane treatment of our loved ones inside Sac County jails. I know this has been happening, I know firsthand. Back in March of this year, my loved one, who was incarcerated at the RCCC branch of Sac County Jail, recounted daily to me the great suffering that they and others endured due to the sheriff's medical negligence. The sheriff's staff actually put incarcerated people who were known to be positive for COVID into my loved one's pod at the RCCC. This caused my loved one and their entire pod to become infected and ill with COVID. Back then, I attended a PHAB meeting, and only lies were told about the COVID situation in the jails. The health director, Dr. Sandy Damiano, stated that most people inside who were infected didn't even know it. That was a complete lie. I got calls every single day, and I know that people, including my loved one, were very ill and even begging for Tylenol and treatment, but they were not given any. So the misinformation spewed about the situation, it was just so disgusting, and it was really inhumane what was happening. I'm horrified that now, 7 months later, my loved one is still suffering from the effects of COVID that they contracted in the Sac County jails. And even worse is that the sheriff's lies are still being spewed. Nothing whatsoever has changed. In fact, things are much worse now. There's this other outbreak in Sac County jails with 75 people being testing positive so far. And it's now come out that people are dying of COVID in the jails. And as you heard from the other speakers, this is not just one case. This is being covered up, just like the outbreak back in March was covered up. And what I want to know is, how can you allow this to continue? I know that the Board of Supervisors has limited control over the jails, but I'm imploring you to do something. This is a public health crisis, and we need all hands on deck. The
You have
Sheriff's
10
Department,
seconds.
I call upon you to make the following, to help the following things become a reality. The district attorney needs to stop the spread and save lives by choosing not to file charges in cases where there's not an immediate and identifiable public safety threat. The Sheriff's Department has to stop the spread and save lives by ordering emergency releases, as he did back in June of 2020. The Board of Supervisors needs to use their power and
Can
platform
you
to
please
shine
wrap
light
up your
on this.
comments?
I'm almost done. Thank you very much. To shine light on this urgent and life-threatening crisis, which is affecting thousands of incarcerated constituents and their families, the Mays Plaintiff Council and or County Council should file for releases, and the Sac Superior Court, via the presiding judge, should approve these measures. And the media needs to do its job and rigorously investigate, rather than regurgitating talking points from the public officials as fact. I beg you, I implore you, please do what you can and do everything you can. This is a
Can you
public
please
health
wrap
crisis.
up your comments?
I'm done. Thank you
Thank
very
you.
much.
Please send the next caller. Hi, caller. Please start with your comments. You have 2 minutes.
Good morning, Chair Frost and Supervisors. My name is Nazanin Arab, and I am working for Greater Sacramento Pediatrics. We take care of we serve a lot of medical patients. We've done that since 1986. Ever since Geographic Managed Care, HealthNet has been one of the IPAs that we have worked with, and they're very informative. They actually, we get a lot of classes and a lot of teachings from them, and we apply to all of our IPAs with medical patients. And HealthNet understands the path to wellness very well. Their HEDIS program is one of the most complete, and it is to improve the health of community. HealthNet has been a great partner with us, and I think the community is going to suffer with them not being around. And lastly, they have 2,500 employees in the North California, and I know that they're very committed to this community. I know with them being there, the other insurances as well, they work better because of the competition they have with HealthNet. I really appreciate your time, and thank you again for letting me talk on behalf of HealthNet Insurance for medicals. Thank you. Have a great day.
Thank you.
Thank you. Bye-bye.
Bye-bye.
Okay, please send the final caller. Hi, caller. Please start with your comments. You have 2 minutes.
Members of the board, Rosario Cortez Capeller, a Sand Dollar Way homeowner. Our Spyglass neighborhood community just wanted to thank you for this opportunity to speak to you. We were just following up on a request to Supervisor Desmond to consider touring and surveying some of the damage that AT&T's subcontractor, P31, has done to our sidewalks and street. The daily traffic, noise, and dust has truly altered our peaceful existence here. It's been since July, And we've had countless signs saying, oh, it'll only be till the end of July. And obviously now we're looking down the face of a turkey. So just really, really looking for your leadership, and just thank you so much again for your time.
Thank you.
Okay, that concludes your public comments for off agenda.
Thank you. We'll move to the next item, please.
Okay, item 34 is a presentation of resolution recognizing Sacramento County's fentanyl epidemic and response efforts.
Ken. You'll do good.
Thank you, Madam Chair. It's my first time doing a presentation here, so I'm not sure exactly where to be. But so earlier this
You have
summer,
2 minutes.
It'll be shorter than that. Earlier this summer, we heard from District Attorney Anne Marie Schubert about the fentanyl epidemic in Sacramento County. In my prior service in the Highway Patrol, I saw firsthand the impacts of opioid addiction and overdoses, and I know this is an issue that's very important to several of my colleagues on the board here. In Sacramento County alone, in a 1.5-year period, we saw 140 deaths caused by fentanyl poisoning, not to mention numerous near deaths that go unrecorded in our current statistics. This is on top of thousands of opioid and methamphetamine overdoses in the state of California. And so based on that, District Attorney Schubert has now collaborated with our Department of Health Services, and our health officer, Siobhan Katari, is here and is collaborating with the DA's office for public service announcements to educate the public about the dangers of fentanyl and how so many counterfeit pills include fentanyl, which are deadly to people who don't realize what they're ingesting. And so here today to talk a little bit about, just briefly, about the public service announcements and efforts to get more naloxone out into the community is Tin Ho from the Sacramento County DA's office.
Thank you. Thank you, Supervisor Desmond, and welcome, Tin Ho. Good to see you.
Thank you so much. 175. There have been 175 fentanyl-related deaths in the last 1.5 years in Sacramento County. That's more than all the gun-related homicides that have occurred in the county during that period of time. 98% of the drugs that have been seized off the streets are counterfeit drugs. The crime lab has analyzed those drugs and found that 98% of those counterfeit drugs contain fentanyl. All it takes is a few grams to kill every single person in this room. Just a few grams of fentanyl. One pill can kill. So we would like, on behalf of the District Attorney's Office, thank Supervisor Rich Desmond and the rest of the entire Board of Supervisors for passing this resolution, recognizing that fentanyl-related deaths is an epidemic and a crisis that is sweeping across not only our city, our county, our state, and our nation. As a result of that, in partnering with County Executive Ann Edwards, Department of Health Services, community-based organizations, and different partners in the community, we will be engaging in a wide-ranging public service campaign to educate public, to educate families about this epidemic. This weekend on Saturday, there will be the first ever Sacramento Fentanyl Safety Fair at the Capitol starting from 11 to 2 a.m. We will have not only service providers, but also mental health and drug services that will be doing and conducting fentanyl and Narcan demonstrations and handing out kits, because one pill can kill. And thank you so much on behalf of the District Attorney's Office and all the partners that we have worked with in order to try to prevent another death from the fentanyl crisis. Thank you.
Thank you, Tin. Is there a website where people can go if we wanted to promote that on our websites as county supervisors?
Yes, I will go ahead, our office will go ahead and send out the information and the flyer to each of your staff so it can be sent out.
Thank you.
Thank you so much.
Before you, please proceed, and then we have a supervisor who'd like to also speak, but you could maybe finish
I'm done. Thank you.
Okay, would you like to speak?
Thank you.
Supervisor Cerna.
Thank you. So first of all, great job, Mr. Desmond, on your first presentation. I think you actually put me to shame in terms of your ability to articulate well the intent of the resolution. I'm really glad you've taken this on as an important subject, not just for your district, but for the entire county. And I appreciate, too, the district attorney's office and their activism on making sure that the community is very well educated on the dangers of fentanyl. I would just offer a few invitations or suggestions as well. I think many of you know that my crusade in recent years has really been focused on methamphetamine, but I certainly have not avoided looking at how this county can do a better job enhancing, especially medically assisted treatment for opioid addiction. And to that end, I would encourage, if you haven't already, Supervisor Desmond, I would encourage you to take a look at what types of MAT programs we have locally that are centered around buprenorphine as a very effective way to interrupt the cycle of addiction when it comes to opioids. I've taken the time to do that in my own district, actually spending time in some of the clinics that offer buprenorphine as a very effective means to address a very compelling addiction that we're all very well aware of, but certainly with the advent of fentanyl, it's become even, I think, much more important. In terms of the Narcan, and I know that that's going to be kind of a centerpiece for the Capitol rally that you've mentioned, I would like to suggest, if we aren't already doing this, and this is really directed towards our county executive, is that we ought to look, again, if we're not doing it already, but we ought to look at making sure that our personnel here in the County Administration Center, as well as Branch Center and some of our other county facilities, if they're not trained and have access and currently have a stock of Narcan, that they be trained, that the Narcan be made available, so that we can, as county public servants, have the ability to respond in an emergent way should we encounter people that are involved with a possible life-threatening overdose situation. So I think that's a really important way to be prepared. And again, I just want to thank again Supervisor Desmond for being very attentive to this subject, and to the DA's office for your attention as well. Thank you.
Thank you. And Supervisor Desmond, I think we interrupted your presentation, so please proceed.
No, you didn't. I just want to thank all of you also for supporting the resolution, and thank you, Supervisor Cerna. I'm certainly mindful of your leadership in this area and calling attention to the ravages of our methamphetamine crisis and opioid crisis, and want to join you in those efforts any way I can. So thank you for those comments, and I will be out there on Saturday at the event, and I hope to see some of you out there as well. And with that, I will just present this to Tian Ho. Thank you.
Thank you very much.
Thank you, Tin, for your leadership, and this is extremely important for Sacramento. I personally have people in my district who have, it's not only the young, beautiful people who have taken that one pill who passed away, but it's the families who, over time, can't make sense of it. It's like unbelievable. Just they took it because they had pain, and someone gave them a pill, and that they died. And that's how dangerous fentanyl is. So it's touched all of us, and we really appreciate your leadership in helping fight this battle over fentanyl.
Thank you so much. Have a great day.
Thank you. And thank you, Supervisor Desmond, for your leadership. Okay, at this time, we're going to move to our next item, please.
And I do want to note that we did not have any callers for that item as well.
Thank you.
Mm-hmm. The one caller that did slip in for off agenda, they ended up hanging up, but staff waited with them to see if they were going to try and make a comment. They haven't called back.
Okay.
Okay. So we're on to item 35. This is the 2020 Sacramento County Crop and Livestock Report and Detector Dog Team Program Presentation.
Good morning.
Morning, Chris.
Morning.
Good morning.
Chair Frost, supervisors. My name is Chris Flores. I'm your Agricultural Commissioner and Sealer of Weights and Measures. And I want to thank you for allowing me to present to you today the 2020 Sacramento County Crop and Livestock Report. So each year, counties across the state, pursuant to Section 2279 of the Food and Ag Code, collect crop report statistics from our local growers and our agricultural businesses. And we collect that data and we present it to our boards of supervisors. We send it to the Secretary of Agriculture at the California Department of Food and Ag. And then we also send it to the National Ag Statistics Service at the federal level. I'd like to take this moment to publicly thank the ag producers and our growers locally here that provide this data, because without that data, this report would not be possible. And I also want to thank my staff, especially Laura McCready, who's sitting back here in the red shirt, who collects all that data and collates it. And it's a heavy lift, and she does a really nice job with it. So I thank her. And I want to thank my other staff, Parminder Mali and Kevin Martin, for their help with this report as well, and Brianne Matsura, who's not here today. In addition to the crop statistics and programmatic information included in the report, this year I decided to embed it in a 2022 calendar. All of the photos in the calendar are taken of Sacramento County Ag by Ag Department staff, and then they were digitally filtered to create beautiful artwork. And I wanted, 2020 was a challenging year for all, and I wanted to create something beautiful in a 2022 calendar that would remind us, every day, every month, that this county is beautiful and we have a lot to be grateful for. Okay, this one? Sorry. It's been a year since I've been here, sorry. Thank you. Okay, thank you. Okay, so looking back on 2020, it was fraught with challenges for all of us. And if it taught us anything, it taught us that the ag producers and the ag industry is resilient. And it also taught us that the ag workers were essential. As stay-at-home orders went into effect and schools and restaurants closed, our ag producers continued to grow the hundreds of commodities that they produce amidst the challenges that they faced. And they faced a lot. They had labor shortages, they had transportation issues, they had supply shortages, market fluctuations that they were not used to, and they continued to be resilient. Our 2020 ag gross production value for ag was $454,759,000. That was only 1.2% less than the 2019 value, and a lot of the counties across the state had shortages, and so they did really well. The percentages shown on the screen actually show the gross production value of those crops compared to the total value. So fruit and nut crops, the value is 44.6 of the total value. Field crops were 15.9% of the total value for Sacramento County. So every year we like to go over the top 10 commodities in the county. In 2020, once again, wine grapes were our #1 highest valued crop at close to $156 million. They remain #1, although they did take a drastic hit of $19 million, which was about an 11% decrease in value. Our second highest valued crop was market milk. They came in at $64 million, which was an increase of 25%. And this was mainly due to increased production and higher prices for dairy farmers. Poultry stepped up a spot into the third slot at $38 million. They were up 8% in their gross production value.
Those guys aren't feeling safe right now, I'll tell you that.
Correct. They're hiding. Nursery products slipped a spot, and they came in fourth at $27 million. They were down 22%. Pears increased in value, up 7% to $26 million. Alfalfa hay was in the sixth spot at $16.7 million. We have aquaculture in our county, and they came in at seventh place at $15.5 million. Rice increased in value, up to $14.9 million. Cattle and calves came in ninth place at $13.4 million. And then we had silage corn actually replace field corn for the 10th spot this year. They increased their value by 28%, and they came in at $10.6 million. So overall, field crop value was $72 million, a 6% increase over 2019 values. The highest valued field crops include alfalfa hay, rice, silage corn, and wheat. As mentioned on the previous slide, the value of rice increased by 15%. This was due to an increase in harvested acreage, total yield, and the price per ton. And all field and crop statistics can be found on page 6 of the report. Our fruit and nut and vegetable crops came in at $202.9 million. Crops that experienced an increase included cherries, almonds, pears, and walnuts. Our cherries increased by over 69% over the 2019 value, and this was mainly due to a really mild spring, and they didn't have the heavy rains in 2020. In 2020, the overall vegetable crop value was $18 million, which was a 10% decrease from 2019 values. However, processing tomatoes did not contribute to this decline. They actually saw an increase in value by 28% to $6.7 million. And once again, processing tomatoes are the county's highest valued vegetable crop. And all of these stats can be found on page 7.
Were the increase in crop values increased, was that increased cost or increased volume or both?
The increases in value typically come from, a lot of time it's increase in prices, market fluctuations, or a harvest value as well.
But at this, can we assume at the same time that the volume was the same or increased, or not necessarily?
Not necessarily.
Okay,
Yeah.
thank you.
Yeah. In the livestock and poultry category, as I mentioned, market milk value increased, and this was mainly due to the higher prices for dairy products. There were approximately 16,000 dairy cows on 16 family-owned dairies in Sacramento County.
Just a question. So we're down to only 16 dairies? I thought we had a few more than that. Is that what we?
We're down to about 16. Yeah.
That's it.
Yeah. I think we had 23 a couple of years ago.
That's what I say. So we've lost about a third of the dairies just in a fairly short amount of time.
Yep, we have. Cattle and calves decreased by 16%. Poultry values increased, as I had mentioned. And the livestock and poultry stats can be found on page 8.
Why did we lose them? Was that the water issue, or just people moving out of California because of the cost to do business?
Yeah, a lot of it has to do with increased regulations that they have to.
Greenhouse gas emissions.
Yeah, I mean, there's a lot. Every year
seriously.
there's more and more water issues, and yeah.
Well, and what you're seeing also, obviously, is migration to higher value crops. Your certainly your vines, but your trees, and you can look at some of what the dairies were formerly, and now find walnut trees or almond orchards.
And diversifying their,
converting it. I mean, the irrigated acreage supported the dairy cows and dairies, and now they've got trees. And again, I haven't seen too many vines on the dairies, but certainly in the trees. Do you have a stat in here that shows the acreage? I know that pistachios and pecans now are showing up in the county, and I don't know we even recorded pecans in the past. Maybe been a few very small plots, but
Yeah, so we don't put them specifically in the report because there's so few, that this information is confidential, so it falls under miscellaneous, but eventually we're going to see it come up. Yep.
Where are our hydroponic crops?
They go under miscellaneous.
What geographic location do you find them?
I believe there's...
Rio Linda?
Laura, do you know?
Alberta?
Yeah, they're really small, so...
Okay.
Yeah. We don't have a lot. The apiary value actually increased in 2020 up to $752,000, and that was mostly because of pollination services and the increase for that service. And that's due to increased nut trees being planted, et cetera.
Chris, can I just ask you a question on that? Because I know that there was quite a bit written and reported, and probably still is a good deal of tracking with the collapse of the hives, and certainly the shortfall in having the pollination services, the having hives.
Mm-hmm.
And has there been some reversals on that? And I know they were looking at combination of technical factors, including pesticides, but climate related and so forth. So has that been that issue been arrested, or is it still prevalent? And what are you hearing from the folks that have our?
Yeah, I think hive health is still an issue. Yeah. What we're doing at the department is being really proactive about trying to get beekeepers to register their hives with us. And then we put them onto a database, and people that are spraying pesticides, applying pesticides, we call it Beware. It's an application. And they can go on and look and do a bee check and find out if there's a hive within a mile of their application site. And if there is, and that beekeeper wants to be notified, then the applicator is required to notify that beekeeper or change the product that they are going to spray. And so we're trying to be very proactive about at least limiting the pesticides, influence on beehives. We are also ramping up our apiary program. It's called Bee Safe. And so we have employees who are being trained on hive health and checking bees for health. And so we'll be seeing that more in the future as well. So
what's the utilization on your registry? Is that you just started that, or are you finding pretty good participation, or what?
It's been in state law for many, many years, but we've really ramped up the notice and reaching out to our local beekeeper association as well as the state beekeeper association. And so we're trying to let people know that they need to register their hives, and it's really increased drastically. So that is also part of this number, is that we had more hives registered, and so we were able to reach out to those folks and ask them about their value. So.
Is that information not so much proprietary? You talked about some of the limitations with the report in order to protect some confidentiality as it relates to physical locations, but with hives, and I know there's been some reports of theft of hives, and if that's just an open website, then those who want to use it to notify the beekeeper that could also be used for other purposes. So is that something that through your offices, your department, that there's coordination, so it's not just open access to where hives are being placed and or stored?
Correct. So even the applicators who do the bee check and they look to see if there's a hive nearby, they're not given the location of that hive. So it's very confidential information. Yeah. It gives them that mile radius, and that's it.
Okay,
so
great.
Yeah, we keep it confidential.
That's great.
Okay. The aquaculture value was $15.5 million. And the aquaculture industry in Sacramento County, they produce bass, catfish, crayfish, caviar, and sturgeon. And so it's quite an industry here. Our nursery value decreased by 22%, as mentioned, to $27 million. And our nursery stock numbers include ornamental trees and plants, turf, and Christmas trees. So those folks report to us. And then our seed crops, they actually dropped by 50% in value, but they also dropped 50% by harvested acreage. So I think there was a commonality there. Crops grown for seed in the county include collards, cucumber, oats, onion, pumpkin, squash, Sudan, sunflowers, and watermelon. So those are all seed crops grown here. So as you can see, Sacramento County has a varied and robust ag industry. When we think of Sacramento, a lot of times we think of the urban areas. And yet 40% of the land mass is covered in farmland. One of our most important programs in regards to protecting our crops is the pest detection program. Every year we hire 20 to 25 seasonal aides to deploy and service 12 different types of traps. These traps are designed to trap specific non-native invasive pests before they become established in our county. In 2020, our staff deployed 9,825 traps and serviced them 83,884 times. One of these traps is the Japanese beetle trap. It's a green cone-like vessel with a food and pheromone lure. In 2020, Japanese beetles were discovered in Arden Arcade and in Rancho Cordova. Our staff collaborated with the California Department of Food and Agriculture to place an additional 470 traps in a 49 square mile area, and we captured a total of 93 adult beetles. So due to these finds, we are conducting an eradication program in collaboration with the state. And that program will most likely continue for 3 to 5 years until we do not find any beetles for a couple of years.
Is there a new fruit fly in California?
Yes, yes. And so we recently discovered a few oriental fruit flies, and then we also discovered a guava fruit fly recently. And so we do these delimitations around any kind of find that we discover to make sure that it's not established in that area or that we don't have any others.
It's like looking for a needle in a haystack.
But we find them.
That's good.
So pest exclusion is another program that we conduct to prevent pests from becoming established. Our ag inspectors check marked packages at shipping facilities of produce and plant material looking for pests and diseases. In 2020, our ag inspectors found 122 pests and inspected over 4,400 packages in Sacramento County. To complement our inspectors, Sacramento County is fortunate to have 2 pest detector dogs, Taz and Colonel, one of which you will meet in a few minutes. Our pest detector dogs inspect unmarked packages at shipping facilities using their noses to detect plant material and produce. In 2020, Taz and Colonel discovered 124 unmarked packages of produce or plant material that contained A or Q rated pests. Those are pests that are not known to occur in California. Their job is to detect pests coming into the state before they can become established and negatively impact our ag industry and the environment. Sacramento County is home to 2 of the 13 dog teams in California. To bring awareness to this program, we created a 2022 California Agriculture Detector Dog Team Calendar. Taz is Mr. January, and Colonel is Mr. March.
Quick question for you, Chris.
Yeah.
I know you're going to do a demonstration in a moment. When they discover the pests and whatever packaging it's included in, what's the follow-up with the senders? Is there a fine? Is there a letter at least sent saying, hey, you sent, products that were, contaminated with pests that could, threaten? I mean, there's some awareness. I mean, what is the follow-on?
So the follow-up is that we issue a notice of rejection, and we notify the sender and the receiver, and, we let them know. A lot of times they are, especially since they're unmarked, they're usually packages from, relatives from Florida or from the South or wherever, sending, they're just trying to send a gift. Right. And so we'll let them know what the laws are, and, that unfortunately we can't allow that. And so, we don't issue them any fines, but we definitely issue notices of violation and rejection.
Okay.
Yeah.
But they do get a written communication from...
Yes, it's more about educating the public and letting them know kind of why we do what we do and the importance of it.
And they'll have to find another gift
Yeah.
to send to their friend. Okay, thanks.
And so that will bring us to our detector dog team demonstration. I'd like to introduce Colonel and his handler, Michelle. And as Michelle and Colonel set up for their demonstration, I'll tell you a little bit more about Colonel and his typical day. So Colonel is a 5.5-year-old Labrador Retriever. He was purchased by the U.S. Department of Agriculture in 2018. You can bring him around front, Michelle, if you want. Yeah. And so he thinks he's at the post office. He needs to hop into the belt. Sorry. He likes to hop.
That makes me wonder what's in that hand sanitizer.
Exactly. So he went to Noonan, Georgia, to the Detector Dog Team Training Center, where he began his training. And then when Michelle became a handler, we sent her back to Noonan, Georgia for 8 weeks to train with Colonel. Colonel's typical day begins at 5 a.m. at the kennel with breakfast and lots of love and praise from Michelle. From there, they travel to one of our shipping and receiving facilities, such as FedEx, UPS, Amazon, or they go to the post offices, so the West Sacramento Distribution Post Office. I'm told that Colonel's favorite place to go is FedEx because they have a very exciting belt, and he likes to jump up and navigate around the packages and use his nose to pick out ag products, plants. He can pick out cut flowers, soil, live insects, and live animals. On average, Colonel spends 2 to 4 hours a day working, and then after work, he likes to go get exercise with Michelle, and they'll roam around the American Parkway, and if he's lucky, he'll slip in a little swim. His day ends back at the kennel with some grooming and a game of catch. And then on a special day like today, he gets to show off his skills. And so with that, I will... So what we have up front are some just empty boxes, and one of them has something special in it. And so he's going to... So Michelle, he is, what she does is if he targets on one specific box, we don't let him destroy the boxes on the belt, but she will then pull the box and open it so that she knows if he was right or not about what was in it. So if there's any kind of plant material and there's a mango in there, then he gets rewarded. So that we have positive reinforcement of what he's noting. And so he wants to keep finding it. It's kind of like a child at an Easter egg hunt, looking for candy.
So what happens when there's a shipment of like milk bones or something? Really?
Yeah. So yeah. So they're trained on very specific scents, and they're trained to ignore certain things. So he is specific to plant material.
How did he get his name? Did he do something to get that name?
I think Colonel came from the USDA. I think they had named him. So.
They named him. They changed their names after they rescued him, and they chose it as Colonel. That's great.
Like a corn of Colonel.
Like a
kernel
of corn. Yeah.
It is. Yep. Yeah.
Take it easy on that mango. We'd like to see you cut up and put it in the drink.
All righty.
Thank you.
Thank you, Colonel. Uh-oh.
Yeah. Thanks, Chris. I know that a few years ago, it wasn't Taz or Colonel. I think it was one of the retired dogs. And you placed packages actually in the chambers, and he wandered around and found the package in the...
Yeah, we thought about hiding them under the chairs, but I thought that was not good.
Yeah. But, I just want to say, too, that, really a valuable program. And there's been years now, fairly long ago, when this program was in jeopardy because it required some local match, and yet I think it was stressed, and maybe part of when we had the conversations during the recession about, not only the importance of it, but what it means. And if we get on a list where we get these pests in our county, then the products become embargoed. It affects obviously the growers, but also affects neighborhoods because then the treatment regimes and so forth, and just stress the importance of it. And I think now with so much delivery, although we've had it in the past, but I think now with the advent certainly of what we've seen certainly during COVID, but all the deliveries to homes and so forth, and packages that move across the states and then certainly around the state and probably even internationally as well. I just think it's so very important, and I'm glad we have two of the teams right here in Sacramento. So certainly compliments to Michelle and to your handlers and to this program. And it's great. I thought the idea about the calendar is just really
I wanted to thank the growers, and so we plan on giving those out when they come in for their permits. So anyway, thank you.
Good. Thank you very much.
Okay.
Thank you very much.
you.
That was fun and informative, and I'm glad to hear that all of our crops are doing so well.
They are.
And we appreciate all that you folks do in the county.
Could I ask one question? Because just, we got, there were still the tail end of the harvest, particularly with grapes, but even with some of the other crops, some of the nut crops, when we got the big rain last week, was there any particular damage assessments? I know it was towards the tail end, but we haven't had a rain like that ever, certainly with that amount of rain, 24 hours, but to have that towards the end of October was very, very unusual.
We had our walnuts were about 85% harvested at the time, and so we had a little hesitation about that. And some of the alfalfa fields, flooded, and so I haven't gotten all of the data yet, but we definitely did have a little bit of disturbance.
What about the grapes? Because around where I live, I know they were scrambling right up until Sunday morning or Saturday evening anyway, trying to
get them.
Get whatever
harvested.
to get it.
Yeah. I haven't heard any reports yet, but we'll see. So, okay.
Thank you so
Appreciate
much.
it.
Desmond.
Okay, Supervisor Desmond also had
Chris,
something. I'm
thank
sorry.
you, Madam Chair. So, Chris, really quick. Thank you. I really appreciate this. I think it's so great to highlight the agricultural heritage of Sacramento County and to really show folks what a huge part of our local economy agriculture still is. So it's great, and I really appreciate you keeping us informed. I know a lot of the Japanese beetle activity was in Arden Arcade, and you and your team have done a great job just keeping us in the loop on what's going on and what you're finding. And so I appreciate that. My only complaint with the presentation, of course, is that, two great calendars. I don't even know which one to choose from. And I thought you were laying it on pretty thick with these, but with the demonstration here, it was terrific. So thank you. I appreciate it.
You're welcome. Thank you.
Thank you. And Supervisor Natoli had something.
It just occurred to me, Chris, and again, it kind of goes back into certainly the economics of it, but obviously it's very dependent upon a workforce, and I think you mentioned certainly with growers, but certainly the folks that were employed in both the planting and harvesting, tending to all the various crops and farm and agricultural products. I wanted to note, and again, we're going to have a conversation here pretty shortly about the American Rescue Plan Act monies, but there's been dollars that have come through for rental assistance, and I know that many of the folks who work in the agricultural industry hope to get a foothold here, and I'm sure many of them are homeowners, but a lot aren't as well. And I guess getting the word out to because some do reside on farms. There is some farm worker housing in this county that's maintained by the grower. But I think that's a population that, again, even with COVID testing, we were, I know Dr. Kasiri reported to us, some months ago that they were trying to get out working with the farmers and growers and actually to administer testing and or have vaccine clinics that were very proximate to where folks were employed. I would just say we maybe ought to redouble up efforts. And I don't know if you've been involved as the Ag Commissioner in your offices, but you have a myriad of things to do. But I think some of that rental assistance and that would be available both to landlords and to the tenants in particular, where folks I think are certainly a bit vulnerable in their housing. A lot of times it's shared housing in families, not just single individuals. I would think it's important for us to engage with the Ag Commissioner in the context, because you touch most of the growers and farmers and ranchers in the county in one way or the other, and I think their employees obviously are important to their overall daily endeavors, but it's important for the people of this county, and many of them are generational residents, and some may come here seasonally, but in large part, I think it's a population that's a little more difficult to reach, but I think through our growers and such. And so I don't know if you've done some of the outreach that relates to rental assistance, and if not, I certainly would want to make sure that we stress that as we look to see some economic recovery in the months ahead.
Yeah, and I would just, if something comes across, your desk and you want to notify me about something, I'm happy to share the word. I helped with the harvest for the housing project to get that to Sacramento County. I felt that was very important, and I'm glad that you all agreed. And just making sure that they have resources, right? We made sure everybody had masks. Our offices distributed masks, and hundreds of thousands of masks in 2020. But happy to help. I have all the resources and the connections and the contacts.
Well, again, that rental assistance is available, and I actually had the occasion to talk with Lachelle Dozier yesterday, and I know she's in the audience today. They have their budget here, or will be, and I think making that connection and we could do it, immediately. So it doesn't need to come to my office. I know it's available, and I think it'd be really good to coordinate, because I think there's some opportunity to help some folks, and certainly help stabilize our housing situation as we come into the conclusion of the harvest season, and folks are they may have even more limited access to some of the monthly income and so forth. So I think it's really important to.
Okay.
Yep.
Thank you, Supervisor Natoli. Supervisor Cerna.
Thank you. Thank you, Supervisor Tully, for pointing out that I think very important aspect of agricultural activity here in Sacramento County, namely our farm worker community. And I would just add to that you might also look to state housing and community development department. They, I believe, have an active farm worker housing program, and I think it's still in my late father's name. I think it was unfunded for a few years, but it's been since replenished with resources. So that's another avenue to explore to perhaps look into how we best use your office to communicate with growers and their farm workers to make sure that they're appropriately outfitted with housing choices. And then lastly, in terms of the calendars, just like to plant a seed, forgive the pun, but perhaps next year the calendars might feature our farm worker communities that are actually planting, tending, and harvesting, our crops. I think that would be a nice way to acknowledge their contribution.
I agree.
Thank you.
Good.
Thank you.
Thanks, Chris.
Thank you very much.
All right. Thank you.
Next item, please.
We have a couple of technical things that we need to set up for our next item, because we have folks who are joining remotely.
Sure.
But I'll read the item into the record while we get started with that. Item 36 is the Calvine Liquor PCN. It's a request for a letter of public convenience or necessity from the Board of Supervisors to issue a Type 21 off-sale beer, wine, and distilled spirits liquor license to a new convenience store proposed at 8851 Calvine Road in the Vineyard community.
Hi, Mr. Pahuli.
Good morning, Chair Frost, board members. Chris Pahuli, Principal Planner with the Planning and Environmental Review Division. I will be providing the staff presentation for this item. I should also note that we should have on the line Sergeant Milligan from the Sheriff's Department, as well as the applicant team is not going to be in person, but is going to be participating remotely, and they do have a PowerPoint presentation that I will likely help them toggle through when it comes to that time.
Do you know which business owner will be presenting?
It will be the applicant. The applicant and their representative are both, I believe, on the line.
Okay.
It will be Jason Koo, the applicant's representative.
And Ravender Gill. Okay.
Correct. The request before the board this morning is for a letter of public convenience or necessity to receive a Type 21 liquor license from the State Department of ABC for a new convenience store, the Calvine Market. The proposed store is located in a small strip retail center located at 8851 Calvine Road, just west of Elk Grove Florin Road. Properties south of the site are located within the City of Elk Grove's boundaries. The letter of PCN is required for this business as the site is located in a high crime reporting area. I do want to note that the site is not located in an area considered as overconcentrated with licenses as defined by state statute. The property is zoned for commercial uses and is bordered by an affordable housing development to the north, single-family residential to the west, and commercial development to the east and south. As I mentioned, the site is currently developed with a small retail center, and the proposed store would occupy a roughly 1,500 square foot suite in the building. The applicant, Ravender Gill, has existing businesses with liquor licenses in Solano County, and no disciplinary history is listed on ABC's website for any of those businesses. At the Calvine Market, the applicant proposes to sell a variety of goods that would typically be found in convenience stores, and the hours of operation are proposed to be 8 a.m. to 10 p.m. The submitted materials indicate liquor will only be displayed behind the cashier counter and would therefore only be accessible to employees, and the proposed store will have 24-hour surveillance. Here is the vicinity map prepared for the request, which includes the 1 mile radius from the site outlined in black. The site is located in Census Tract 9317, which based on state statute allows for 4 off-sale licenses. There are currently 2 licenses in the census tract. Approval of this PCN will make 3 establishments. Although there is not an concentration of licenses in the census tract, it is important to note that the site is at the intersection of 4 different census tracts, all with liquor licenses in them. Staff's research has concluded that there are 8 off-sale licenses within the 1 mile radius and 5 within a quarter mile of the subject property. The request for the Calvine Market letter of PCN was presented to the Vineyard CPAC to consider and provide a recommendation to the board. Ultimately, the CPAC recommended on a unanimous vote that the board deny the request for a letter of PCN. Comments provided by the CPAC members centered around the number of other options to purchase alcohol proximate to the proposed business, concerns about loitering and crime, and concerns with the property owner's upkeep of the property and willingness to address nuisance issues on site as evidenced by truck parking concerns. Staff's analysis of the request for a letter of PCN takes into account the Vineyard CPAC's recommendation for denial, but also our review of the immediate area where there are 5 other active alcohol licenses within a quarter mile, providing opportunities for residents to purchase alcohol. Additionally, staff identified a number of sensitive uses within close proximity to the subject site, including 5 elementary schools, 1 high school, Calvine High School, located about a quarter mile west of the site, and 7 daycare facilities. Should the board decide to issue the letter of PCN, staff has included proposed license conditions prepared by the Sheriff's Department. I should note that Planning and Sheriff's Department staff have been actively working with ABC representatives to better understand their current practices for conditioning licenses.
Excuse me, Chris.
Yes.
Actually, thank you, Madam Chair, but I think he's getting to it.
Okay, sure.
Okay. Based on this coordination, ABC representatives have indicated licenses may be conditioned, but only where there is a nexus provided to address specific safety issues. It was relayed to us that our past practice of conditioning all license requests with standard conditions was unacceptable. ABC representatives indicated that jurisdictions interested in further restricting or conditioning alcohol sales with standard conditions or requirements should use their land use and police powers. However, for this specific request, ABC representatives have indicated they intend to apply recommended conditions based on information provided that the site is in a high crime area documented with evidence from the Sheriff's Department and is located within 100 feet of residential uses.
Excuse me, Chris, Supervisor Natoli had some questions.
Yeah, not so much a question, Chris, and again, I think Supervisor Kennedy was going to get to it as well, and not to take away the focus on what's before us here, but that broader issue is one where they say it's no longer acceptable to have standardized conditions. We worked that out with the ABC some years ago, and this board, this county has taken this very seriously. We've been very diligent in processing the applications and certainly applying conditions as appropriate. And certainly the Sheriff's Department and the Planning Department have been, along with other licensing elements in the county, have been a part of that. And so I mentioned this in briefing yesterday. I think it's now time that we need to have that conversation. And again, staff has done your due diligence. I understand what their position is, but I'll say this for the record. What that presents us with then is that if the conditions aren't applicable, and certainly the sheriff has and the county has time limitations as to when to protest both transfer of licenses, but also to file certain comments. We utilize the process here for PCNs, and if there's a change in position at the state, then basically they leave at least this jurisdiction one of two things. You certainly can talk with them, but if they don't agree, then we can all we can do is say no or say yes and let it ride. And I think that doesn't provide the community interaction and protection that we've sought, and I thought we had a good working agreement with ABC for a number of years. This isn't the first time this issue has occurred, but if there's a change in policy there, then I think that this board, I would recommend that we engage with them and maybe through the exec's office now that this means and invite them to attend and then properly agenda it and have some discussion, because otherwise the applicants are going to get caught in the middle of this. And we'll look at individual applications just as you had the one before us. But I wanted to say that for the record because I think that it's been very important. We've done a lot with consistency, with hours of operation, with prohibition on single sales, and and certainly you've used the data that's required in law relative to concentration of licenses. And I again thank you for the fact that you looked at the area that included the city of Elk Grove and took that into account. But we've also looked at calls for service as relates to sheriff services in the unincorporated area, and so if that's the position they're now taking, then I think that there needs to be a conversation at a higher level with certainly elected representatives of this county, the board, but working through our chief executive officer. And again, it's not to grill them at the podium, but if that's where they're going to put us from this board member's point of view, then that just puts us in the position that if they won't take the conditions, then they're going to leave us no choice. And that's not really fair to the applicant to say no all the time, because that may not be the answer if we can appropriately condition these things. And this whole thing about having to provide a nexus and not be able to standardize conditions, I think becomes a very slippery slope, because we knew that even with those agreed upon conditions that we couldn't be additive because we're not the regulator of the alcoholic sales. We're the permitter on the land use side in the granting of the PCN. And they come here for requesting public convenience or necessity. Public convenience, I don't ever see there's a necessity, but public convenience. But if we're going to be asked to grant that and do it within this time frame, then I think we need to have the ability to know what those conditions are before we take our action. So that's my point on all this. And again, I don't want to digress from this particular item, but it's related because this is the first one we've seen. Well, I guess it's the second or third one we've seen, but you were working at the staff level earlier this spring, so this is the first time we've actually had a report to this board. So I'm just going to offer, Madam Chair, I think we need to have a follow-up at the board level from a policy framework, because this is important to neighborhoods, it's important to business people who seek to sell the alcoholic beverages, and to the general public. And if ABC is now in a different position, then they need to have a conversation with us. So,
Can
thanks.
we arrange that?
Yes, absolutely.
Thank you. Thank you, Supervisor Natoli.
Just to, I have this concluding slide here. So despite ABC's indication of applying conditions to this specific license, staff is recommending the board deny the applicant's request for a letter of PCN for a Type 21 liquor license based on the analysis provided in the staff report package. I am available for questions, and as I mentioned earlier, I believe Sergeant Milligan to be on the line from the Sheriff's Department, and then the applicant team as well.
Thank you. I don't see Supervisor Kennedy in the queue yet, so we'll move to Sergeant Milligan to if he has any comments, and then we'll move to the applicant for the presentation.
Yes, thank you. This is Sergeant Milligan with the Sheriff's Office. I don't have anything else to add other than that we did look at calls for service and reports in that 100-yard area, including the city of Elk Grove. I would like to follow up on what Supervisor Natoli was saying regarding the recent new kind of informal guidelines from ABC. I would certainly welcome getting the parties together to have a conversation on that to kind of look for some more guidance here.
Thank you. We appreciate that, Sergeant Milligan, and we appreciate your comments. And at this time, we'll, I believe Jason Coe is on the phone. Mr. Jason Coe?
Yes, present.
How do you do? Are we ready to move forward with your presentation?
Yes, absolutely.
Okay, great. Thank you.
Thank you. Mr. Pahuli, are you going to administer the PowerPoints?
Yes, I can.
Okay, great. Firstly, thank you to everyone. Thank you to Board of Supervisors, planning staff, CPAC, the community, everyone involved in this particular project. As explained, the projected site is 8851 Calvine Road. I want to get into the business operators and their operation. Ms. Ravinder Kaur Gill, and you can go to slide 2, Mr. Pahuli, is part of the Gill Sidhu family. They own and operate 7 businesses through the city of Vacaville and the city of Dixon. They're all family-run family-run businesses, which include restaurants, gas stations, convenience stores, hotels, an event center, and actually a second hotel going in the city of Vacaville, which will be another Hyatt. The Gill Sidhu family immigrated to the USA from India, created these businesses from ground zero with their hard work and dedication. Their interest was in improving their community and providing the necessary needs for their surrounding areas. Through these businesses, they were actually able to put all their children through college. Those children are now part of the family business. This would be a true definition of what we call the American dream. The Gill Sidhu family has an outstanding reputation with the city of Vacaville and city of Dixon. Slides further down will show you evidentiary facts of that. Both cities have supported the Gill Sidhu family in their businesses. And in fact, the family was able to donate to a nonprofit such as Play for All Parks, which helped create a park in the city of Vacaville. During the pandemic, their stores were able to provide products that the major markets ran out of. I'm sure, as we all know, toilet paper was at a bare minimum during the pandemic. The community was able to find that type of product at the Gill Sidhu stores versus at the major markets they were sold out. In addition to that, the Gill Sidhu family had the opportunity to purchase 8851 Calvine Road back in July of 2020, which they did. There is a Punjabi market there, which they did like seeing there, that there was a family-owned market, but what they felt was that they needed more of a convenience, not just a specified Indian market, but maybe something that provides, to all different demographics of the area. One thing that we want to show to the board is not necessarily the operations of a convenience store that's selling alcohol. We want to show to the board the operators that you're bringing in. The operators also happen to own the land as well. And so with them owning 7 businesses that are successful, them having a stellar reputation with the city of Vacaville and the city of Dixon, you're not bringing in a liquor store owner, you're bringing in a successful business owner that runs their operations in the absolute most appropriate fashion. And I think that's what the focus should be on, because they're going to be a benefit to the community. Their interest is not to make a revenue off a bottle of 40 of Old English. Their interest is to provide alcohol as a convenience to the other items that they're providing. Other market goods, produce, oil, car oil, all different myriad of things, which we'll go further down on the slides to show you. In fact, we can go to the next slide, which are going to be the PD conditions. I don't need to read them because I think everyone on the board has these. They're pretty standard from what I understand from the sheriff in regards to any kind of off sale that's going to be applied for. The applicant has no issues with any of these whatsoever. In fact, they're agreeable on them. Again, they want to be part of the community. They don't want to be a nuisance, which is why they have no issue with these. Any liquor store owner would know that selling singles is a huge part of their revenue. This is what counters this particular applicant from being a liquor store is they have no issue with not being able to sell singles. They have no issue with selling 6-packs and things of that nature. And as Mr. Pahuli alluded to earlier, their sales of alcohol or the alcohol display will be behind the cashier. Therefore, there's no access for the public to grab a bottle. It would be employee pulled at all times. As far as no loitering signs, open alcohol containers, things of that nature, they have those across all of their stores, and that's a standard as part of their business operations, not just because the city or the county is mandating that. If the county, let's say, was not mandating that, they would still put those items up because that's part of their business operations. We can go to the next slide. Facts and findings, as Mr. Pahuli alluded to, per the alcohol beverage control, the census tract that the location is located in 93.17 allows for a total of 3 off-site licenses. There's currently only 2. Therefore, we would not be over-concentrating the area if this PCN and license were to be approved. Again, we understand that the Sheriff's Department deems the area as high crime. We've agreed and reviewed the conditions. We're good with them, no issues whatsoever. And in fact, we are willing to make sure that the ABC imposes said conditions, and prior to signing them, we would provide them to the county Board of Supervisors and Planning to ensure that what's enlisted in the conditions is applicable to what you guys are wanting as well, and in addition to the Sheriff's Department. Lastly, when we had our CPAC meeting, I can completely understand where the neighborhood is coming from, the representatives and things of that nature. Anytime you hear of liquor, it always tends to scare the neighborhood. I want to make note to the board that the meeting was presented as Calvine liquor. And so we felt right off the bat, based off that DBA, we were under scrutiny because we are not a liquor store, we're a market convenience store. And I want to make that very clear. At no point during our CPAC meeting were any questions asked about the business operator themselves. It was strictly about the overconcentration, quote unquote, of alcohol within that quarter-mile area. And so I feel that if we were asked questions about who the operator is, what their intentions are, what their previous business history is with running these type of businesses, I think that may have potentially have changed some minds during that CPAC meeting. But again, I do understand where the CPAC is coming from and appreciate their time and efforts in their vote. We can go to the next slide. Again, we are just requesting that the Board of Supervisors looks into supporting family-run businesses, and more so, instead of looking at as what the business operations are, as who the operators are. We really want to stress on that because, again, bringing good operators, I think any county, incorporated city, they want that. And the benefit in having a client or an operator such as these guys who bought the property in 2020 is they're going to change that. A lot of the complaints that the neighbors have had, these operators will take into consideration and they'll apply it to make it work for the community. Again, these guys, if they were detrimental communities, Vacaville mayor would not write a letter in support. They would not donate $25,000 to build a park in Vacaville, which is near their C-stores, might I add. So their intention, again, is to not be a liquor store where they're selling Black and Milds and things of that nature. They're going to be a convenience to the community. We can go to the next slide. This is just a support letter from the mayor of Vacaville here. I don't think I need to read it. It's pretty self-explanatory. I do encourage the board, if you need to or if you'd like to reach out to Mr. Rolette. He's left his email on there, so you can email the mayor himself and find out, really from his mouth as to how these guys operate. The other image here is a copy of the receipt for the Play for Park, so you can see proof that they did in fact donate $25,000. If you look up Play for Park, they build parks. One of the other support letters that we weren't able to provide, as we just received it this morning, was from the city manager of Dixon. He too was able to provide their email. So if you feel the need to email Jim Lindley, the city manager of Dixon, you're more than welcome to do so. Jim has also left his direct phone number, so you can contact him directly if you need further insight on these particular business operators. Next slide. This is just a floor plan site map. Really what I'm showing the county here is the security plan. And I want you to notice the little red dots on the left-hand side image are their security cameras. On the right-hand side, you'll see the images where the blue boxes are with red 3 lines is their camera system. You can see that this location has ample security in regards to cameras. They have no intention of taking these cameras out. If anything, they may add more if that's what the city, or I'm sorry, if that's what the county would like and or planning. Next slide. These are just images of one of their stores that they currently own in Vacaville. As you can see here, the alcohol on the, for the image on the top right, you'll see the cashier right there. You'll see the COVID safety glass right there, and the alcohol is behind the cashier, only accessible by the cashier and or an employee. You'll see they have a myriad of items outside of just alcohol in there. These fridges here, behind here, in fact, all from here over are non-alcoholic beverages. From here over is going to be beers, sold in singles because that's what the city allowed, but under the understanding of what the sheriffs are imposing, those fridges will not be filled with singles. Those will be unalcoholic beverages. We can go to the next slide. Here are some of their market goods. The top left image you'll see is toiletries, medication, things of that nature, Tylenol, soaps, lotions, etc. The top middle image is car oil, gasoline tanks, things of that nature. To the top right, more car products for them. Bottom left, some cold foods. They will have a hot food area as well. The second image to the left, canned goods, flour, condiments, things of that nature. The last 3 images on the bottom right are all non-alcoholic beverages, which those are just a fraction of the fridges they have of non-alcoholic beverages. We can go to the next slide. In conclusion, we want to thank the Sacramento County Board of Supervisors, planning staff, community, and its members for taking the time to listen to and to hear our request for PCN approval. We have the goal of continuing to run successful businesses and would like to bring said business to the Sacramento County area, unincorporated. The family is always open for communication with the surrounding citizens and government agencies. So if for whatever reason a decision is not made today, we are open and willing to talk further as to how we can be a force in the community. The goal at hand is to provide market convenience to all that live in the area. We also want to provide employment to those that live in the area. In the same way that we have improved and provided to the city of Vacaville and Dixon communities, we'd like to do the same for Sacramento unincorporated. And we respectfully request that the County Board of Supervisors approve our PCN request, and we're confident that you will be proud of our business that we bring into your county if possible.
Thank you, Mr. Coe, and I can also put in a good word for the Gill family because they've had businesses in Citrus Heights over time, and they've always kept up their promises to deliver as promised on all their businesses. But I'm wondering if Ravender would like to say anything at this time. I'm not sure if Ravender is on the phone. Yes,
they are on the line.
Hi, this is Ravinder Gill.
Yes, I was just wondering if you had any comments for the board.
I just want to tell the board that, we are a very good family-owned business in Vacaville and Dixon, and we will provide the same thing for Sacramento County. So it's just not the liquor store, it's more toward the market and help the Sacramento County.
Thank you very much. And at this time, I believe Supervisor Kennedy had some comments.
Thank you, Chair. I think those that know me know that I try to bring business to South Sacramento just about any way I can. That we need the retail support, we need jobs down there. So I always walk into these with that lens. I do think it's unfortunate, and I thank Supervisor Natoli for his comments earlier, and I agree wholeheartedly that we need to reignite those conversations at the state level. I think it's unfortunate that the position that ABC has taken on these standard conditions, as somebody who's conditioned countless projects since the early 90s, these types of projects, and due to the fact that I was comfortable that those conditions were going to be enforced, I have often, when appropriate, actually supported those projects. One of the things that I've always found to be hard to support is this arbitrary census tract. And I remember when it came around first. And I mean, if you have a property like this where there's literally 4 census tracts it's touching, you could have 16 licenses within a stone's throw. That is arbitrary in my mind. So I've never been very swayed by the census tract data alone. I understand it's a good starting point, but as Mr. Natoli said, I mean, you go into Elk Grove even, I mean, they're impacted by this as well. Bottom line is this. I believe that the Gill Sidus are, good corporate citizens. I believe that they, probably have run good stores in other communities, and I welcome them in the South Sacramento. However, at this time, because of the nature of the conditions on a PCN, the questions of whether or not they will actually be enforced, I don't feel comfortable going forward. This isn't something that, without those conditions, this is not something the neighbors will support. This is not something that they see for their neighborhood. I understand it's one small store, but these are cumulative projects. How many times have we driven down streets and said, why did the county allow all of this to happen? Well, it didn't happen overnight. It happens incrementally. And so I'm proposed to deny this application. I'm going to make the motion to deny this application. Again, this is absolutely no reflection on the family who's operating this business. This is what I'm hearing from the community and my level of discomfort that these conditions will actually be enforced at this time. So that's my motion.
I would second the motion.
Okay, we have a motion from Supervisor Kennedy and a second from Supervisor Natoli.
And let me just double check to see if we have public comments for this item.
I do not have any public comment in chambers.
Okay, and we do not have any public comments for this item, so I'm going to close the
Am I able to ask a question to the board?
Sure.
I'm just wondering, once you guys have your meeting with ABC and you're able to find a common ground where conditions could then be imposed based off what the sheriff and the county and CPAC would like, and ABC agrees that, is this something that we could reapproach later down the road? I feel like the applicant is somewhat in purgatory because ABC may do one thing versus what the county wants. And while I can understand the decision of the board, I'm just trying to see what options may be available later down the road once the county and ABC are able to meet and find a common ground.
Would you like to speak to that, Mr. Pahuli?
I think that it would probably be fine to have them either file another application for reconsideration, or if the board would like to continue the matter, those are all options. Leaning over to county council, maybe if there are any other alternatives that you can think of, or if those are the two.
If we continue it, does that mean they don't have to pay for another application fee? It just continues their application?
Yeah, that would probably be true.
That's the...
Do we not have to take some timely action on this, though, council?
So it probably is best not to continue the item today to address it, because not only is your action going to affect the property owner as we stand, but it also affects the state and the application that the state is processing. I do not know if there are limitations on the amount of time between when one application is submitted and denied and the opportunity to resubmit, right? Because were you to process another request, it still is going to be contingent upon what the state decides, because they ultimately make the decision as to the issuance of the license. So it's best to proceed as you plan today, and then we can look further into whether there are any impediments and time constraints on reapplying at some point in the future.
So what you're saying is that we could approve it, but the state could still deny it, and so it doesn't, we still need, we need to be on the same page, basically.
That's correct, because the ultimate jurisdiction for issuing the license is with the state.
And just, I mean, this is not empirical, but I think we've all dealt with, conversations with the state. This isn't going to happen quickly. So a continuance would be,
sorry to laugh,
quite some way out in the future. And by the way, Mr. Coe, I completely understand your comment there, and I understand and I'm sympathetic to it, which makes this a difficult decision for me.
Right. Oh, and just to add one thing, as far as ABC goes, and in talking to Ms. Yvette Daniels, who's assigned to the particular file, because I also represent the applicant in regards to their ABC application, the applicant was fortunate enough to win what we call a lottery license through the state. So if in fact that this were to be, if PCN is denied, ABC is then going to deny the application, in which case the applicant will then lose its opportunity on this lottery. So if we were to withdraw this particular ABC application and the county and the ABC were to come to an agreement, let's just say 6 months from now, hypothetically speaking, the applicant doesn't necessarily then re-qualify for that same license that they are awarded previously. In fact, they would have to either re-enter the lottery with a chance that they don't win, or they'd have to spend an exponential amount of money, more than what they got the lottery license for, and having to buy a license on the open market. So there is a bit of, I guess, it creates a little bit muddy over water for the applicant in this case, in getting denied PCN, but then maybe later down the road saying, hey, look, we've come to an agreement with ABC, go ahead and refile. It affects them on their licensure side and what they're spending money-wise with the government, with the ABC. I do know in speaking with ABC that if the County Board of Supervisors is to continue this, they're not going to deny or withdraw the application, because they're going to state that, well, we can't make a move until we know whether the county is going to approve the PCN. So that's been my discussion with ABC recently.
I would like to withdraw my motion for denial of the application and instead continue this item for a date in January in order to give an opportunity for staff to clear up some of the, as was said, muddied waters.
I have a second from Supervisor Desmond, a motion by Supervisor Kennedy, but I also have some comments from Supervisor Natoli.
No, I think I was a seconder, so I would.
Well, I'm sorry, Supervisor Natoli's original second.
And I certainly could support the motion to continue. I was going to ask, though, if the applicant withdrew, recognizing that there was a motion for denial, we hadn't yet voted, whether that preserves some of their rights for their lottery license at the state, because again, my recollection is, and I know you're going to research this, that's part of the motion now, but that there was a period of time by which they could not reapply through the county's process. I think it was a year. I could be wrong about that, and you're going to confirm that one way or the other. But I would again offer too, if they wanted to voluntarily withdraw, they've come this far, the motion will preserve an opportunity for some clarification, additional information. But effectively then if they withdrew, then I don't know if they can, with the liquor license, and this is from Mr. Coe, I guess you maybe will respond to that. Is there a clock ticking on the lottery award that they have?
No, they're already pending their application there. So as long as they filed within the requisite time frame, which they did, ABC will keep this application pending until such time either the applicant themselves withdraws, the County Board of Supervisors denies the PCN. Those are really the only two ways that this application will go bye-bye from the ABC side.
And I'm just curious, though, if they withdrew, could they, if they were looking at another location, could they reapply, or does this go for this?
No, they lose that license. The moment they withdraw from this opportunity with the ABC, that lottery license is gone.
Okay, that's helpful to know. Okay. Anyway, I would support the continuation to allow more time for information to be received.
Thank you, Supervisor Natoli.
Madam Clerk?
Yes, so we have a date in January the 11th or January the 25th. What would you prefer?
Considering the holidays and everything, and I'm asking staff to, put some work behind this, I would say the latter date.
Okay, we'll continue to January 25th.
Let's not expect ABC also to move too quickly during the holiday season either.
Yeah.
Yeah. Right. Okay, so we have a motion for continuance to January 25th, 2022, and a second by Supervisor Natoli. Please vote.
Unanimous vote.
Thank you, Board, and thank you, Mr. Coe.
Thank you.
Thank you all.
Just read this in here.
Okay, next item, please.
Item 37 is the Sacramento County Health Authority Commission report back.
Madam Chair?
Yes, Supervisor Kennedy.
Yeah, I'm making a bad habit of this, but if it's okay with staff, I'd like to just give a bit of a background as to how we got here. Thank you. So as we know, there is a Health Authority Commission that was established through state legislation and that this board approved, and I serve at the pleasure of the board as a representative of the board on that commission, along with a couple of other, 3 other staff members from the county and a number of individuals from the community. A lot of hard work has gone into this process. I asked for this hearing because there were a couple of concerns, which concerns probably a strong word, but there were things that were triggering in my mind that said it's time for a public hearing on this before the board. Through Zoom and a number of other reasons, and these meetings have not been widely publicized, available to the public, and I felt first and foremost the threshold issue in my mind was that the Board of Supervisors is going to be asked to make a decision which impacts approximately 500,000 Sacramento County residents and their health care. That's probably one of the more important decisions we will all make as members of the Board of Supervisors. I didn't feel completely comfortable going too far down the road being the keeper of the information for the board. I thought that the board members, my colleagues, they deserve to have information as it comes in more periodically than suddenly, okay, now it's time to make a decision. So I asked that this come before us today. Now, there have been a few concerns that I have voiced at the board and at the commission, and many, this won't come as a surprise. One is the speed in which the process has taken place. This is a monumental decision that we've been talking about for, since the late 90s. In the 90s when the pilot program was started by the state for GMC model in San Diego and Sacramento. But it's something that we've been talking about for decades, yet this process has gone in lightning speed, in my opinion. In such, I was concerned and still remain concerned that 2 voices that haven't been heard. One is that of the county and the Board of Supervisors through the process, and we're trying to remedy that today. And then the other concern I have is that very little of the conversation has included any input from the most important people who are in this process. And that's the people we're serving. That's the 500,000 or so Medi-Cal patients. There's been very little public communication. And when I reached out to community-based organizations which do case management, which do enroll people in Medicare, who are on the ground every day, and they say, we didn't even know this was going on. That's a huge concern to me. Another reason that I asked for this hearing to be held today. To me, a great deal of the conversation has been on whether we go from 5 plans to 4 plans to 3 plans to 2 plans or to 1 plan. That is fine, and I'll get into that probably at my summation, but for now, what the conversation has lacked is how does this make the outcomes better? And that's the outcomes for patients, not the outcomes necessarily for the health plans, not the outcomes for the hospitals, certainly not the outcomes for members of the commission. But there hasn't been enough conversation and data to show how this helps outcomes for those 500,000 or so people. So I wanted to start this conversation here today in a more public fashion than in a Zoom meeting that nobody knows is occurring. This is not a criticism of the members of the commission who, as I said, have worked very hard. It's been very animated at times, I will say. There's strong opinions on every side of every discussion and every issue in this process. But today, I wanted to hear where we're at. I want the board to hear where we're at, where we're going. And I would also like to talk about things like, why is it we're focusing so much on the number of plans, and yet I haven't seen empirical data that shows that that's the determinant. But that seems to be where we've been hung up on, in my opinion, throughout this process. So I just wanted to give that broad overview. I'm sure I'll have other questions, and I welcome the input and the questions and comments from my colleagues. Thank you.
Thank you, Supervisor Kennedy. And we have our Department of Health Services Director, Siobhan Katari, here to walk us through a pretty comprehensive presentation.
Great. Thank you so much. And thank you, Supervisor Kennedy, for your comments. I hope to address some of your questions and comments in my presentation, but happy to take questions along the way. I wanted to introduce also in the audience, we have with us Eddie Kirby, who is our Vice Chair of the Health Authority Commission. So at the end of my presentation, he'll come up and say a few comments as well. Okay. So just in terms of a brief overview of the agenda, I will give you a brief history of Medi-Cal managed care in Sacramento County. I will talk about the creation of the Health Authority Commission that the board voted to approve in December of 2020. I'll go into the authorities and the roles of the Health Authority Commission, the progress that the commission has had to date, as well as the future work. And then also talk about the impact on this procurement process that Supervisor Kennedy was talking about, as well as the impact on CalAIM. So in terms of the history of GMC, in 1991, AB 337 established the California Managed Care Initiative, the route by which the state and counties developed several distinct Medi-Cal managed care models. Of the 6 models in California today, the Geographic Managed Care, or GMC model, is the pilot project that was developed as an experiment in building a competitive public health insurance marketplace similar to the private insurance marketplace. Sacramento County and San Diego County are the only 2 in the state that use this model. Other models limit competition to 1 or 2 plans as compared with the GMC model, which provides 4 to 7 plans.
In 1991, AB 337.
Sacramento County's GMC model was established in 1994. In 2010, with growing concerns about the managed care plan's performance, Sacramento County, via SB 208, created an advisory committee empowered to inform the State Department of Healthcare Services regarding policies to improve coordination amongst providers, improve healthcare services, and health outcomes for the residents of the county. Over time, however, it became clear that this advisory committee did not have the teeth necessary to ensure accountability. In 2017 and 18, there were some more fluctuations, with 2 plans entering the market and 1 plan exiting the market, which left Sacramento County with a total of 5 plans. Today, Anthem represents 40% of our members, HealthNet has 25%, Kaiser has 21%, Molina has 11%, and Aetna has 3%. For context, as Supervisor Kennedy did point out, there are currently over 583,000 individuals in our county who are eligible for Medi-Cal, representing about 31% of the population. Roughly 480,000 of these are enrolled in a managed care plan, which is about 82%. The rest are fee-for-service at this time. Sacramento County has a complex network of health plans with 5 plans, as I mentioned, 4 4 independent practice associations, 7, and I apologize, it says 6 up there, but it is 7 FQHCs, and 4 major hospital systems. This vast network, although seemingly providing more options for beneficiaries, has led to a complex web of relationships between the plans, the IPAs, the FQHCs, and the hospital systems, resulting in a number of challenges for beneficiaries and providers alike. Having 5 plans has not only made it difficult for the county, our advisory boards, and even the State Department of Healthcare Services to track outcomes, but it has also resulted in a lack of local control. Although the number of options would seemingly result in greater access and heightened competition would seemingly result in better quality of care, these factors have not yielded the results hoped for when the GMC pilot was established in 1994. The web that I described has resulted in difficulty for beneficiaries trying to navigate the healthcare system. Additionally, each plan has its own authorization processes, networks, and protocols for accessing ancillary services, such as transportation for beneficiaries to and from appointments. Additionally, the shifting networks and contractual relationships between the plans, IPAs, and providers has resulted in beneficiaries having a difficult time accessing consistent and reliable care. This slide demonstrates average quality scores of different managed care plan models. A composite score is a compilation of quality outcomes, provider network adequacy, access to care, and data quality. You will notice that in the counties that have fewer managed care plans, average quality scores are higher. In GMC counties, Sacramento and San Diego, we have the lowest quality scores in the state. For this reason and others, the State Department of Healthcare Services has decided to reduce the overall number of plans in GMC counties during the upcoming statewide procurement. A statewide procurement has not occurred in over 20 years in California. By doing this, they also seek to reduce duplication of administrative requirements and contracting for providers, further the goals of simplification and streamlining the healthcare delivery system, and allow for greater oversight. The State Department of...
Excuse me, Siobhan, Supervisor Kennedy.
Sure, thanks.
All right, Siobhan, we do our best to time the slide changes.
Okay. I'll go back.
Thank you.
You're welcome.
On that one, first of all, this says average quality composite score by plan model. Based on what? I mean, who is this? I mean, there's no, what's this affiliated with these?
What is the composite based on?
Well, not just what's the composite based on, but who did this?
Oh, this is the state
score
that puts this together. So we received this from the Department of Healthcare Services.
Okay, thank you.
This is state data.
Okay, thank you, because I remember there was a 2018 California Healthcare Foundation report that actually found that San Diego scored quite high, if I recall, and they have 7 plans as opposed to our 5. And then the same one also showed that Sacramento outperformed some of the more local counties like San Joaquin and Stanislaus. And they themselves are two plan counties. So what's the incongruity there? How do these things not mesh up?
So these are average quality composite scores, so I can't speak to individual county level other than to say when the state took these measures for the geographic managed care, there may be some plans in each of our counties, Sacramento and San Diego, that are actually performing really well. But overall, the plans, this would be their composite score for how they're performing. And I think what this speaks to for GMC counties, and this is the conversation that I've had with the Department of Healthcare Services at the state, is that the more plans we have, the more confusion it leads to, and the more folks who actually end up falling through the cracks because of that constantly shifting network that results in folks just not being able to access care. That makes sense. So some of these plans that operate here in Sacramento County actually may have higher scores in other counties where they operate. It's just here their scores don't reflect that. That makes sense.
Okay.
Okay.
Thank you.
You're welcome. The State Department of Healthcare Services has been signaling the process of a state procurement for years and began to release information and a draft RFP to gain public input earlier this year. In their draft RFP, the Department of Healthcare Services indicated that they would be allowing for 2 plans to operate. However, it's still unclear until the final RFP comes out if this will be their final decision on the overall number of plans for GMC counties. Our department and the Health Authority Commission agrees that fewer plans is desirable, but has not taken a stance on the total number of plans that makes the most sense for Sacramento County beneficiaries. This procurement will allow the State Department of Healthcare Services to change the structure and the requirements in MCP contracts. It is anticipated that this will result in better oversight and outcomes reflecting the current state of healthcare in California and the new policy initiatives such as CalAIM. This table shows the most current timeline on the procurement process, although some timelines have recently been pushed back to give the plans more time. The live date is still the go live date is still scheduled for January of 2024. In December of 2020, the Board of Supervisors established the Health Authority Commission via county ordinance to help address the challenges with the GMC model described previously. Per county ordinance, the Health Authority's objectives include improve healthcare quality, increase healthcare access and network adequacy, better integrate Medi-Cal managed care plans, behavioral health, and oral health services, reduce health disparities, and promote prevention and wellness. The ordinance established that the Health Authority shall recommend at least 2 plans to the Department of Healthcare Services until the Health Authority implements a county-sponsored local initiative health plan, or until we explore this as an option and deem that it's not the right way to go for the residents of our county. Earlier this year, SB 226, authored by Senator Pan, codified the role of the Health Authority. In addition to this role of designating plans, the Health Authority will meet...
Excuse me, Siobhan.
Yes.
Sorry, Siobhan, I'm just not very good at this. If you go back to the slide previously.
Oh, previous slide.
Thank you. So we're talking here, and I appreciate you reading the purpose of the commission that was established by this board's ordinance. But that doesn't necessarily mesh with what this says here, which says we establish a health authority to recommend at least 2 plans. I mean, that's not, those words aren't in the ordinance, what the purpose of the action, I mean, and even on our website says what you said is the purpose. But again, and this is my editorializing here, is that the conversation is so focused on getting lower plans, we're sometimes missing the purpose of what we were intended to do here, which was local control, accountability, and better outcomes, not necessarily an arbitrary number.
Yeah, no, apologies for the slide. So I will make sure to update that, but you're absolutely right. And that's the reason I wanted to read the goals of the county ordinance, was really to lift up and improve healthcare quality. Absolutely. I will change that slide for future presentations. Appreciate the catch. So in addition to that role of designating the plans and improving quality and access of care for Medi-Cal services, the Health Authority also has the ability under this ordinance to obtain a Knox-Keene licensure to serve as the county's sponsored local initiative, or to enter into a contract with a managed care plan to be the designated local initiative plan. And what that means is, as I showed that slide earlier about the different models in the state, the COES models, the county organized health system models, which really govern healthcare at the local level, are the ones that are found to have the best outcomes so far. So that would give us the authority to do that. All Health Authority meetings are open to the public, and we welcome the community to join us. You can search for the Sacramento County Health Authority Commission website to find the meeting details. And I appreciate your comment, Supervisor Kennedy. I think you're absolutely right. In this new Zoom world with COVID, we've had a difficult time doing the kind of outreach that we would love to be able to do with initiatives like this. And we'll absolutely take that input and find other strategies. In a few minutes, I'll talk about some of the work the Health Authority has done to outreach to beneficiaries, however. Okay, let me just make sure I'm on the right slide. Oh, I'll go over that later, the commissioners. Okay. Progress to date. So in its relatively short time up and running, the Health Authority has made good progress. Earlier this year, the Board of Supervisors established the commission and seated the commissioners. We have representation from 5 advocates, 2 beneficiaries, 3 clinics, 4 hospitals, 2 physicians, behavioral health provider, and an oral health advisory committee member. The County Health Services Director, which is myself, and the Board of Supervisors, which is Supervisor Kennedy as a voting member. And then Dr. Ryan Quist also sits on the commission as well. So we have 3 total county representatives. Managed care plans and IPAs are also serving as non-voting members. At least 2 from each of those organizations are on the commission as well. The commission has also developed goals and comprehensive MCP assessment process and scoring criteria. We released a request for qualifications to evaluate MCPs and make decisions about which plans to recommend for letters of support to the Board of Supervisors. We have been working in close partnership with all of our plan partners and have been in an open dialogue with all 5 MCPs. All of our community-based organizations, our partners, our elected officials, and other stakeholders about CalAIM to help develop the best CalAIM model of care for Sacramento County. I'd like to give you a quick overview of the Health Authority's current work and the work we're looking forward to in the next year.
Sorry.
Yes.
Supervisor Desmond.
Thank you, Madam Chair. Just a quick question. I know.
Sure.
So you have representatives from 3 of the managed care plans as a non-voting member.
No, they're actually from all of the managed care plans.
Okay, so each of the 5 MCPs are represented as non-voting.
Yes.
Okay. Thank you.
Yes. You're welcome. As I mentioned earlier, a primary role of the Health Authority is to designate the health plans that will compete in the state's procurement process. Any health plan intending to contract with the state to serve Sacramento County is required to first meet with the Health Authority. In order to determine which plans to designate or recommend, the Health Authority established an RFQ process that is currently underway. The assessment is based on a variety of factors, including past performance, quality health measures, and the future of plans' intent around CalAIM and other initiatives. The Health Authority received responses in our RFQ process from all 5 plans currently operating in Sacramento County. We are now in the process of convening an ad hoc committee with commissioners and external expert reviewers to review and score the RFQ responses to determine who will be recommended to receive county letters of support. Because the Health Authority is a public meeting governed by the Brown Act, having an ad hoc committee allows the process to be confidential to both respect the plans, trade secrets, and help mitigate any potential for influencing the selection process. Once this scoring process is finished, which we anticipate will happen about January, the Health Authority will send the top 3 ranked plans to the Board of Supervisors, which I'll be bringing back to you in March of next year. This will come before the board to request for your recommendation letters that will accompany the plan's proposals to the Department of Healthcare Services. As I've mentioned before, it's the Department of Healthcare Services at the state's role. It's their role to select the plans that will operate in Sacramento County.
Excuse me, Supervisor Cerna.
Thank you. So with regard to that third bullet about the mention of the top 3 highest ranking plans, does that presume that that is then the universe of plans that would be considered, no more than 3?
No, thank you. That was my next sentence is it should be noted that the letters of support only strengthen the applications. All of the plans who engage with us, which are all 5 that currently operate here, are able to compete in the procurement process. So it's just like getting extra points, I guess.
So how was 3 selected? I mean, what is that arbitrary or?
No, I don't think it's arbitrary. So the Health Authority Commission, and certainly Supervisor Kennedy can weigh in on this as well. The Health Authority Commission decided that they would rank all of the plans in terms of a set of established criteria that they've been talking about for quite some time, that we've been talking about for quite some time. And they decided to just put the top 3 ranked forward. It's not arbitrary. They didn't feel like giving all plans that submitted would necessarily be what they wanted to do. So they considered whether to send 2 plans, 3 plans, or more. The other thing is, one of the reasons is if the State Department of Healthcare Services is going to select 2 plans, and let's say letters were given to only 2 plans, and one of those plans didn't meet the state's threshold requirements, that would be leaving sort of our runner-up, if you will, out of that letters of support mix. So I don't know if Supervisor Kennedy, if you want to add anything to that.
I will just say, without, in the risk of repeating myself, that I would like a healthier, more robust dialogue as to why. Again, it kind of baffles me. Why is 5 better than 3, better than 2? And I will say the process was that, and since it's a public meeting, I can just recap. The motion was made to only recommend 2 plans, and a substitute motion was made to recommend a minimum of 3 plans, which was ultimately what was adopted by the commission to put forward to the county. A lot of this has been driven by dialogue with Senator Pan's office, who one of his staff members is doing a great job as vice chair. And the state is really giving pushback on limiting the plans. They at one point said, we don't want to have more than 2. There's a lot of us on the commission that feel that that's arbitrary, that feel that I haven't seen the empirical data that shows that why it gets exponentially better. So therefore, I did make the motion to do a minimum of 3 plans.
Thank you. Are you done, Supervisor Cerna?
Yeah, I guess I am. I just have a kind of remaining, I don't know if I'd call it a concern, just I guess interest and maybe understand a little bit better what would happen if at the end of this process there was a feeling by some that there were 4 really good plans that deserved recommendation. What happens then?
So I imagine we would take that back to the Health Authority for a vote. They have selected 3 plans. We have been interacting with council around how the decisions are made to ensure that we're not doing anything sort of outside of the authorities that the Health Authority has, but also not to interfere with the state's procurement process. And so I would have to ask council about that, but I imagine if there were, for instance, the 3rd and 4th ranked plans were very close to one another, then that may necessitate coming back to the Health Authority. But we're trying to really adhere to the integrity of the process that's been established, and we have been ensuring that we get council's review of that along the way. So,
thank you.
Thanks, Supervisor Cerna. Supervisor Desmond.
And sorry to keep belaboring this, because this is great, and I really thank Supervisor Kennedy for getting this on the agenda, because I'm learning a lot about this. And that question Supervisor Cerna had is my exact question. I mean, if we should be letting the need dictate the number of plans we're selecting instead of limiting us. And I'm very interested to hear council's interpretation of what we need to do. I'm still not understanding that we have some legal impediment that would prevent us from selecting more plans. So.
Yeah, there's no legal impediment. That was just a decision made by the health authority. What's important to stress here is that what the Health Authority Commission is really trying to do is to take a lot of different variables about plans performance and really and the intent of the plans around collaborating with the county and around really implementing CalAIM in the best way possible. So for instance, the health authority voted that unless plans offer these 6 basic community supports that have to do with housing and sobering centers, then they wouldn't be considered at all for a letter. So what the health authority is trying to do is really push the plans to put their best foot forward in terms of serving the county. And so I don't think there's a distinction between 3 and 4, but I think it's important to stress that it really isn't our decision locally as to how many plans the state will select to serve us. And they really have come to the decision to limit it to 2 or 3. We're not sure what they're going to choose. But they've really come to that decision with the intent to reduce the fragmentation and improve the quality based on the pilot, the managed care initiative pilot that they've been doing over the last 20, 30 years.
Okay, no, thank you. And all those factors you said that the authority is using to evaluate the plans, completely agree with that, of course. But if we find, based on the need and based on ultimately the folks who rely on it, that they can still be served by 3, 4 plans, well, then it's incumbent upon us to make the argument to the state, I would imagine, to allow us to have more than 2 or 3, or right? Is that correct?
Absolutely. If we locally feel as though we need 4 plans to meet the needs in our community, then you're absolutely right. We can advocate from the local level to the state. I would say that, the data that we've seen, the discussions that the health authority has seen, and even before the health authority, the community advisory boards, we haven't been seeing really good outcomes as a result of having more. So in this case, more is not necessarily better. We certainly want to make sure our beneficiaries don't fall between the cracks as this transition happens, and the plans will have to scale up in order to serve more beneficiaries if we have less plans. But we are not seeing the data that tells us that having more plans is better at this point.
And I understand that. I mean, I understand fragmentation poses problems, but so does concentrating things in an artificially low number of plans as well, I would think. And I think ultimately it's about the end user and those who rely on it to make sure they have the choices they need with good plans that will be able to meet their needs. So thank you, Siobhan. I appreciate your
Yeah, absolutely. It's a yes, thank you. No, thanks for raising that.
Thank you, Supervisor Desmond. Supervisor Kennedy.
Thank you. I think we're seeing why I wanted this brought to the board. Another argument that has been made as well, we can always, there are counties with 1 plan, but a bunch of subcontracted plans underneath them. And that argument has been made. My feeling there is, aren't we adding another layer of bureaucracy on top of it? And how is that more efficient? That's been my opinion.
Okay, thank you. Please proceed.
Okay. Thank you. So once this process of state procurement is finished, the health authority's priorities will shift to include establishing ongoing review and monitoring processes of the plan's performance and outcomes. The Commission has identified key data that it would like to review, which we will refine this winter. We intend for a collaborative process using the brain trust of the Commission's expertise and their diverse perspectives to identify challenges and strategize solutions with plan partners. As part of that, we'll help to ensure that CalAIM, especially enhanced care management and community supports, which I discussed last board meeting, are integrated into existing health and homeless service systems within the county, reducing fragmentation and leveraging existing resources. In the future, based on how this next few years goes with planned performance, the county, in partnership with the Health Authority, may assess if a model change is needed to move to a county-sponsored local health initiative to best serve Medi-Cal beneficiaries in Sacramento. I wanted to highlight just a few key impacts to date. As a result of the board taking action to develop the Health Authority, we have experienced much stronger local governance and community involvement as we discuss how to improve services to the Medi-Cal population. While this was very limited prior to having the Health Authority, we now have a strong mechanism to identify and uplift local needs and strategize to meet them. This is evidenced in the articulation of the Health Authority's decision regarding criteria we will use to evaluate the plans to designate and procurement. This includes the plan's approach to CalAIM implementation. And as I mentioned, we have set a threshold requirement for the plans to offer 6 basic community supports to be considered. The Health Authority has strengthened MCP partnerships, and as I've noted before, our collaboration with MCP, with the managed care plans, is unprecedented in our history in our relationship with the county's plans, and the plans have been very responsive throughout this process. And finally, to help facilitate accountability, we first gathered information on the key issues via a local provider and beneficiary survey that the Health Authority administered. We reviewed DMHC complaint data and commission experiences, and then we drew from that data to develop a robust assessment process. So just wanted to mention that we do have a consumer input committee, consumer protection input committee, that has been working to gather beneficiary input throughout this process. With regards to future impacts, we're looking forward to next year when we intend to continue community engagement and to understand the challenges that beneficiaries are experiencing to inform the work of the Commission. The Health Authority will also be a forum for identifying systemic challenges and engaging with plans, hospital systems, and providers to collaboratively address these challenges. And finally, as I noted to you in the last workshop, a social health information exchange would greatly expand our ability to track performance and outcomes, and we're looking forward to coming back to you with a proposal for that at a later date. And so with that, I'd like to introduce our vice chair of our commission, Eddie Kirby, unless you have...
Before you take off, we do have Supervisor Cerna in the queue to speak.
Absolutely.
Thank you. So in terms of when the board would be expected to make a final decision, what is the roughly the quarter or the month and the year?
Yes, absolutely. Thank you. So we're going through our process right now of assessing the proposals that have been submitted to the Health Authority. And then in March of next year, I'll come back before the board, and I can come in the interim if you'd like to talk about more, but we'll come back with the Health Authority's recommendations for plans to receive letters of support. The plans would submit those letters of support to the state, and it's not until later next year that we'll find out, maybe the end of 2022, which plans are selected for our county. 2023 will be a transition year with a go-live date of January 2024.
Okay. So we would have plenty of time to have some idea of the change in the plan structure as it affects our budget. So, well in advance of any recommended budget changes, we would know what we're dealing with, right?
We will not know the plans that are going to operate. However, during this upcoming budget process, certainly, and even before, certainly we are planning for CalAIM implementation, and there will be some budgetary changes associated with that. But that will be a multi-year initiative, and so it's going to be kind of a slow build as different populations are being served, for instance.
Got it. Okay, thank you.
Very welcome.
Thank you, Supervisor Cerna. And at this time, we are ready for...
Great. Thank you. And then I'm happy to come back up if there's more.
Mr. Kirby, yes. And Mr. Kirby, you work at Senator Pan's office and also vice chair of the board. So is that correct?
Yeah, that's correct. Good evening, or good afternoon. I'd like to thank the Board of Supervisors for your groundbreaking work to establish this health authority. As Siobhan highlighted this year, we've seen tremendous shifts in the local landscape and in our partnerships with the managed care plans. We've also initiated community engagement and reviewed complaint data from Sacramento County residents. We've heard from beneficiaries, providers, and other stakeholders on our survey of beneficiary and provider experiences this summer. It was open for a limited period of time due to time constraints because we're trying to build this all under the Department of Healthcare Services timelines that we have to, deliver on. We reviewed the Department of Managed Healthcare complaint data from over 500 Sacramento residents who received Medi-Cal over the last 3 years. One of the key challenges we've repeatedly heard was access to care. In fact, in our provider and consumer survey that we did, every single person that responded mentioned access to care in one way or another. That was done through our Consumer Protection Committee, but we also have a Quality Assurance, Quality Improvement Committee, subcommittee of the Health Authority. And so both of those committees have really been working, and they meet every other week for 2 hours a pop. So for me, I'm on both. I've been spending just alone 10 to 12 hours a month for the last, since this was established earlier in the year. I would point out and suggest, we had, there is an email listserv that was created to make sure that folks that have interest in the commission and our meetings are able to get the notices and the agendas. And so would encourage any folks that aren't on that to get signed up. That is on the Sacramento County Health Authority website. But as I mentioned, access was really crucial and brought up by everyone. Particularly the struggle to get timely appointments and for patients that have long wait times for specialty and primary care. As a result, we included many questions in what is a 17-page RFQ about the access to care to ensure managed care plans have strong plans to address and improve this. We're looking forward to next year. We intend to continue our community engagement and expand it. And in fact, I'm hoping that we'll have some resources to help with that. Residents are, so that we can understand the challenges that residents are experiencing and continue to work with the managed care plans to improve their product as they go on. And to inform the work of the commission to collaboratively address these challenges. I know that I and the Health Authority members are strongly committed to accountability, transparency, and quality. And while these have always been important, I can't think of a more important time to be engaged in this particular work. And I am inspired and excited by the work that lies ahead to track outcomes and help drive improvement in quality and access, and to reduce disparities for the 500,000 Sacramentans that rely on Medi-Cal to access health care. And, I'd just also like to point out, there's over a 20-point gap between Medi-Cal patients, our Medi-Cal population, and the rest in getting their COVID-19 vaccines. This is just one measure of quality that's lacking in the Medi-Cal system. This commission really was brought together by you all to make sure that we're doing the work on behalf of the public to get these plans and the providers and all the stakeholders to work together. And while it is certainly not perfect because we're building a plane while flying it, it in fact is coming together very well. It is a transparent process, but it would be great to get more help in helping spread that word. So, I would encourage folks to sign up for the listserv to get those notices and participate in the meetings, because it's open, and anyone that's on there, we've not shut anyone down on talking at all. So, we're hearing from folks, all the plans are involved, lots of providers. It's going really well, and from my perspective, given the short period of time that we're stuck under really because of the state. So that's my conclusion.
Thank you, Mr. Kirby.
Thank you.
I don't see any questions from the board. We do have some public comments on this item. We have one in chambers. Do we have any on the phone, Flo?
We do have several on the phone.
Okay, we'll start with the in chambers with Dr. Jonathan Porteous with WellSpace Health. Good afternoon, doctor, and thank you for waiting so patiently for this item.
Thank you. Well, it's terrific to see all of you in person and all of our colleagues here. So thank you very much for giving me a few minutes. I am Jonathan Porteous. I'm the Chief Executive Officer of WellSpace Health. I'm a licensed clinical psychologist. I'm the Vice Chair of the Managed Medical Advisory Board, and I'm a Commissioner on the Health Authority Commission. It is complex, okay? But in the last 10 years, WellSpace Health has grown from 3,000 patients to over 110,000 patients, despite that complexity. But that tells you something about the responsibility I feel that I bear for the people I serve. I'm the sole parent of 2 children, and I feel just as much responsibility or more with serving over 100,000 beneficiaries of Medi-Cal in Sacramento County. I feel like we're making a decision about 500,000 people, and we need to be really, really cautious. The Managed Dental Advisory Committee years ago was commissioned by you to do a study. Barbara Ava did that study. We had a very planful process with data, and the county and other supports were able to commission new dental facilities and double the access of dental care to the children's dental population in Sacramento County. It was data-driven, it was planful, pro formas were done. We're talking about local control. I'm anxious. Control means you actually know how to drive, and I'm not convinced that we know how to drive yet. I would like much more data. The extent to which the plan issue is discussed, it feels like a bit of a red herring. I don't think we know all the data we need to make a major decision like that. I'm very concerned that if we do, we may be swerving and then overcorrecting because we don't know what we're controlling. And then ultimately, there's cost. And I'm very anxious about the transparency about how much this is going to cost. Not because it's opaque, it's just that we haven't run the numbers yet. So I just want to be really cautious about proceeding. I'd recommend that we go with a much more planful process. We can make lots of changes to the existing model as a commission as we grow in our strength and our ability to make cautious decisions about 500,000 people. Thank you.
Thank you, sir. I do not have any other public comments in chambers, and I gave Dr. Porteous extra time since he was on the board, so we needed to hear what he had to say. So we'll move to the phone public comments.
And that makes perfect sense. Please send the first caller. We have several callers, about 11 or 12. Hi, caller. Please start with your comments. You have 2 minutes. And could you mute the meeting? Can you mute that meeting in the background?
I'm very anxious about.
Yes. Thank you so much. And then go ahead and make your comments. And then you can start with your comments.
Now?
Yes.
Hello, my name is Joan Werblin. I'm a nurse and I'm Vice President of California Health Collaborative. This is the organization I'm representing today. We are a nonprofit organization working to promote the health and well-being of all residents of California, specifically among the needs of the underserved, especially rural and urban populations. Our work directly impacts the health of members of the Sacramento County community. The decision by the Department of Healthcare Services to reduce the number of managed care plans from Sacramento from the number 5 down to 2 is very concerning to our organization, and we're afraid would have a negative impact in efforts to improve the health and wellness of Sacramento. Our organization, like others, were very surprised when the announcement was made. We were not involved, informed, or asked to provide information in any of the planning, but we know that we will have a great responsibility to assist our clients in the implementation if this plan is put into action. Those of us who have needs and support programs for the clients involved in Medi-Cal, we need to know where our programs are going to go. We've had no communication so that we can plan effectively for the future. California already lacks providers. There's a shortfall of nurses and physicians. I don't know how moving everyone into one or two plans is going to solve that problem. We're concerned about this transition going smoothly and that we will continue the continuity of care for appropriate care. If we have two plans to do the wraparound
You have
services,
15 seconds.
Thank you, that CalAIM is planning, I'm afraid we're not going to be able to meet all of that with multiple layers of administrative services going to be needed. Thank you for the opportunity to address you, and thank you, Mr. Kennedy.
Thank you.
Okay, please send the next caller. Hi, caller. Please start with your comments. You have 2 minutes.
My name is, do I speak now?
Yes, go ahead and start.
Yes,
You have
thank you.
2 minutes.
Thank you. My name is Adrienne Shapiro. I'm founder of Access Advocacy. I'm here representing Access Advocacy, an organization that focuses on education and advocacy for those living with sickle cell disease. Our goals are to improve the lives of patients and caregivers who are dealing with this chronic illness. Access Advocacy serves many community members in Sacramento who are either uninsured or enrolled in Medi-Cal. We work closely with the Medi-Cal managed care plans to ensure that our resources are reaching those most in need. These partnerships are essential to our mission of improving the lives of patients and caregivers dealing with sickle cell disease. We know firsthand the stress and anxiety patients feel when their health care is at risk, which is why we are extremely concerned with the Department of Health Care Services' proposed shift in managed care plans for Sacramento County. This change comes as a surprise as many community organizations serving these populations, like Access Advocacy, were not engaged. And we are concerned that this change will disrupt care and harm those we serve. This proposed change was not requested, and it will have massive implications on the health and well-being of individuals in our sickle cell disease community. We're asking for the Sacramento County Board of Supervisors to call on DHCS to rescind the proposed cut in managed care plans. It is important that the supervisors and the public have the opportunity to understand, comment on, and discuss the impact of potential reduction in the number of Medi-Cal managed care plans serving Sacramento community. Thank you.
Thank you.
Please send the next caller. Hi, caller. Please start with your comments. You have 2 minutes.
Hello, my name is Rachel Rios, and I'm the Executive Director of La Familia Counseling Center. Thank you for taking my call today. I'm calling to express my concern, as other callers have, regarding the proposal to limit the managed care organizations in Sacramento. We are concerned that this will have an impact on an already stretched healthcare system, as we've learned through this pandemic. What we've learned is that during these most difficult times, disadvantaged communities, especially communities of color, need to have more healthcare options, not less. We understand that there may have been some outreach, but we also know that for many of our communities, there needs to be intentional outreach services to hear their feedback and how they will be impacted. We know that health inequities disproportionately impact communities of color, and this is not the time to reduce health care services. So we ask the county to please take a look at this proposal and have conversations with this state to ensure that there is proper input and a proper analysis of the impact to our most vulnerable communities. And I also want to acknowledge and appreciate Supervisor Natoli's identification of the needs of our farm workers. La Familia is honored to be the contracted agency working with the Housing for the Harvest program. And what we continue to see is that many of our farm workers don't have access to healthcare services or a health home. So it really underscores the importance of having an inclusive managed care program in our county. Thank you.
Thank you.
Please send the next caller. 41. Hi, caller. Please start with your comments. You have 2 minutes.
Thank you. This is Pat Fonkushida, President and CEO of the Sacramento Asian Pacific Chamber of Commerce. I'm here today to express our concerns with a recent proposal by the Department of Healthcare Services to reduce the number of managed care organizations serving county residents enrolled in Medi-Cal. The county did not request the change, and this drastic of a decision should not be brought by our local elected leaders, not state bureaucrats. As a business organization serving our minority community, we understand that a choice in multiple plans for our residents creates competition, and when businesses compete, customers receive better service and quality of product. We believe that the recommendation to reduce the number of plans is a decision that is not based on quality of care or health outcomes. The real issue is that there is not a county hospital system, so that there is not a safety net for Medi-Cal patients. Staff spoke about the challenges of managing and tracking outcomes of multiple plans and the quality of those outcomes. The county would be better served and could achieve the desired outcomes with a county-run plan that would do a better job of establishing local control and quality control. Exiting a global pandemic, we need to be expanding resources for vulnerable communities in Sacramento, not removing community partners and limiting choice. The changes recommended by DHCS for the upcoming Medi-Cal RFP to allow only 2 plans to operate in Sacramento will disrupt the health care of many Sacramento residents currently enrolled in Medi-Cal. We ask the supervisors to engage with DHCS and ask that they revisit the change in delivery model for Sacramento County. Thank you.
Thank you.
Please send the next caller. Hi, caller. Please start with your comments. You have 2 minutes.
Good morning, Chair Frost and supervisors. My name is Lane Himmelman. I'm the Chief Development Officer for Habitat for Humanity of Greater Sacramento, and I want to thank you for allowing me the opportunity to speak today on this important and timely item. As an organization serving low-income families, seniors, and veterans with affordable housing, many of whom are Medi-Cal members, we appreciate and support the county in its efforts to find better ways to serve our Medi-Cal members. And additionally, we appreciate that HealthNet has been an active participant in the Sacramento Health Authority and the work they've been doing serving the Medi-Cal community in the county of Sacramento. We believe HealthNet understands that the path to wellness is so much more than medical care, but about removing barriers and creating a culture that will truly improve the health of our community. And HealthNet has been a great partner to Habitat, and without HealthNet, some of our most vulnerable community members would not have access to the services that they provide. So as a major employer in the county with over 2,500 employees, HealthNet is committed to the county, and they asked if we would share on behalf of our partnership. And so I appreciate your time, and thank you for allowing me the opportunity to speak today.
Thank you, Lane.
And please send the next caller. Hi, caller. Please start with your comments. You have 2 minutes. And then if you could turn the music, if you could turn the meeting down in the background or mute it, thank you. Thank you so much. Go ahead and start.
Start now?
Yes.
Hi, good afternoon. My name is Amber Levitt, Interim President and CEO of United Way California Capital Region. Thank you for allowing me the opportunity to speak today on this important item. As an organization serving Medi-Cal members, we appreciate and support the county in its efforts to find ways to better serve our Medi-Cal members. Additionally, we appreciate that HealthNet has been an active participant in the Sacramento Health Authority and the work that they have been doing serving the Medi-Cal community in the county of Sacramento. HealthNet understands that the path to wellness is so much more than medical care. It's about removing barriers and creating a culture that will truly improve the health of our community. Without the work of HealthNet, it would be impossible for United Way to reach and provide needed services to our community's most vulnerable populations throughout the county and region. HealthNet has been a great partner with us, and without them, our most vulnerable community members would not have access to the services that we provide. And lastly, as a major employer in the county with over 2,500 employees, HealthNet is committed to our county. I appreciate your time, and thank you for allowing me the opportunity to speak today.
Thank you.
Please send the next caller. Hi, caller. Please start with your comments. You have 2 minutes.
Thank you. This is Scott Succo. I'm the Executive Director of the Liver Coalition of San Diego, your sister city for managed geographic care in California. First off, I'd like to applaud the Board of Supervisors for holding this meeting and for listening to the concerns and your thoughtful comments. I've heard pilot and an experiment used a couple times to describe the geographic managed care model, which has been in place since 1998. That leads to my question. If DHCS, or Sacramento County, wants to change the delivery model, a legislative administrative process is in place for counties to make such a change and will allow for the public, transparent process that includes community most impacted, such as Imperial County, for example, is changing its model and has used the established process. To date, Sacramento and San Diego have not submitted a change in their current model. So what's being talked about is an experiment. Is it an experiment or a pilot if you're not changing the model? You're just reducing the number of plans. And also, in 1998, when this was established, San Diego and Sacramento had a voice. You voiced it, you shared your concerns, and you advocated what was best for your county. So I don't think that the state expects you to be silent and just accept what they have offered. So I would be interested to know how this works if you still are in the same model. You've just reduced the plans. Is that clear? Thank you.
Thank you.
Please send the next caller. Hi, caller. Please start with your comments. You have 2 minutes.
Thank you. Good afternoon, Chair Frost and Supervisors. My name is Danelle Ellison with the Greater Sacramento Urban League. Thank you for allowing me the opportunity to speak today on this important and timely item. As an organization serving clients who are Medi-Cal members, we appreciate and support the county in its efforts to find ways to better serve those members. Additionally, we appreciate that HealthNet has been an active participant in the Sacramento County Health Authority Commission, along with the work they do to serve the Medi-Cal community in the County of Sacramento. HealthNet understands that the path to wellness is so much more than medical care. It's about removing barriers, addressing the social determinants of health, and creating a culture that will truly improve the health of our community. HealthNet has been a great partner with the Urban League and continues to provide our most vulnerable community members with complete access to services. Lastly, as a major employer in the county, over 2,500 employees, HealthNet is committed to our county. I appreciate your time, and thank you again for allowing me the opportunity to speak today.
Thank you.
Okay, please send the next caller. Hi, caller. Please start with your comments.
Covered California, now we know that open enrollment has taken place.
Hello?
And Covered California has their ads out. I want to read you something from one of their ads. It says, last year has made it clear that having health insurance is more important than ever. And now, more than ever, you need to compare plans side by side and save the one that is right for you. Your choices are important. And if you need help, they have a lot of ways for you to access help. Particularly now, more than ever, with the pandemic and everything that we have learned through it, this isn't the time to destabilize healthcare. And we are already hearing from people that are hearing about this happening that they're really worried that they're going to lose their continuity of care. We already have provider shortages, workforce shortages, and more choices are better than less. So we would like to work with you, with the supervisor, and now with the Healthcare Authority. Thank you for the invitation. We would like a seat at that table, and we'd like to continue the discussion to ensure that whatever changes are made, they're for the betterment of the people on Medi-Cal. Thank you.
Thank you.
Okay, next caller, please. Hi, caller. Please start with your comments. You have 2 minutes.
Thank you. Good afternoon, Madam Chair, Vice Chair, and Supervisors. My name is Stephanie Nguyen, and today I'm calling in not only as the Executive Director for Asian Resources, an organization that enrolls many of our community members into Medi-Cal, but also someone who grew up relying on Medi-Cal for my health and medical care. You know, I remember it like it was yesterday, being on Medi-Cal and having to call around different providers to find out, one, if they accepted Medi-Cal, and two, if they were taking new patients. While this may sound easy enough, it wasn't. As someone without a language barrier, I had a hard time finding a provider that was accepting new patients, that would accept Medi-Cal as a form of medical insurance, and also within close proximity to where I live. I remember it taking hours to the point where I wanted to just give up. I'm only one person, and I know there are many more with similar stories. Stories that are far worse when you don't speak the language, when you don't have means for transportation to travel across the city just to be seen by a doctor. I know these stories to be real because there isn't a day that goes by that constituents from your district walk into one of my 3 offices asking for assistance and finding a provider that is in their network and speak their native language. I can only imagine how much more difficult it will be when the Medi-Cal managed care plans are reduced from 5 to 2. This process seems rushed. It's left out the voices of the community and, more importantly, the patients. It's tough enough as it is when you have limited options, or when we are assisting thousands of refugees and their families who we have welcomed into this county, especially during a time when access to health care and health services is very important. Please don't make it impossible. I'm asking you to take a pause and to work with us. Work with the service-providing organizations that will be impacted by this, because I guarantee you that thousands of medical recipients will be walking into our doors and asking us to assist them in navigating this big change. And unfortunately, we haven't had a seat at the table to discuss these changes, so we are not prepared to assist them. Thank you for your time.
Thank you, Stephanie. Okay, next speaker.
Yeah. Can we have the next caller, please? Hi, caller. Please start with your comments. You have 2 minutes.
Make it impossible. I'm asking.
Oh, could you
Hello?
can you mute the meeting in the background?
Yes, I'm muted.
Okay, thank you. Go ahead and start. You have 2 minutes.
Thank you. I'm sorry. I didn't realize I was already in the meeting. Hello, members of the Board of Supervisors. I'm Siri Vade, the Executive Director of the Cystic Fibrosis Research Institute, or CFRI. And on behalf of CFRI and the patients and families we serve, I wish to express our deep concern regarding the Department of Healthcare Services policy to reduce Sacramento's managed care model from the current 5 plans. As an organization serving a medically fragile community, we fear this change will have a detrimental impact upon patients in Sacramento County. There are 2,500 people in California diagnosed with cystic fibrosis, a genetic disease that impacts every race and ethnicity and still has no cure. Most people associate CF with lung disease, as that's the primary cause of death, but the disease impacts every organ system, and the medical regimen for those with CF is extremely complex, requiring a coordinated team of pulmonologists, gastroenterologists, social workers, endocrinologists, respiratory therapists, registered dietitians, and often hepatologists. This dependence on an extensive network of medical providers is not unique to those living with CF. This is the norm for many others living with rare or complex health conditions who are dependent upon Medi-Cal for their health care. We ask the Sacramento County Board of Supervisors to call on the Department of Healthcare Services to rescind the proposed cut in managed care plans and retain the current number of managed care organizations into the future. Any DHCS decisions regarding delivery models should go through an open process that engages stakeholders and follows the proper process for engagement. CFRI serves many community members who are either uninsured or enrolled in Medi-Cal, and we're concerned that we were not engaged and included in this process. This is a change that was not requested, and it stands to potentially worsen the health of our community members. Thank you so much.
Thank you.
Okay, and please send the next caller, and I believe this is our last caller, but we may have a straggler come in. Hi, caller. Please start with your comments. You have 2 minutes.
Yes, hello, my name is Stacy Fellows, and I am probably the only caller that is an actual Medi-Cal recipient. I am not receiving an hourly wage right now, and I do not represent a special interest organization such as HealthNet, Kaiser, whatever HMO that Medi-Cal has allowed at this point. I am a lifelong Sacramento citizen who has had multiple medical procedures that are being denied currently because of the COVID protocols that are being put in place. This is going to set up all Medi-Cal patients for a firestorm of medical treatment denials. Trying to minimize our choices is not the way that you solve the bloated bureaucracy and red tape for your most vulnerable population, as you claim. Patrick Kennedy states that he had this meeting or had this hearing so that he could actually hear from the people who are the Medi-Cal patients, who are the Medi-Cal recipients. Yet as I sat on this phone, as I sat in this meeting or on this meeting virtual and listened to all the callers, each one of them have an executive title attached to them. How does that show that you really care about what the Medi-Cal patients need or require? A little input for you right now. I have a referral for a post-op medical advice or insole that I need for my ankle surgery. My doctor spent hours getting the referral process set up for it, all to find out that ultimately it's not something covered by Medi-Cal. It's not something covered by HealthNet Medi-Cal. I currently am not able to have my physical therapy appointments because the only person who will provide that service to me with my insurance is Mercy Medical Group. Mercy Medical Group is going to force me to do a COVID test for each one of my 13 initial physical therapy appointments. How is that helpful? Minimizing our providers is not going to help. Why don't you try working on minimizing the red tape so the real good providers are not going to exclude themselves from being a Medi-Cal provider? How about add in more Medi-Cal providers, not take away from the system? But then again, I'm not a lobbyist that can give you thousands of fucking dollars, am I? I can't wait for each one of you to be removed from your
Can you please wrap up your
position.
comments? Thank you.
I'm done.
Thank you.
And that is our last comment. Let me just double check. That is our last comment.
Okay, thank you. And Supervisor Cerna.
Thank you. And thanks to everyone that waited patiently, both in chambers and telephonically, to address the board on this. And again, thanks to Supervisor Kennedy for agendizing this important discussion. I too have learned a lot, not the least of which is that the consistent concern that I hear pretty clear is over the number of plans. And I know that that has not been concluded yet, but given the nature of the presentation and as some may have gauged by my line of questioning, I too am a little concerned about assuming that there's going to be a limitation at this point in the process from what I know about the process. I guess the one thing I'd like to have confirmed, and I don't know if Siobhan is the right person to confirm this or not, but it sounds to me about how I understand this process to involve both the board and certainly Department of Healthcare Services, that the interests that have expressed concern and continue to express concern about the number of plans probably have more than one bite at the apple here in terms of influencing this board with their positions or their arguments for their positions when it comes time for us to deliberate the number of recommendations that we make. But also, and perhaps even more importantly, ultimately, they, I assume, will have an opportunity to somehow engage with the Department of Healthcare Services on their ultimate recommendation about the number of plans. Is that the case?
Yes, we can certainly, and I have spoken with the Department of Healthcare Services a couple of different times about this with the concerns that 2 plans may not be enough. Originally in their RFP, their draft that they released, we did see that they were recommending only 2 plans. The Health Authority Commission did have concerns about that, as did we. Without knowing, and so we did give them feedback during that process that 2 may not be enough. Once again, we didn't establish how many we thought would be the right number, but we said two may not be enough. And so we think in this new RFP that's coming out that we haven't seen yet, they may give some flexibility, but we could certainly engage in further discussion with them if that's the board's decision to do so.
If it's not their will to look at more than 2, I assume it's well within the purview of this board, along with whatever recommendations we might make about individual plans, to also express clearly, again, if it's the will of the board, our concern for the limits on the number of plans. That I don't know that that's been communicated at all by any of us. Perhaps maybe by Patrick in his capacity as the board's representative on the Health Authority board, but it seems to me that at least I can't ignore the fact that the thematic or consistent concern continues to be this one about going from what has been, with all its faults, a universe of 5 plans to something less than that. So I just want to make sure that we will have that opportunity as a board to address that and act on it accordingly in the context of this somewhat complex process.
From a timing perspective, so the department and the health authority have communicated with the state about the concern over limiting to just 2 plans. But if the board would like to take action on that, certainly we can get that agendized to bring it back before the board. I ask for some leeway to bring it back sooner rather than later, because the Department of Healthcare Services will be releasing their final RFP just after the first of the year. So I think if they're going to take that under advisement, it should be before the holidays that we get it back on board agenda.
Okay, great, thank you.
Supervisor, if I may just to add to Siobhan's comments, going back on this issue over time, when we established the advisory committee back in 2010, the issue always was local control and performance of the plans. It wasn't the number of plans per se. And this issue of the number of plans was not ours, as you can tell from the comments, it was the state's. And largely what we've heard from them as the rationale is administrative. It's easier to run 2 plans than it is to have 5. But nonetheless, they have looked at data from other counties and they have compared the different county performance. But I think you raise a good point that we can weigh in with them to ensure that really what should be on the table here is the type of service that our customers get throughout the county. That should be the issue, not just the number of plans. And while, the RFP goes out along the timeline that Siobhan just mentioned, they don't make a decision on the plans, as you saw it in her chart in the presentation, until the end of 2022.
Sure.
So this is an effort we can continue to work at, but certainly I would agree with Siobhan that the sooner we can get to them with that advocacy, the better it would be.
Yeah, no, I really appreciate what you just said, Bruce, because I do believe from what I've heard is that the state has started from almost the place of limiting plans is better for the reasons you cite, the administrative costs and complexity. We've been very clear acknowledging the challenges with GMC for the time that it's been this pilot, and given the fact that our utilization rates have been so low, they haven't certainly been where we want them, and that certainly has all influenced our focus on the outcomes being what is most critical here. So we're kind of starting from different places, but at some point, I just think we have to be very honest with the state. And again, if it's the feeling of this board, not just me, but if it's the board's will to be very expressive about where we are starting from and why we hold that position, we ought not to consider that in a rush matter at the last minute. We ought to start thinking about that now, I guess is what I'm trying to say.
Thank you. Supervisor Natoli.
Well, thank you, Madam Chair. I just want to take a moment here, because as I've listened here this afternoon, and I can remember sitting in this very location at the dais 25 plus years ago and hearing from state representatives and our staff, some are still with the county, spending hours trying to, again, talk about how we were going to not improve, but how we were going to maintain access for Medi-Cal recipients, assure that they had the follow-on, they had the timeliness to meet their health needs and so forth. And here we are now in November of 2021, and we've gone through various iterations. We've heard from them, and I thank you for the presentation, Siobhan, and I think Bruce, just in responding, Supervisor Cerna addressed it, and talking about utilization rates and hearing from certainly providers, but also from, in the last call, I think was pretty poignant, in just listening. That could have been any member that spoke to us back 25 years ago. The frustrations in trying to implement geographically managed care, and the state's idea that this was going to be the pilot, and they were going to start out with 2 and 4, and then this was going to be statewide. Well, here we are 25 years later, and it's us in San Diego that are doing this, and now they're going to come in and dictate change. And I appreciated Bruce's frankness, because it's going to be easy to administer. I don't care how easy or hard it is to administer. What about patient care? That's the bottom line. Supervisor Kennedy said it earlier, and access to those services they need for their own personal health, for that collectively certainly the health of this community. And as I listened this afternoon, and again, callers from both healthcare providers, those that advocate on behalf of certain folks with certain health challenges, as well as organizations that obviously reflect a broader community perspective as it relates to both cultural and language barriers, let alone socioeconomic barriers, and just the challenges are just within provider networks to have specialists and so forth. This is frustrating. The fact that the state, they're still talking about driving the car. They're the ones that have been driving this truck through this community for the last 2.5 decades. And when I hear that last caller, I bet you could go out and have a community forum if you could get folks to actually, believe that there was going to be some change, because they actually made a comment about how they were being provided services. I'm sure there's a lot of stories out there where people are very grateful about the fact that they have coverage and that they can get access to a physician or to a health professional. But this change up, as they change in administrations at the state level, that they look at their own statistics and who's utilizing what. To me, it gets away from though who is the parties that are going to receive the service. We got 500,000 folks in this county that are eligible, more than 1/3 of the population in this county, and we're still talking about how we're going to make things better. And I'm not convinced at all that it's going to make things better by necessarily reducing providers. When you look at the challenges within the healthcare arena, but I think the state needs to listen to people like that last caller. I didn't appreciate the profanity at the end, but that's a frustration. And I bet you that's echoed time and time again. And we can hear from professionals like we heard from today who, have grown their GHCs and other approaches, I think Jonathan, certainly his organization, and there are others that called in today that have been strong partners, but this is just frustrating. And I appreciate the leadership, certainly of our commission here. But I, for one, think that, the state folks, it doesn't need to be you, Siobhan, they need to come over here and talk to this county. Supposedly, we're their partner. We're one of the 2 counties in this state that has geographic managed care. Now they're going to tell us they're going to do this wholesale change. And, I'm not convinced at all that it's not going to be totally disruptive. Very honestly. I'm just not. That's not been the proof over the last, 20 plus years. And again, I really feel for people that are in the position of that last caller. It must be terribly, terribly frustrating. And someone would have to prove to me that what's being proposed here is going to make that better. I'm not convinced. I mean, your presentation was solid, and I think we heard from a lot of folks here today. So I'd like to have us come back. I support the idea in having a more thorough discussion. I mean, I don't know, maybe we can invite Medi-Cal recipients. Invite us to take them over here. Let's spend a day. We're going to spend a day in these chambers on a whole variety of subjects. Let's get the word out to Medi-Cal eligible folks. You can call into the Board of Supervisors and tell us how you believe the service is for you, for your family members. That would be, I think, at least one way to really get to the core of, how people either believe in the system or why it's working or why it's not working. And to me, that's local control. That's taking into account the concerns and the views and certainly the experiences of folks who are actually on the receiving end or not of the medical services that are covering these plans. So I'd be willing to devote that time, and I think devoted a day to hearing this, and certainly invite our commission members in. And I appreciate Supervisor Kennedy's leadership on this as well. But there was a lot of deja vu here today, I got to tell you, just listening to what I heard. So thanks.
Thank you, Supervisor Natoli. Supervisor Kennedy.
Thank you very much. Not a lot to add to that. I have to thank you, Supervisor Natoli. When I started having conversations with Senator Pan, and I appreciate he's been a leader on this issue for a long time. Back years ago, we started having conversations of our concerns over GMC, and then when Bruce first came back to the county, Phil and I engaged in a conversation with Bruce on the very same subject, had meetings on that. And I believe you provided a very good analysis of that. I didn't enter into those conversations because I was concerned, all due respect, that I was concerned over the convenience of providers. I did it because I wanted to do 3 things: local control and accountability, that's 2, and the patient outcomes, and not necessarily in that order, but they all go together. It was not this plan number thing that has come up. So I too would like to support my 2 colleagues in their calling for a conversation to be had with the community, which has been lacking here. And I'm sorry, but expecting people to get in touch with you and get on a listserv so that you can be informed of what's going on with their health care is simply not adequate. In this day and age, we can do better outreach than that, and we have not. And you heard that today loud and clear, I think. So I would like to, I believe you could probably just play the tape back and listen to Mr. Natoli's comments and draft a good letter to the county to the state over that. But we go beyond writing a letter, which will end up in a file cabinet somewhere. We actually have more robust conversations about that with the public and the 1/3 members of this county that we serve who depend on this for their health care every day. We need to improve outcomes. I'm not sure that we're heading down the right direction.
Thank you, Supervisor Kennedy. I just want to add that I agree. I think there were some points brought out about how competition breeds, I think, better quality and lower prices and better care. And I completely concur with the idea of maybe there's not just one answer to reducing the number of service providers. Maybe there are other solutions that we haven't explored. I think Dr. Porteous brought that up, that maybe we could spend some time looking at, some other ways that we can improve. So this was an informational item, and I'm sure glad that you brought it, Supervisor Kennedy, because I wasn't. It was very informative to all of us, and we appreciate your leadership. And so what do we need to do now in order to fulfill the board's desire regarding bringing this back and having that maybe that workshop or conversation with the community?
So there's an old showbiz saying, Ann, help me get off stage.
So I've been looking at the future board date, agenda items, and we are very, very full between now and the end of the year. It would be very difficult to do a full day, as you suggested, unless we do a special meeting on not one of our regular days. We've already added December 8th. What I don't know is how many items we have scheduled on December 8th, and I don't know if Ms. Evans knows that at this time for December 8th, as that might be a possibility. The 14th, because we have redistricting built in all throughout this as well.
The other thing we might be able to look at, members, is talking with the state about their time frame for releasing that RFP.
Yeah,
because that would give us more time if they could consider that. We could certainly communicate to them the concerns that were raised today and explore that possibility. How easy that might be, I couldn't really say, but that's another part of this discussion. We're trying to jam this back to your board because of their release date. And we might be able to revisit that with them.
I was just saying, remind them about local control.
Do you know what's on the 8th yet?
Yeah, so on the 8th, we would be able to work that out. Right now, that is targeted, we would be able to work that out.
Okay.
We'd have a full afternoon.
So might I suggest we schedule it for the 8th, and in the meantime, we can work with the state and see if we can, push out the RFP date, which might give us more time to schedule a lengthier discussion at the first of the year.
Could I just ask on that, then when we would anticipate afternoon and evening so we can facilitate? And I guess I meant it when I said, is there a way to notify Medi-Cal recipients? Can we send a letter? We know who they are and invite them. I mean, we may get a whole lot more feedback than we might have anticipated, or maybe we don't. But again, if you really want to hear from folks, that's the way to do it. And if we're going to spend the time, hearing from providers and health plan managers, that's all well and fine. But I'd like to hear from some of the folks who, again, either they're satisfied or they're not satisfied with the service. And that to me, we can play a tape back for the state. So again, I don't know if that's possible. That's a lot to do. But again, if you could,
I'm guessing we can figure out.
We can do outreach. I would suggest an evening meeting for that, though a lot of folks work. So
yeah, that's fine.
Yeah.
Right.
Or the meeting on the 8th could go to 5 or 7 to 7 p.m. instead of.
What we could do is calendar this at the end of the December 8th meeting, and it would automatically go into the evening because of other items that we have.
Can I suggest that before you put the 8th down in ink, is that maybe you confirm first the RFP?
Right.
How firm that is?
Yes.
Yeah. I mean, there's a sequence here to what we're trying to do.
Yes, we will hold the spot on the 8th, but in the meantime, work towards other options.
Work toward delaying the RFP.
Yes.
Great. Well, that sounds like a good plan, and we thank you, Siobhan.
Thank you.
Worked hard today. Thank you very much.
Not over yet.
the next item's mine too. So.
Yeah.
Thank you, Siobhan.
Were you done, Supervisor Natoli?
Oh.
Yeah, no, I'm done. Yeah.
Okay.
Yeah. That was a 10:30 item.
Yeah, we're going to be here. Yes, we're going to be here. All right. Next item, please.
Okay. Item 38 is the 2020 annual report of the Sacramento County Mental Health Board.
So thank you, Board. Siobhan Katari, Director of Health Services. And I'm just introducing this item. I wanted to, first of all, thank our Mental Health Board, who is your advisory board on all things mental health here in Sacramento County. Thank them for all of their work on this. And they are required under the Welfare and Institution Code to do an annual report. So this is the report of the board, and Lauren Sheely is our chair of that board, and I'm going to introduce her today to give her report.
Good afternoon. Good afternoon, Lauren.
Hi, Lauren.
Thank you. All right. So thank you. As Director Katari mentioned, my name is Lauren Sheely. I'm the current chairperson of the Sacramento County Mental Health Board. I also serve as a family member representative from District 1 on the Mental Health Board. And I am here to share, as she mentioned, the 2020 Mental Health Board Annual Report. Okay, so first, a little bit about the Mental Health Board. Its activities are guided by statute, which is here on this slide. I won't go over the entire thing, but a couple of things that we are required to do are review and evaluate the community's public mental health needs, services, facilities, and special problems. We also advise the governing body, which is you, and the local mental health director as to any aspect of the local mental health program. Our board is comprised of 16 members, one member of the Board of Supervisors. So Supervisor Kennedy sits with us. We also have consumers on our board, family members, and public interest representatives from all districts within the county. Okay. So what I'm going to cover today is some of what is in the report, our 2020 annual report. And in particular, I'd like to highlight our goals and accomplishments for 2020. So early in the year, each year, we hold an annual retreat. Our retreat for 2020 was held on January 11th, and we established several goals for the calendar year. We established an ongoing goal to monitor the implementation of the priorities of the Division of Behavioral Health Services. We also established 3 process goals and 2 policy-related goals that resulted in recommendations that went to you. So I'll go into each of those a little bit more. First, to the process goals. First one, we wanted to develop data sources or sources for data-driven decision-making. I should first mention we have 2 standing committees that help us advance the board's goals. We have an Adult Systems of Care Committee, and we also have a Children's Systems of Care Committee. And both of these committees individually accomplished objectives related to developing data sources for decision making. First of all, the Children's System of Care Committee worked on a report, which is still in progress at this time, related to school-based mental health services. And a lot of those data sources were around, I'll list a few of them, data on mental health programs within Sacramento County, data from school districts on their school-based mental health programs related to special education programs, data on the rates of mental illness among children and adolescents and suicide rates, and also workforce data on occupations related to the provision of mental health services. And then the Adult Systems of Care Committee also used data in its recommendations. Some of the data that it developed were around qualitative data on encounters between mental health consumers and police during mental health crises, In particular, we collected information from family members who submitted narratives about their experiences with in these encounters. We gathered data on 911 system call volume related to mental health crises. We also looked at a research report on community attitudes in Sacramento related to attitudes towards law enforcement. We looked at data on homelessness within Sacramento County. And we also looked at data on other behavioral health response programs for mental health crises, including the CAHOOTS program, and in particular around the demographics for the people served and their funding. Related to the second process goal, both of the committees, the Adult and Children's System of Care committees, engaged community members in their work towards the goals. Okay. So our next process-related goal was to improve communication and collaboration among other sister organizations. We did accomplish that. In particular, the Adult Systems of Care Committee had a presentation from the Alcohol and Drug Advisory Board. And we also consulted that board as well as the Public Health Advisory Board in preparing its recommendation letter on alternatives to 911 responses to mental health programs, which I'll go into in a little bit more detail in just a bit. Okay. The next thing that we did was accomplish an ongoing goal, which was to monitor the implementation of the priorities of the Division of Behavioral Health Services. So the first thing that we had to do was understand what those priorities were. We understood that the priorities for 2020 and the focuses that they had at the beginning of the year were the crisis continuum, individuals who are experiencing homelessness, individuals who are involved with child welfare and probation, school-based services, and individuals who have experience with the criminal justice system. So we had presentations from the respective managers of the Division of Behavioral Health Services to stay informed on those priorities and monitor them throughout the year. Okay. So next, I'd like to just go over our goals and the accomplishments, the related accomplishments of our policy goals. And these are the ones that resulted in recommendations that actually went to your board. Okay. So the first one it was advocate for mental health services for the homeless. So with this, we ended up writing a letter of recommendation to you that went to you in July of 2020. In order to do this, we had presentations from a variety of different groups, but I just want to cover briefly what our recommendations were. They were to add a triage navigator to improve access to care and to allow additional system intake. We also recommended that the division add additional homeless outreach workers and expand mobile services. This would include an integrated team focused on providing mental health outreach, system intake, transportation assistance, as well as we recommended that the county investigate delivering clinical mental health services that would include dispensing medication and coordination of mental health clinical services through a mobile clinic. So that took care of our goal related to mental health services for the homeless. That goal we are also continuing to work on for 2021. And as far as the next policy goal, I have a couple of remarks related to this one as well. I'll read what the goal is, and then I'll tell you a little bit more about it. So the goal is advise and collaborate with first responder programs leading to better outcomes, particularly for at-risk communities and marginalized individuals. So as with our other goals, this one was established at the beginning of 2020, as I mentioned during that retreat. We established this with the Division of Behavioral Health Services priorities in mind. One of those priorities being folks who may be involved with the criminal justice system and other engagement with law enforcement. However, in the letter that we ended up writing with our recommendations, and there's a link to it in this PowerPoint, we did note that we did not predict the extent of the national civil unrest that would come that year. So as we looked at the data and we heard from people in our community during meetings that we held over 5 months, this included obtaining first-person accounts from family members about their encounters with law enforcement. All of this shaped the direction and influenced our work towards this goal. And ultimately, our recommendation took the form of a response and in support of Supervisor Kennedy's September 2020 recommendation to establish a behavioral health response for mental health crisis calls. So that's what we ended up writing our recommendation about, rather than what we initially set out to do. Some of the specific aspects of our recommendation included taking a look at the initial proposed budget, which at the time was $1.5 million, and in particular we advocated increasing that amount. We also advocated for assembling a community advisory board, and we made some recommendations about the composition of that board. And then we also mentioned that we thought that program should include a 3-digit phone number. Okay, so in addition to the goals that we set at our retreat and working on those throughout the year, we also did some other things. We held a hearing on one of the new programs that Behavioral Health Services established. This was a Mental Health Services Act innovative program related to the forensic population. So we held a public hearing on that program back in June of 2020. And then another thing that we did was approve a data notebook. This is something that we also do every year. This is a notebook that collects information related to the county's mental health system. It's something that the Mental Health Planning Council, or the Behavioral Health Planning Council, collects from all the different county behavioral health systems. And each year there's a different focus. So the 2020 focus was on telehealth. And I'd like to just share briefly a couple of highlights from that survey. One of the things that was found for Sacramento County was that there were a couple of challenges identified back in 2020, including that consumers were challenged from accessing, utilizing telehealth services by a lack of computer or mobile devices, also a lack of availability or inadequate internet services, an inability to afford internet services or a mobile data plan, a lack of privacy in the home, and also a lack of knowledge regarding the availability of telehealth services. And then there was a question that was asked about telehealth and whether it has increased access to behavioral health services for any groups. And there was one group identified where access was increased, and that was for rural or distant communities. Okay. All right. This next slide is just a recap of meetings that we held at our, presentations that were held over our general meetings during 2020. These are held so that our board can stay informed throughout the year. And so there's more information about each of these in the longer report. It's just a variety of topics. And then this slide just covers the fact that our board members are also serve as members or liaisons to several other organizations. These include the Sacramento County Alcohol and Drug Advisory Board, also the National Alliance on Mental Illness, or NAMI, as well as several other organizations that are listed here. One thing I would like to mention, usually this report includes a discussion of site visits to mental health providers. We were not able to do site visits due to the ongoing pandemic in 2020 nor in 2021. That is something that we would like to hopefully get back into for 2022 if possible. And that is the end of this presentation. We do have more information available on a website here. It includes all of our meeting agendas. We, this last year, also recently started putting our meeting minutes up on the website as well. So that hopefully helps with some additional transparency for the public so that people can follow a little bit more with what we're doing. I'm happy to take any questions or take any questions back if I'm not able to answer them today.
Thank you, Lauren, and thank you for your very informative presentation, and thank you for your service on the Mental Health Board, and all of you. I know it's a commitment that you make, and without people like you taking those leadership roles, we wouldn't be able to do as well as we do, and representing, hopefully, being in touch with what's going on in the community and what the community wants to see. So thank you so much for being here today and presenting. And we do have a couple of board members who wish to ask questions or make comments, and we'll start with Supervisor Natoli.
Yep. Thank you, Lauren. Appreciate you being with us for a good part of the morning and certainly this afternoon, and for representing the Mental Health Board. You did a fine job in your presentation, and I want to just say thank you to Ann Edwards and Bruce Wagstaff, and certainly the division for making sure this got on the agenda. This is very refreshing. I'm glad we get a chance beyond just showing up on a consent item to actually have the presentation, and certainly for you to be the presenter, because I think it reflects a very important body of work. And I think as you recited some of the accomplishments and contributions that the board made, and certainly in consideration of items that this board had before it, were very important. And I think as I know that in going forward, the role of the Mental Health Board is a key one, certainly in its work, and as stated, certainly in its mission. But I think as we look at some of the landscape, certainly post-pandemic, and hopefully we get there sooner than not. But mental health needs certainly within different segments of our community some of the isolation, but some of the impacts that have come about. And I think as we're trying to make, important process changes in the way we address people's needs, both in the carceral system, but also just generally in our community, that the board's work is key to that. And again, as we've looked at Mental Health Services Act funding and some of the innovative programs, and you referenced them in your comments, again, I appreciate the service, and I served as an alternate for a number of years on the board, but this was useful. I think it's very helpful. I'm glad it's up on the website, and I would just commend you to your work. And I was just noting mentally here as you were going through your calendar that it was November of last year that on your data notebook, and here you are November of this year, but to tell us what you did in 2020, and certainly would be very interested to know how you followed through on some of those things in 2021. But thanks for your leadership, and as Supervisor Foss said, Madam Chair, that the service of all the members on that body, and certainly I think our staff's engagement with the Mental Health Board, it just, I think, really emphasizes the importance of what the board work is. But I appreciate you capsulizing it here today in your presentation and the report from the Mental Health Board. Thank you, Ann, for seeing to it that this got on the agenda, and hopefully we'll make it a regular occurrence in the years to come that the Mental Health Board representatives can come before us and actually do a presentation. So thanks.
Thank you.
Thank you, Supervisor Natoli. Supervisor Cerna.
Great, thank you. So I'll pile on, Lauren, with accolades, and start by thanking you again for your willingness to serve on the Mental Health Board so capably. And I thought your report was exceptional, and really shows you that the Mental Health Board, I think, has evolved over the last several years to really be something that we lean on heavily up here to help guide us. As you're probably very well aware, there have not been just the initiatives that you outlined that were front and center for the board during the last year, but over the past several years, there's certainly been a lot of ripe policy discussion on everything from Laura's Law to, how we look at meeting the consent decree with regards to the jail and mental health services in the jail. So I want to thank you for all that. I do want to encourage you, and you mentioned if there's anything we want to reflect on that you might take back to the board. Certainly, we do have Laura's Law that is, in the process of being stood up and then implemented, and I suspect that will, on the natural, be a very germane subject for the Mental Health Board to continue to monitor. That is the implementation of it. But we do have the new crisis response model that we're also trying to develop and put in place. So it would be good to hear in subsequent reports, whether it's you that delivers it or others, just how well that those suite of newly designed and implemented services are doing. Because I will be the first one to tell you that I'm going to go directly to you and other folks on the Mental Health Board to get a very honest assessment, especially from consumers and family members. So again, I appreciate you being here today and giving us the report, and wish you well, and look forward to the next one.
Thank you.
Thank you.
Thank you, Supervisor Cerna. Supervisor Kennedy.
Thank you, Chair. I'll be very brief. I just wanted to also say, Lauren, because this is the first time we've actually met.
Yeah.
I see you on my kitchen table all the time. But I do want to say that, it is a challenge for all my board members, my fellow board members, and that's why these appointments are so important, that we really get people who are thoughtful, and we do have that. There's more robust discussion, and because it's a lot of times these issues are very emotional, and people have very strong feelings, as they should, about these issues that we handle all the time. And you have handled the responsibility of chair with great aplomb, and I want to thank for those other board members who are listening. It's really one of the most dedicated group of people that I've ever seen on any board. So thank you for your work as the chair. I appreciate it.
Thank you. glad to do it.
Thank you very much for being here today, Lauren, and we thank you again for your service.
Thank you for having me. Okay, bye-bye.
We do have a public comment, I believe, for this item, item
Okay.
38 in person. We don't have anyone in the queue.
We have Mr. Felton Hill Sr.
Did I speak on Article number 38 here?
Pardon me?
Number 38. Number 38.
Is Article 38?
Yes, number 38. Yes, it's number 38.
I'm on my way up. I'm a disabled vet. So
Okay, take your
I'm
time.
on my way up.
Take your time,
Jumping
sir.
in Beirut, Lebanon, for this country that treats me like it does. I am sick, I'm appalled, and I'm very upset right now. You know, I graduated from McClatchy High School, went and served 8 years in the United States military, the United States Army, 101 Airborne. Now, what's going on right now is, look, this situation, they finna let all these go to Afghanistan, get all these individuals, bring them here, put them in our barracks, give them tax dollars, give them a first-time home buyers program, this, that, whatever else. Come on, man. I ain't got nothing to do with me even being here. See, because I was stolen and brought here. Now, what's going on with this administration? Going to get these people. They're going to give them money every month. They're going to give them food, a place to live, everything else. While in the meantime, they're still treating me and my kind like dirt. Man, this is not right. I don't like the administration that's going on right now. I want Trump back. And look, I say God bless all of you guys, but it's not right. Because look at what's going on. They're going to go and rescue these people. Look, me and my kind, I can't go to Egypt. I can't go to this way, that way, that way. Some places I can go. But what I'm saying is I'm not accepted and giving money and say here and this and that, you know? And these people are doing it because they can get votes. It's sad, it's sick, and I want to cry, you guys, because I made 59 jumps out of plane for this country, man. That's right. You know what I'm saying? To protect our way of life. You serve. It's just going away, and it's just people don't care. People don't care because I and this gentleman, we can't go over there and live. Get money, have peace. Let our children and grandchildren grow. People.
Thank you for your service, sir.
This is sad.
It's ugly. You did a good job.
That is, that's all that I have for your public comments.
Okay. Okay, that concludes that item, and we will move on to our next item.
Madam Chair, could I just ask, point of order, we could take the next item, and then is it possible for us to have a break? I know that we've got a lot of folks that want to weigh in on the item 40, but it might be helpful for us to have nothing else like 15 minutes and let people get prepared in clerk's office, get their folks, because I'm sure we're going to have a lot of commentary, maybe in chambers, but certainly from folks on the line. So if I could suggest we can take the next item and then
sure
take a brief break. We don't want to take it very long. We knew it was going to be a long afternoon. So.
You have public comments in queue for 40 and 41.
Right.
Okay.
Yeah.
Okay. Yeah, that's a
but
stellar idea.
We do it quickly, but just give us, give everybody a
15
chance.
minutes.
Yeah.
Thank you, Supervisor Natoli. Good idea. So we'll take the next item, and then we'll take a 15-minute recess.
Okay. I'm sorry.
Okay.
For item 39, you are acting as the Board of Supervisors and Housing Authority of the County of Sacramento and Sacramento Housing Development Corporation. It's the 2022 Sacramento Housing and Redevelopment Agency proposed budget.
It's okay, Flo.
I'm sorry.
It's all right.
Thank you, Flo.
Very
Yeah,
powerful comments.
Yeah, that was heart-wrenching.
Good afternoon. Hello. Good afternoon, Chair Frost and Supervisors. My name is Susanna Jackson, and I am the Chief Financial Officer for Sacramento Housing and Redevelopment Agency. I am here to present to you the 2022 budget. This budget follows the same format as previously submitted budgets, which has won awards from the California Society of Municipal Finance Officers and the Government Finance Officers Association. It is a balanced budget for the period of January through December of 2022 and incorporates the activities of the housing authorities of the city and the counties of Sacramento. The total estimated resources for the agency are estimated at $383.3 million. Of that, the resources that are needed to fund the projects, operations, and programs of the agency is $347.1 million. A majority of our funding is from different federal sources, which is estimated at $205.8 million, and these programs include the Housing Choice Voucher Program, public housing, and the newly created Emergency Rental Assistance Program. The remaining amount of $177.5 million comes from state and local sources, such as local housing, housing trust fund, affordable housing, and other miscellaneous sources. Here's one graphic that shows how the money will be broken out by category. The largest category is 130.7 of the HAP, that's the Housing Assistance Payments, which is our Housing Choice Voucher Program. Then it's followed by $78.4 million of capital projects and $66.7 million estimated of Emergency Rental Assistance Program payments. This is a multi-year budget comparison. It shows, again, the same information that was on the prior slide, but through 2018 through 2022. Again, the total estimated expenses are $347.1 million, with the housing assistance payments at estimated at $130.7, emergency rental payments estimated at $66.7 million, total operating budget at $63.4 million, capital projects at $78.4 million, and public services at $5.7 million. The 2022 proposed budget of $347.1 million represents $133.9 million, or a 62.8% increase compared to previous years. This increase is due primarily to the creation of the Sacramento Emergency Rental Assistance Program that did not exist prior. As a brief overview of some of our major funding sources, this is the HCV program, which reflects the historical HAP revenues and expenses and lease-up percentages. As you can see, while the lease-up percentages were 89% in 2020 and 2021, we estimated a 90% lease-up percentage for 2022. You will notice that our HAP expenses are higher than previous periods that have higher percentage of vouchers leased. This highlights not only the difficulty of voucher holders being able to find housing, it highlights just how expensive an 89% lease-up rate is for the agency, which is currently estimated at $110 million for 2020 and beyond. The next slide illustrates the historical revenue trends of the public housing program. You can see in 2020, there was an increase of a total of $21.6 million combined for both the city and the county. This was due to the additional CARES Act funding that was brought in for the public housing program. We anticipate smaller amounts in 21 and 22, mostly due to the decrease in the public housing units due to the RAD and Section 8 dispositions that you've heard about previously. This last slide details the Sacramento Emergency Rental Assistance Program, showing our payments for both the rental assistance and the utilities. As you can see, we had approximately $1.9 million in April, and in May increased to $10.43 million in assistance for the city and the county. In July, we were at $12.5 million, August also at $12.5, and then September we were at $17.8. So this concludes my portion of the presentation. I'm going to hand it over to Executive Director Lachelle Dozier.
Good afternoon, Lachelle.
Yes, I've had good morning. Let me change that to good afternoon. Good morning. I'm Lachelle Dozier, the Executive Director of SHRA. Today, I'd like to provide you with a brief summary of the work that the agency has done over the past 2 years as we've navigated the challenges of the pandemic, as well as look forward and see what we'll be working on in 2022. But before I go into the specifics of the agency's budget, I would like to give an update on the federal administration's Build Back Better Act. As you may be aware, there have been a lot of changes and amendments to the original proposal outlined by the President. Many congressional members have advocated heavily to ensure that the housing provisions remain in the Act. On October 28, following an appeal by the President Biden, the housing provisions still remain in the Act. If this passes, it will include $150 billion targeted to affordable housing, which is the largest single investment in public housing ever. The budget that our CFO just talked about does not anticipate these funds because we're always very conservative and we never know exactly what Congress is going to include, especially since the housing provisions look like they were going to be in jeopardy and going to be cut. So, just to give you a high-level overview of what those provisions look like, in terms of rental assistance, it is $25 billion, of which 22.1 will be for housing choice vouchers, and there will be specific allocations within that $25 billion for those who are extremely low income, as well as those experiencing homelessness, survivors of domestic violence, or human trafficking. In public housing, it is $65 billion, and that will go towards our capital fund, which we have never seen those types of funds being appropriated. The Housing Trust Fund, which is a national program, is estimated to be $15 billion. And if you break that down in terms of what we're looking at for California, it comes through the state of California. It's approximately $2.69 billion. The Home Program, an additional $9.9 billion, and the CDBG program, $3 billion.
Excuse me, Supervisor Kennedy had a comment.
I'm sorry, Lachelle, to interrupt. You were on a roll and spending a whole lot of money there.
Yeah, there's a lot of all B's, billions.
Maybe not now, but in the future, just for my own edification, it'd be great if you could just what are competitive, what are formulaic. I mean, because we're hearing national numbers, and I don't know what that means to us. I guess is what I'm saying.
Correct. And those are some of the details that we are still ferreting out in the provision of the Act in terms of how much the state is going to go competitive. And then there are some that allows HUD total discretion. And so HUD hasn't made that decision. But as soon as I do get that information, I will provide it to you.
Appreciate that.
Mm-hmm. Well, that was the end of my billions. So if this act passes, it will provide much needed resources here at the local level to address our growing housing crisis in Sacramento. So we're keeping our fingers crossed. So there are 5 areas that I want to focus on in terms of what the work is of the agency and what we've been doing. This is a snapshot of those things, and those are our response to the pandemic, how that has impacted us as an agency, our response to homelessness, affordable housing production that has continued, our public housing conversion, where we're still continuing to convert over our public housing to a new platform, and then our Choice Neighborhoods Initiative, which is Marisol Village. So our pandemic response, when this first started, it was officially recognized in March of 2020, the state shut down and everything else, but we had very little time to react. However, as an essential agency with essential workers, we began tackling the crisis internally with an effective strategy to become fully functional. Within a few days, we had deployed our computers to employees to work from home. We started to reach out to our residents and figure out how we were going to continue to serve our customers. So internally, we had to develop our COVID-19 policies and protocols, keeping our staff continually informed as to what was going on, getting out the PPE, touch-free sanitizing station, temperature checks, masks, gloves, all of those things at our work sites. It was imperative that we really work hard to make sure that we did not slow down in terms of providing affordable housing services to all of our clients. We installed new technology so that we could start to telework more effectively with all of those employees who were working at home, but there were many employees who still were on the front line, still working every single day. We gave incentives to employees when the vaccine became available, and we have a very high favorable response to that and high number of employees who have received the vaccine. And in terms of our external outreach, we really work very hard with the communities that we serve. We were trying to really get the word out. We provided vaccine clinics. We had informational meetings with healthcare experts to answer questions. And we partnered with the city to provide free meal service to our senior residents. And that's a picture there. At the beginning, we saw a lot of our seniors were very afraid to leave their homes. And so that's why we worked to make sure that we were bringing services and resources to them. One of the things that Susie was talking about was our pandemic response in terms of the Sacramento Emergency Rental Assistance Program, or SARA. This was a huge effort and a huge lift for the agency. We quickly responded by developing a strategy to improve our capacity to administer this new housing initiative that served people who were really in need of resources. It opened in February and went through March, and then we reopened in May and we left it open. So we are still continuing to accept applications. In response to trying to organize all of these things, in the spring of 2020, I created a Homeless Innovations Department in the Housing Authority to administer some of these new initiatives through partnerships with the city, the county, and also our experienced resources provider. So I'm going to go into our next slide. So this is the actual amount of funds that we received in round one. Some of the money came directly to the city and the county, and some came through the state. So in the first round, it was $96 million. And then we also have received information on the second round that is coming up, which is approximately $84 million. So this particular slide, when we put this together, we were at dispersing about $62.2 million to all of the residents in the city and county. It was about 9,000 residents, and we were at 69%. As of today, that number has grown to $72 million has been dispersed to 9,600 households, and we're at 74%. And I really just want to commend the staff at how hard they worked to really put together this program and get those funds into the hands of the people who need it. There are still many, many individuals who are in the queue. But if we're looking at 74% nationally in terms of disbursements, they're at around 11%. So the city and county of Sacramento has far outpaced other jurisdictions in making sure that that word gets out. But we are working really, really hard. We have received over 20,000 applications from people who are in need of assistance. One of the things that we are seeing as a
Excuse
result...
me. Excuse me. I wasn't sure when I could get a break, and that was very intense presentation. Supervisor Cerna, followed by two more.
Okay.
Can you explain the 92%?
Excuse me?
The 92%, can you explain that?
So the breakdown is between the city and the county, so we receive and we track them separately. So in the city, we have used up 92%, in fact, it's even higher, of the funds that were allocated for the city, and 59% in the county.
Okay.
Does that answer your question?
Yeah, just the way it's presented, it just looks like an error to me, but maybe it's just because I haven't had lunch.
Okay.
Okay, thank you, Supervisor Cerna. Supervisor Kennedy.
Yeah, I was a little confused myself, but the specific question I have now is, it's a pretty big difference between the city and county. Is there a reason for that?
Well, the county received much more money than the city.
Yes.
Yes, the amount of money that the county received, gosh,
but it's
yes.
I guess I'm still confused. It's still, regardless of how much, and we're talking percentage, if you go to back to the other slide, it's a significant difference between the county and the city.
Mm-hmm. We've had many more applications come from our residents within the city than we have in the county, and so we're continuing to do the level of outreach necessary to reach out to all of those communities to make sure that they know and understand about the program.
Okay, that's a little disturbing since we have the same population and we have, the need too. So, thank you.
Mm-hmm.
Thank you, Supervisor Desmond.
Thank you, Madam Chair. Yeah, I had some of the same questions. Just wanted to clarify this, and that's the percentage of total funds from both rounds of SARA funding?
No, just the first
just round one.
Just round one.
Got it. Okay.
Mm-hmm. We have not started expending the funds from round two. The funds from round 2 gives us more time to expend. It's about 2 to 3 years. So this is a program that's going to be around for quite some time.
Thanks. And Lachelle, you and I had a discussion, maybe it was a month ago or so, obviously with eviction protections ending. There were some, I can't recall exactly what it was, but there's discussion, I guess, with the courts before they enforce any kind of eviction for failure to pay rent. There would be a requirement for an inquiry or something to determine if the tenant has taken advantage of these. Can you explain that to me?
Yes, in fact, we have worked out a relationship and working with the courts because we did see a surge in applications at the end of the eviction moratorium. The courts were very concerned that they would be overwhelmed. They didn't receive as many as they thought. However, we did set up a process so that if someone comes before them, that they will actually reach out and contact us to make sure that they have either put in an application or even their landlord has put in the application for rental assistance. If it is in the queue and being processed, then they will delay the action to give enough time so that we can get those funds dispersed. So, and if you actually even go to Sacramento County's website for eviction court, there is a link to the SARA program back to our website so that people know and understand that it is available. But I would say that I am very pleased that the courts are taking this type of approach.
And I agree with you. I think that's a great backstop. I mean, frankly, it should be something that should have to be considered before somebody could be evicted, is just ensure that they have gone down this path of getting resources that they may need to keep them in their home. So,
Right.
Okay, thank you.
And just to follow, oh, sorry.
Go ahead. I'm sorry.
I was just going to follow up on that point. So we did query all of the applications to see, how many, and there are quite a few that actually have received an eviction notice or a notice to pay rent. And so we will be reprioritizing. Those will go to the top of the queue so that we can make sure that they get their resources first and they are not subject to any eviction. We're trying to make sure that we outreach and let people know about this and not self-evict. In other words, they need to make this application to the program so that they can stay stably housed.
And Supervisor Natoli.
Yeah, thank you, Lachelle. So how do you expand getting the word out? Obviously you have some connectivity to people who made applications, and I don't know if you were not here this morning or earlier today, but as we talked yesterday, again, a smaller complement of folks, but nonetheless, folks, and some of them could be in the rural areas, could be in the suburban areas, but working to do some outreach there. But are you working with the Department of Human Assistance through folks who may be receiving aid through other channels? Also, does the Rental Housing Association, I assume that they've been a strong partner in this, but you have individual landlords, you've got property management companies. If you just take a quick minute here and kind of what you've done thus far and getting that word out, but then how you're going to expand upon that, particularly when you're going to have another round of funding, but we still got significant funding available from this round that the clock is ticking on. So
right. So at the beginning of this process, we contracted with nonprofits. So there are, I believe, 13 nonprofit entities that we are working, and they are the ones who really are boots on the ground. There have been some who have done, just outstanding work. Asian Resources, La Familia, all of those are working to actually sit down with those residents and walk them through the process, help them upload documents, and really are our connectors out in the community. In addition to that, we did a very aggressive outreach and campaign through local radio stations. I know that myself and Sarah, we've been radio celebs, so to speak, on a couple of stations talking about this program constantly, and then also outreach into newspapers and newsletters, especially for those that are speaking different languages other than English is not their main language. And so those are some of the things that we have done thus far. And we'll continue to do that so that we can make sure that we expend all the funds. At the rate that we're going and the number of applications in the queue, I don't think there's going to be any issue with expending the amount of funds that are left in the county whatsoever in round 1. And then round 2, because we have 2 to 3 years, then at least now this is an available resource that is now going to be here for us.
So you just said it, but you have confidence that before time runs out, you will have expended the funds that are available to us, and if we just transpose these numbers, then at 60%, you got roughly 50, a little less than 5,500 folks helped. So you will be pushing 10,000 households.
Oh, yes. Yes, we're already.
I'm talking about in the county now. I was as it was in the city that has a number. I wasn't doing the additive there, so in the county.
I think that's possible that you definitely could get to that amount. It depends on.
I know the amount that they qualify for and so forth.
Exactly.
But do you have a targeted number?
So on average, we're looking at it's about $7,400 per household. That's the average amount.
Well, let me ask you another way. So how many applications are still pending that haven't been yet processed?
Goodness, I know we have over 2,000. 6,000 applications.
Left.
6,000 applications still pending.
That's what I mean. Okay, so you've got those are county or city and county.
It's a combination of city and county.
Mm-hmm. Okay. Well, maybe a little more data. I know we're getting late, we're long in the hours here, but maybe a little more background regarding that. To what Sarah was just saying to you, I'd be curious to see, because again, if there's any way we can help facilitate making sure the use of it goes to the folks who need it the most. So, all right, thanks.
Absolutely.
Thank you, Supervisor.
So, moving forward, homeless response. One of the things the agency has stepped in is really overseeing and administering the opening of 3 shelters to house the homeless in 2020 and 2021. Most recently, the X Street Navigation Center opened in Sacramento to serve up to 100 people living on the streets in the surrounding areas and others who are homeless in Sacramento. Since the opening of the shelter, which has only been a few short weeks, there are 77 guests are in the shelter. The Meadowview Navigation Center opened last year in South Sacramento, and that one serves a capacity up to 100 women. Due to COVID, we were limited to the number of people who could be served, but now we have been working with the county, have been able to raise the limit, and we have 90 guests who are at the Meadowview shelter. And at the Meadowview shelter, 75 of those women have gone on to be housed already. The other shelter that we also oversee is a tiny home village, which is called Emergency Bridge Housing at Grove. This is for transitional age youth. There's a picture there of one of the young men who's there and talking about his experience, and pictures of those tiny homes. There are 24 cabins that are set up there, and since we opened that, 62 youth have exited the program and into housing. And then we'll also be working with the city on the expansion of that development as well. Moving on to homeless programs and permanent supportive housing, as you know, that is a huge focus and one of the priorities that you have set for us. And so one of the solutions is looking at how we can bring these projects online. There's a picture there of Sunrise Point, which is permanent supportive housing. It's now under construction by Jamboree Housing. It's going to provide 47 units of permanent supportive housing for homeless individuals and families. It's there in the city of Citrus Heights, the very first affordable housing that has been constructed since their inception. They're excited and we're excited. I got a chance to drive by and it is really coming to fruition. In addition, also in 2020, Courtyard Inn on Grove Avenue opened after rehab, and we have 78 units of supportive housing and 14 units of workforce housing. The next one is our Project Home Key that we have been working very hard on. In September, the state issued $1.45 billion of funds for Project Home Key. We previously, last round, was able to do the La Mancha project there, which is on La Mancha. And that's for homeless individuals. It's a partnership with Mercy Housing to serve 100 formerly homeless. We now are partnering on 2 new applications for Project Home Key that have been submitted to the state. One is Vista Nuevo, which was previously the Staybridge Inn, and this is in North Natomas. This will be for families, so they will have at least one minor child. And we will be working on that project. It's 106 units, permanent supportive housing. And then we're also going to have 10 units that will be for transitional housing. So we're expected to open that next year if we receive the funding. And then most recently, the last one is a project Central Sacramento Studios.
Excuse me, Supervisor Desmond has a question.
Absolutely.
Thanks, Michelle. Just on the Project Home Key, the project up in Natomas, that conversion, do those have kitchenettes? That hotel?
Yes.
Or they already do have kitchenettes. Okay, because you and I have had the discussion about hotels with kitchenettes, without kitchenettes. Some of this additional money, would it make it more feasible to actually acquire some of these hotels without kitchenettes? Is there additional money for that? Because you and I have talked about some hotels in District 3, for instance.
Yes. So you can proceed with one that does not have kitchenettes. So the way that we evaluate the hotels is kind of tier 1, tier 2. Tier 1 are the ones that have kitchenettes that are light rehab, and we can convert them quite easily. We can also attach vouchers to those units because it is a full apartment unit. And then that helps us with the long-term financial sustainability of the project. And we also have this deadline by the state that we have to get this thing done within 8 months. So the second tier is those that do not have kitchenettes, where we have to do an additional amount of rehab. So we're looking at the financials, what the acquisition cost is, and also the extent of the rehab that can be done. And so the Central Sacramento Studios is one that does not have kitchenettes. They are all 1 bedrooms, but they will go about that transition. It's in fairly good shape, so it'll be an easier conversion for the kitchenettes.
Okay. Well, thank you. So, maybe with additional funding, maybe we can take a fresh look at some of these opportunities that might pencil out now. So.
Absolutely.
Okay. Thank you.
Absolutely. I know I was talking about all those billions of dollars that's floating around. Obviously, we want to put them to good use. So the next one, and I just have a few more. I know it's I'm just trying to get through so you guys can get something nourishment. So the next one is our affordable housing production, and this shows the amount of money that we have actually committed through our multifamily loans and mortgage revenue bonds over the past year, and the funding that we project for the county and city. This is not counting any of the Build Back Better that I talked about originally, but you can see on the county side typically what we receive for housing, and on the city side. The next one, this is showing the number of units that we have completed and what's under construction, and then what's in the pipeline. So of the ones that have been completed, you can see, there's rehab that we did on the Shasta Hotel, but Courtyard Inn, where we had some new units, La Mancha, also some of the projects from Public Housing and RAD. And then under construction, there's 652. I have to move one from one category to the other. So we had Mutual on the Boulevard in the pipeline, and it's already, they told me today, moved to under construction. So we're really excited about that. So 652 units, of which 392 are permanent supportive housing. And then those in the pipeline, and these are ones that we're still continuing to work on, still continue to seek all of the financing and mechanisms to bring them together. But the funds that we were talking about, additional funds, could definitely give these a shot in the arm.
Excuse me, Supervisor Cerna.
Thank you. So in the pipeline box there, you have Marisol Village phases C and D. Or I don't know if those are phases or just parts of the project, but those, I assume those are the areas where we still have the outstanding need that we've talked about so many times. Is it possible that if we find ourselves up against a wall with what HUD is requiring in terms of identifying secure funding. Could we hypothetically take the balance of, or a part of the balance of the first tranche of federal assistance from the county and the city, and use that to either secure all of it, or more likely to just better position us to find other funding for match to complete it?
Yes. So we did reach out and talk with our attorney, who also consulted with county council about the use of the American Rescue Plan funds for this purpose, and they did say that it was an eligible use.
Okay. But in terms of, going all the way back to the other slide presentation, or the earlier one that had the two tranches of federal assistance for SHRA, would we necessarily have to tap into the cities and the counties' separate allocation of ARPA, or could we use the agency's balance of ARPA, I guess is what I'm asking.
Okay, so the agency ARPA is not a part of that chart. I think the chart, if you could go back just a couple, is this one here? Oops, is it this chart?
No, way back. There you go. Round one, round two. So I guess what I'm saying is, can the balances that are, maybe advance the slide one more. Yeah, can the balance of this, could it be used?
So this money here is only to be used for the emergency rental assistance program.
Got it.
And not for the infrastructure or capital for Marisol.
Mm-hmm. Okay. Thank you.
Yes. But to the extent that the city or county want to allocate any of those funds, they can be used for the Marisol. And that's what the attorneys did opine.
Okay, good.
Okay, so then just a couple of more slides. The Public Housing Rental Assistance Program, a demonstration. This is where we are transitioning from one platform to the other, so that we have resources and we can leverage that. We finished our pilot last year, 124 units. We'll be looking at our next round, which will be 2 elderly high-rises downtown, and continue to work methodically through our inventory so that we can do the level of improvements that are necessary. Obviously, if there are additional funds, then this will accelerate our opportunity to get those units transitioned over. And then our last 2 slides are talking about Marisol, so which I was just gonna go over that this is formerly Twin Rivers, and now for anyone who's driven by there, they can see all of the work that's going on. It was one of our oldest properties in our portfolio, built in the 1940s. Systems, infrastructure reached the end of their useful life. We did go to HUD and we received a $300,000 planning grant. And then from there, that positioned us to receive a $30 million Choice Neighborhoods Initiative implementation grant to do the work. So today, with the help of many partners, stakeholders, and residents, we're looking forward to opening Marisol Village. At full build-out, there will be 487 units there. The housing is designed to include affordable units throughout the development, so there's going to be a mix of affordable workforce and also market rate units. It will be complete community with a lot of amenities, management offices, community rooms, swimming pool, barbecue, huge park in the middle of the development. So we're very thrilled about all of the things that we've been able to leverage here. We've been awarded $1.8 million green infrastructure grant for the park. We completed construction of the park, and there's a huge community garden. We started construction on blocks A, B, and E, so 3 of the 5 we're into construction, and we've completed some of the community projects, which is Salvation Army Center of Hope. There was a patio and shade cover. So when we talk about Mirasol, it's not just the buildings there. It really is rebuilding an entire neighborhood. There's mural art. I don't know if you've noticed that as you've been driving down 12th Street. All of that is absolutely gorgeous and part of this particular project. New bike lanes that are being installed. It really is transforming that neighborhood. So looking ahead to 2022, we looking at completing the construction on A, B, and E. We want to start construction on Block C because we received funding from the state's accelerator program. So that project that block is good to go. And we have our last block. Our last block is Block D, and there's about 116 units. We're applying for funding from the state, but we must get through the financing, get it under construction before September of 2022, because that is our deadline with HUD. And it is not a deadline that can be moved. It is something that literally Congress would have to make a change. So that is what we're looking at in 2022, as well as construction of an early childhood learning center. And we'll be welcoming our former residents back, about 110, we estimate, out of the original 218, will be coming back to make Mirasol Village their new home. So with that, we're now leasing. Anybody who's interested, there's the contact information there. We already received over 1,000 people on the interest list for Mirasol Village. I'm available for any questions you may have.
Thank you. That was a great presentation. Supervisor Natoli has some comments.
Yeah, I'll be brief. Thank you, Madam Chair. Thanks, Lachelle, for your presentation. I know we had a chance to brief over the phone, and just wanted to highlight something that came out in our conversation briefing, and that is that I know we're paying a visit tomorrow to Mather Community Campus to take a look at, current state of facilities and, and get a little bit of understanding about some of the needs. But I also know, and I asked you the question, but I wanted to make sure it was out there, that with the housing money that's coming down, that there are VASH, which are the vouchers for veterans that become available from time to time. And by the way, compliments to Sarah on behalf of the agency. Did a very nice job at the dedication a couple of weeks ago of the 3 phases of Mayfair Veterans Village. But with the community campus, so you've got 30 acres there. We obviously have some other acreage, and I know that Ann and Troy Gibbons and others have been in conversations with the city of Rancho Cordova, where a lot of the properties currently are the vacant properties the county retains ownership to. But I think there's some opportunity, as you've talked about, both the money in the infrastructure bill, obviously ARPA monies that are going to come down to the county, and we'll have that conversation today and going forward. But it's encouraging, and I guess I just wanted to know, are there currently, which are the project-based, which are important? That was important to Mercy Housing, to the nation's finest, the city of Rancho Cordova, the county, and other partners at Mather Veterans Village. Are there currently vouchers available, or do you anticipate additional tranches coming through of those? Because that was key. That was, again, you and certainly Christine and Sarah and others in the agency were very much on point when we were trying to get that project put together. But as we're looking at the potential for maybe doing something additionally out at Mather that could be a complement when we have services available, certainly available to veterans. We know there are any number of homeless veterans, and certainly the permanently supportive units are all filled up out there, and they've got, I think, 47 transitional unit spaces available, and I don't know how many of those are currently occupied. So I guess my question is, though, is that what does it look like on the voucher front? Because again, it's one thing to get money to construct, but to have that permanently guaranteed income with our partners for rental, I say permanent, but it's for a good length of time in order to do the financing. What's the horizon look like as far as our landscape?
Right. So you are correct. This is probably the only way to reach those deep levels of affordability for a long period of time is to look at vouchers and project basing, which is why the priority for project basing that we do is only for homeless projects in the city and the county. VASH is another opportunity and a separate tranche of funding that we continually receive additional allocations for. And it's based on the fact of looking at the population and the number of homeless vets in our area. And if they still see that that number is either constant or going up, then that's why we get additional VASH vouchers. And as you know and recall in the previous process, then we work with the VA. They have to give the green light. And if they do, then we can go ahead and project base. So yes, the answer to your question is there are VASH vouchers that we could look to project base.
And when 25% of our estimated homeless population, I've seen different numbers, but it's certainly in that range, a full quarter of the homeless, and I trust most of those are individuals, maybe some families that are amongst them as well. That's a significant number, and if we could certainly, make some inroads as it relates to certainly to permanent supportive housing, but and to have those units available, I think it could begin to make a difference. And so, I'm encouraged by that. I don't know where we are with the discussions regarding the property, situation, but I. Again, I'm hopeful, and I know Bruce, I think you and Emily and myself and Ethan and others, Supervisor Desmond, are going to take a look. So, you're certainly welcome to join, but this is kind of just preliminarily to look at the layout out there. But I'd like to see us be able to maybe do something else, and obviously it's going to require a lot of work, but at least set in motion an opportunity to build upon, I think was really, really a tremendously well supported, well accepted, and a well needed, I say first step. There's 3 phases to it, but 150, just a little bit shy of 150 spaces available for folks, making a difference. One other thing I just wanted to ask about, certainly help with the discussion we're going to have here in a few minutes. So the funding streams you're talking about are separate and apart because we did this community survey, and we're going to talk about it with the next item on the American Rescue Plan, and housing homeless that came out, very high in that prioritization, and we've got a recommendation coming forward from the county executive as to how we might at least initially allocate the first $150 million. Are we able to combine? I mean, it kind of goes to Phil's question a moment ago, as it relates to Mirsal Village. Are we able to combine those funds, and who's taking a look at that? We're going to employ folks here in the county side of it. I mean, SHRA, you're a key part of that, and I think strategically, for dollars that we have discretion on, housing dollars aren't going to be able to be applied elsewhere. The ARPA money could to the categories that are funded for the money that comes directly to the county, and so I guess I want to make sure that we've got that alignment, and we make the best use, certainly from a discretionary standpoint, of the dollars that we'll have available. And it sounds to me there's going to be significant dollars coming down, at least as anticipated, through the agency, to the various funding sources. So any thoughts on that? Either one.
Well, I'll just say one, and I'll toss it on over to Ann, is that yes, you can use it as a part of the financing stack and leverage other resources for housing.
Okay.
And at the last meeting, Lachelle and I talked briefly about really needing to work together on the housing piece of this. I mean, we can do a fair amount on homeless services, but we really need Lachelle's help on the housing piece of it.
Well, and I think that as we're going to hear and have already heard and going to hear more, the demand for the dollars that are available and in how folks may see it differently, but certainly the variety of things that can be used with the rescue plan monies, where the housing dollars will be limited to housing and related types of services. I just think it's going to be imperative, as for much as we know at the point in time we actually, pull the pin and say we're going to, do these dollars or do these projects. And so I guess that integration, and I don't know from a staffing standpoint who's on point for you. I know we're going to give you additional help in the exec's office in the county and to help our community. I think that's just key, because housing projects can take a lot of the available dollars, and if we make the right decision, we go forward, but we found out we could have used these dollars over here, and we could have made them available for other services within ARPA. And I think that will be really helpful to the board. I know it will be to you, Ann, and your top executive staff, but I just see SHR is got a key role in this housing piece of it, as well as in some of the homeless services. Obviously they're working directly with providers as well. So
I totally agree with you, and Mr. Wagstaff will be point person for the county to work with Lachelle and her team.
You didn't have enough to do, Bruce.
I know. We just keep piling it on.
Okay. All right, good enough. Thank you. Thanks for your presentation.
Thanks, Supervisor. And at this time, we don't have any other supervisors in the queue, so I'm going to go ahead and open public comment. We do have some, we do not have any, actually, I'm opening a public hearing at this time. We don't have any public comments in the chambers, but we do have some phone calls.
Sorry about that. We have a couple of callers. Could you please transfer the first caller? I'm going to ask staff to transfer the first caller. Hi, caller. Please start with your comments. You have 2 minutes.
Yes, hi. Is this the Board of Supervisors, Sacramento?
Yes.
Yes, hi. My name is Trina Latch, and I'm calling in from Placer County. And unfortunately, I was not able to hear some of this hearing, but I would like to make a public comment as far as the reason why we're having so many disparities and medical issues and crises is because it's been self-inflicted by this administration and government. We should not be celebrating a medical state. Okay, we should be helping people get back to work. That is what's causing all of this. Is the people that are lacking working or getting a job because of forced illegal mandates upon us. This needs to stop. It is a crisis because you guys are forcing this to be a crisis. Okay? And again, we should be encouraging people to go back to work and trying to get everybody on Medi-Cal. Okay? Government enforced social programs. All right, thank you for your time, and I will be calling back later. Thank you.
Thank you.
Staff is going to be transferring one more caller. They had hung up and they called them back, and so they're working through that right now, so it should just take a second.
Sure.
Hi, caller. Please start with your comments. You have 2 minutes.
Hello, everyone. This is Mike Kelly. I'm a local affordable housing developer. From what was presented and what's posted on SHRA's website, it appears that for the January 2021 round, there was approximately $7.5 million that was available to be deployed in the county, while only about $1 million of it was encumbered with an invitation to a full application. The subsequent round, however, which is in August, indicates that there were no funds available in either the city or the county. And I just want to make sure I'm interpreting it correctly because it appears that roughly $6.5 million should roll over. So my question is, I would just like to know if these funds have been deployed or if they will roll over for the upcoming December round. Thank you for your time.
Thank you. Do you want to speak to that, Lachelle?
Yes, those funds have been allocated to the projects when you saw the ones that were in the pipeline.
Mm-hmm.
So those are the ones that they have received that allocation, and that's why we did not have any funding left in the last round.
So they were applied
Yes.
and allocated?
Mm-hmm. Yes.
Great, thank you. Do we have any other callers?
I'm checking one more time, and we do not, and I'll go ahead and close the public comments now.
Okay, and I will close the public hearing and refer back to the board for a motion to approve the resolution and the
I
budget.
move the item.
Second.
We have a motion by Supervisor Natoli and a second by Supervisor Cerna. Please vote.
Unanimous vote.
Thank you, Lachelle, and everyone from SHRA for all your hard work. We've referred a lot of people to you. I know you've been busy. Thank you for all that you're doing to help us and the people in our districts. Okay, at this time, we're going to take it's a quarter after. We have 15 minutes. We're going to take it. So this meeting is recessed until 3:30. This meeting is called back to order, and I want to welcome everyone back. And we'll just move right into the item 40.
Okay, I'll establish a quorum really quick. Supervisors Kennedy, Natoli,
Here.
Desmond, Cerna, Frost,
here,
and you have a quorum. Okay, so item 40 is the approval of the American Rescue Plan Act proposed Phase 1 funding allocation.
Good afternoon. Ann Edwards, County Executive. I am pleased to present to you today the county's proposed Phase 1 funding allocation of the American Rescue Plan Act, also known as ARPA. With me today from Deloitte is Damon Armani, who can answer questions about the specifics of the act, as well as additional federal and state funding resources. Sacramento County's full ARPA allocation, as you know, is $300 million. We did receive $150 million in May of this month, and we are anticipating receiving the second $150 million in May of next year. The key focus of ARPA is on COVID recovery instead of COVID response, as was the focus of the earlier CARES Act. Therefore, we have created a vision in Sacramento County that supports investments in recovery for residents, businesses, and communities, focusing on equity to disproportionately impacted communities. We want to make smart investments that will maximize the impact of the ARPA funds, and we also want to keep this in mind as we develop and invest in programs and services, and be aware that allocations must be obligated by December 31st of 2024, and funds must be spent by December 31st of 2026. All ARPA allocations can be spent for purposes that fall within these overall categories: supporting public health expenditures, addressing the negative economic impacts caused by the public health emergency, replacing lost public sector revenue, providing premium pay for essential work, and investments in water, sewer, and broadband infrastructure. On July 27th, this board approved identifying priority issues that aligned with the results of a community survey. In ranking order, the top 4 priorities were housing, homelessness, health, and economic response. Those were followed by essential workers, infrastructure, education, and broadband. We are recommending investments in the top 4 priorities as they address the most immediate need and take the most time to establish. The first 2 priorities recommended for ARPA funding allocations are housing and homelessness, and we will assist those who are experiencing homelessness or who have fallen behind in rent or are in need of affordable housing as a result of the pandemic. This will cost 39% of the available allocation. We can invest in a variety of programs and services, including permanent supported housing, transitional housing, shelter, and sanctioned encampments with support and sanitation services, as well as community safety.
Madam Chair.
Excuse me, Supervisor Cerna.
Sorry, I don't mean to interrupt your flow, Ann, but I just want to be clear, because it's the first slide of several that you're going to make reference to a percentage of available allocation. That is, that percentage applies whether it's 150 or 300?
Right now, we're talking just about the first 150,
That's it?
and we will have additional conversations about the second tranche later.
Got it. Thank you.
Mm-hmm. So the third priority recommendation for health will assist those experiencing health impacts from the pandemic, particularly to underserved communities with lack of access to health care. This will cost 13% of our available allocation and allow investments in COVID mitigation efforts, mental health and substance abuse treatment programs and services, meals for homebound seniors, and access to health care for marginalized communities. The fourth priority recommendation focuses on economic response and will assist businesses and workers directly impacted by the pandemic, especially those in or those who serve low-income communities. This will cost 13% of our available allocation and allow investments in direct assistance to small businesses and nonprofit organizations in unincorporated Sacramento County, funding to CBOs to support businesses, and grants to chambers of commerce and PBIDs. In addition to these recommendations, the board has authorized premium pay for eligible county employees. ARPA rules describe essential work as on-site with regular in-person interactions with people or regular physical handling of items that have been handled by others. Premium pay for essential workers will benefit eligible employees of Sacramento County who performed that essential work between the beginning of the pandemic and to the present day. This will cost 8% of the county's available allocation and will compensate county workers who must be physically present at the job site and prioritizes compensation to those income-eligible workers who performed essential work. We have begun scheduling meetings with labor organizations for further discussion, so these are high-level details at this point. So administrative costs are essential to minimize the risk to the county and ensure a grant management program and assure program and fiscal integrity. Our contract with Deloitte is included in these administrative costs. And while county staff will ideally administer the program in the long term, Deloitte will be in place to ensure that we scope and implement projects in compliance with federal rules, maximize our use of eligible funding sources, establish appropriate monitoring and control procedures, and provide expertise when more complex issues arrive. This will cost a maximum of 10% of the available allocation.
Excuse me, Supervisor Kennedy.
Thank you, Chair. And we talked about this already during briefing, but I wanted to ask publicly, that 10%, is that a normal number? Is that within the margin of what's typical for these type of administrative costs and what the industry standard is?
It is very typical, yes.
Okay. Thank you.
Thank you.
And finally, the district allocations will account for 17% of the Phase 1 ARPA funding. And staff will be reaching out to your offices individually very soon to begin conversations about the mechanics of this process. The remaining priorities that were not addressed in this Phase 1 funding allocation proposal, infrastructure, broadband, and education, are covered by various state and federal legislation, and there are a lot of them. And Damon is here and can answer questions you have about those items as well. ARPA does allow local government funding for revenue loss. However, the county has not seen significant losses. We will continue to monitor this through 2024 so that if we do find that we have those, that we can look at that option as well. So what are our next steps? We will begin bringing project recommendations before the board between now and the end of the year and throughout early 2022. We will be providing regular reporting to the board on ARPA status updates. Of course, we'll receive an additional $150 million in May, assuming there are no changes to that. We'll provide website updates with regular reports to the U.S. Treasury for spending and outcomes. And that actually concludes my presentation, and I'm happy to answer any questions you have, and Damon is here as well to assist.
Thank you. Supervisor Cerna has some comments.
Thank you. If you can go back one slide, please. I'm not sure if this is best directed at you, Ann, or Damon, but do we know yet if there is a cutoff date after which any revenue losses cannot be accounted against this?
I do not know.
There's no functional cutoff date. So it's December 31st of 2024 and whatever finance period occurs before that. So if you see a revenue loss at any point between now and then, you'll be able to reallocate funding as long as you're able to report it and everything else.
So literally up until the deadlines for us to appropriate and spend, we can account for losses.
Based on current rules, yes, sir. Just remember it's an interim rule. So, and we do expect Treasury is going to tighten up revenue loss a little bit.
Got it. Thank you.
Yes, sir.
Thank you.
Thank you. Supervisor Desmond.
Thank you, Madam Chair, and thank you, Ann. And you and I had a little bit of a conversation about this yesterday as well. You know, when we talked about this several months ago, one of the priorities that we identified was infrastructure, and I guess when I was thinking about the affordable housing piece of this, I was kind of putting the infrastructure with that, with the thought being that, look, we have a lot of infrastructure improvement needs that would, I think, open up areas for more affordable housing, you know, infill development projects for affordable housing. So I just want to know what your thoughts are on that, because I look at some of the areas we've talked about in my district, you know, North Highlands, areas like that up there where they desperately need more housing, but the infrastructure, the aging infrastructure is such an impediment to that. The developers know how much it's going to cost them to build there, and so that dissuades them. So can you give me a little bit of your thoughts about that?
Yeah, so if we were planning, let's say, a new affordable housing project in one of the areas you're talking about, and infrastructure was needed to be enhanced in order to make that happen, we could actually do that with this allocation strategy because it's so tied to the creation of affordable housing. If it's unrelated to that, we really are hoping to wait and see what the infrastructure bill has to say in it about infrastructure and many other components as well before we dedicate money to infrastructure. But it is something we could relook at in the spring if it's pure infrastructure.
Okay, but okay, so talking about it again in terms of a specific affordable housing project we want to attract, under those circumstances, you would envision maybe using it under that 39% category.
Yes, we could do that.
Okay. The other question I had that I'd mentioned to you, you know, we heard from a lot of park districts. I have 9 different park districts in District 3, and obviously they took a big hit during the pandemic in terms of lost revenue, and we're just required, I think, to perform a lot of additional services. Where would we be able to provide some relief for park districts, for instance, in any of these categories?
So I think that would fall under the economic response. So we're talking about businesses and communities that suffered economically as a result of the pandemic. So we could probably fit that in there. And I'm just going to look to Damon to see if that's actually appropriate. And
Generally, yes.
Yes, okay. And then the other option is your district allocations. That would be another option to support that as well.
Okay. All right. Thank you.
Mm-hmm.
Thank you, Supervisor Desmond. Supervisor Natoli.
Yeah. Thank you, Ann. And again, each of us had a chance to ask some questions in briefing. Just to touch on the infrastructure piece, one part of that I think should be examined a little more closely is that if there are specific projects that would qualify, and again, many of these would certainly, I say many, some of those projects could help in neighborhoods that are either underserved, have challenges because of infrastructure, water and sewer particularly, and it might be that the county is not even necessarily the purveyor. It might be the water agency, but if it's out in, just for example, in Supervisor Desmond's district where you have a couple of different water purveyors, but by improving that, either fire flow or the quality of drinking water, but some of that's going to require some engineering and at least some feasibility analysis. And the concern I have is that not to certainly upset what the recommendation is here, although ultimately we're going to have to prove it, is that, if there were some, again, I don't know all the lists. We saw some of those come through, and you had internal submittals, and, each of us got, letters from different organizations, different agencies. But I guess what I would want to know is that if there were some potential projects that needed to have either a feasibility analysis or some preliminary engineering around them to do that now. But otherwise, my concern is, I shared this with you, we lose 8 months, potentially. And then, the infrastructure has a little longer timeline on some of that. And I guess I would want to know sooner rather than later if we think we have some viable projects that could compete, then if so, let's put a little bit of money or potentially allocate some money so that we could get our arms around that. And I mean, you're gonna have certainly analysts in your office and the assistant's office at Deloitte for contractual period. But rather than just delay and say, well, we're going to see what's going to happen with the national infrastructure bill, which again, that's going to include a whole lot of other things besides water and sewer and broadband, and not to take away from the dollars we have in this current tranche. But I guess I'd like to see maybe something around that, so at least we could have some examination. And I don't know who's going to do that. I mean, again, I don't even know what the list is of the menu thus far from people who have submitted. I'm sure you've gotten dozens and dozens of letters.
Well, we have probably hundreds of, not
Okay.
just specifically to water and sewer,
No,
but
I know.
hundreds
Yeah,
of proposals, and we're in the process right now of sorting all of those proposals into these funding category areas, so we'll have a better sense of what that is. And these recommendations before you today are really a direct result of the community survey. These were the highest priorities identified by the community survey, and we do have future opportunities to look at infrastructure. And of course, if it's the will of the board to move some money from one of these categories to infrastructure, that we will certainly do that for you.
Well, I guess to my point, it was, though, some of these might require some additional lead time. And if you're sorting into a batch, and we know we have X, that have nothing else to do the examination, so we're going to know either we got a project or not, depending upon funding availability, in the next round or maybe other rounds of funding. That to me would be at least the level of examination that could inform whether it was prudent, and even for the one of the five of us who might have a project, in the district, to know, what the timetable is, what the costs are, what other matching money may be available. And so I took that one subset because that pertained to the infrastructure, and was specifically called out water and sewer and broadband in this legislation. The other thing I wanted to ask about then is, I know we've heard from folks who, nutrition providers, obviously some restaurateurs that have stepped up during dine-in program and dine-home program and Great Plates and so forth, and some of those have some challenges because funding is either they raise some private sector funding, they're beginning to run out, and the continuity of that. When would you anticipate? And I don't know, maybe some of these categories are going to be acted upon more quickly than others, but that one falls clearly under health, and I guess community benefit, maybe some economic recovery as well. But how soon would you be able to react so we can take a look at funding some of those programs that we chose to do?
So that process is underway right now. We are, as I said, putting the proposals into categories, and then the deputy CEOs along with department heads are going to work through those as quickly as possible to get something before you as quickly as possible. As I just said earlier, it's hard to believe that December is right around the corner. We're hoping to get some project proposals to you in December, but certainly by the first of the year, and some of them, as you said, will work more quickly than others.
Okay. So on the economic response, the 13% would amount to how much money, roughly?
$19.8 million.
So about $20 million. Is it anticipated that these would just be direct assistance via the form of grants, or is the opportunity, if we have some businesses that are trying to recover, they may see the prospect of doing better or starting to come out of it, but could certainly use a low or no cost loan, so to speak. It requires another level of administration. Are we able to kind of cycle these monies while we have possession of them, ultimately having to expend them by a certain amount of time? And my question is, I guess, if you had a business that was in transition and it would assist them via a loan, I mean, and versus a grant, and assuming in good faith intent, they could repay it. So just example, $50,000 would help them acquire something, some new equipment so they can, gear up with their new business plan. But they're willing to, rather than go through all the other machinations of securing a loan, but it would help them grow their business, and they could repay it to the county in a certain amount of time. Is there anything like that envisioned, or is that completely out of the question?
So one of the challenges with that is that the county is not a lender or a bank, and we don't necessarily have the expertise to loan money. If we were to go that route, and again, I'm going to look to Damon to
Yeah.
tell me if I'm off base
Yeah.
here, is we'd probably be looking at contracting with a bank or something of that nature to do that work for us. But we were primarily envisioning grants and things to small businesses to help them get back on their feet, or to help them sort of reimburse them for all the expenses they had during COVID, and then technical assistance as well, to help them get back on their feet.
Sorry. So from an administrative standpoint, your grants are always going to be better. Let's assume for a minute you already had a bank or some other financial entity that could help you manage the loan. You'd have to have it all repaid and then respent by December 31st, 2024.
Right.
And so and then if you did have interest involved in it, it creates an additional administrative layer.
Right.
So I would encourage you, just from my seat, to go with grants wherever possible, and use loans only in those rare occasions where it is the only way really to get after it. And then as long as you are providing that loan for an otherwise allowable expense, then if for some reason they don't pay back, you
can
guys
forgive
are
it.
okay.
You could forgive it, yeah.
Right.
Well, the reason I asked the question is, again, most folks are not going to look a grant in the face and say, no, I don't want to do that. But there are, some, folks who, say I could use the help and it would be immediate, but a short-term loan would help me bridge whatever I'm doing, and again, I'd like to repay that, and I could give you the assurance via whatever instrument that I could do that. I don't know that we make a regular practice of it. I'm just thinking about some folks though that they retain some independence. Granted, it's their tax dollars at work, but they might, choose to participate, but want to pay it back. I can't imagine that's, certainly majority of folks, and to your point about administrate, I get it. But there is the ability to do, you just got to spend it all by 2024. So if you did stuff like that, do you know of any jurisdictions, David, that
So we know of, I know of one state level jurisdiction that is building a program similar to that. I will tell you that the administrative cost side of it is a lot higher than they had planned for. Approaching around 18%.
Wow.
Which is not technically unallowable, I want to be clear, right? So 10% is the sort of industry standard in this universe. You can justify more than that if it is truly that complicated, right? But when you start going above 10%, you start attracting attention. And when you start building loan programs, you start attracting attention. And with 17,043 recipients, right, the goal is to not attract attention. Right? Because then you only get the desk audit, and they say, oh, yep, they got good controls, they got all the right processes and everything. They move on to somebody who's doing something flagrantly in violation, like some of the other counties in California.
So maybe going back to the housing question before the break, if we have monies and we say this is a local grant program, but obviously Small Business Administration, there are other dollars that your firm's helping us track where some other dollars could come to this community that could be of assistance. Could we use that as stand-up money or earnest money to, again, via a grant that could then help folks either secure, additional lending, whether it's the, public sector through SBA or private sector, is that those eligible and allowable? Where again, down payment, for example, on something, or allow them, to finance. Some of that will be private transactions. But I'm just curious, but bringing more money to the county, saying we're going to have a program over here, and whatever comes through USDA, through Department of Commerce, whatever it might be, and we're going to have some of this money over here to help our local businesses obtain more, and we'll kind of grant them that earnest money to get their feet in the door and get them to the front of the line. So
it fundamentally depends on what you're providing the loan for, right? Whether or not that in and of itself is an allowable expense, and exactly how you construct it with relation to any other federal dollar.
Okay.
Right. So to go back to when I very first talked to you guys, some can be mixed, right? Some of them are like the Ghostbusters, right? You don't mix the streams unless you want to watch the Marshmallow Man explode. Like, it's just bad. And so what you want to do is you want to figure out exactly what you want. So if you came to me and said, Damon, we want to build this housing development, we want to do these things, here's the amount of private investment we get, here's the amount of other federal grants that either through CDBG or the other programs that are coming, how do we construct a program that is compliant with ARPA? And my people are going to sit down and do that, right?
Okay.
And then we do work with an economic development group in another location, and we're doing a lot of mixing private investment with public dollars. And that's like, if ARPA is considered master's level work, that's like PhD level complicated, right?
Yeah.
But it's happening all across the country, and we're starting to see entities trying to procure us to do that work, which tells me it's spreading.
Do you see in other communities, again, we have, a lot of the national financial institutions obviously are reflected here in Sacramento. We have some other more local lending institutions. And if we, either for housing or maybe for a business investment, but, talk with our financial community and then as you were kind of describing, I was just thinking that you may build a program. I'm not making it too complicated, but here we're in for this, and if this person qualifies for X, here's the package, and you not just mix and match it, but you actually provide, I guess, for lack of a better term, I said down payment, but you provide, some dollars to go to to allow folks to recover, and and obviously people are challenged with hiring and so forth, but we're talking about some of the acquisition costs, the costs that they took on, help repay themselves and so forth. So I'm just curious, is there anything innovative like that?
Yeah, so we are seeing down payments for facilities and other things in order to secure larger financing. Again, as long as the thing being the down payment's going for is otherwise eligible, right? So you can't necessarily use it to, I don't know, have an offshore oil rig, right? Just to pick something sort of, right? Like that's unallowable. So that wouldn't be okay. But there are other things you can put an investment in, especially when it comes around housing. So if you can tie it to housing insecurity, food insecurity, Clean Water Act, Drinking Water Act, then it's going to be fine as long as you manage the eaches of it correctly, right? Like it's just because it's allowable doesn't mean that the road you take to get to execution stays allowable the whole way, right? That's the trick of it. And you guys are going to start seeing news articles early next year and mid-year about already the OIGs coming and forcing entities to repay money, right? So they're mostly done with the CRF audits.
They're doing what? They're forcing people to
repay money.
From the CARES Act?
Yeah, CARES Act and starting ARPA desk audits.
Oh, starting ARPA, sorry.
Yep. So it's going to be all over the news. I think a lot of people that made mistakes in CARES will be forgiven because of the nature of a response effort, and it was first, y'all just didn't have time. To do it correctly. But
we did it correctly. We took the heat for that.
Yeah. But ARPA will be a very different program, right? Yeah. And you'll see a lot of things in that space. But yeah, I would expect you to, based on the news I've been reading in general and listening to my buddies back home, it's coming.
All right, that's questions I have for right now. Thanks.
Thank you, Supervisor Cerna.
Great, thank you. I suspect, Madam Clerk, we probably have a number of folks that are in the queue.
We do have quite a few in the phone queue, and I think we have one or two in chambers.
Okay. So before we hear from the public, I do think it's important to acknowledge kind of what this is today and what it isn't in terms of the presentation and what's before us. And so I just want to confirm my understanding of what you've prepared and put before us and have for the public to respond to. When you have these percentages that are associated with the very broad categories, at this point we're not talking about specific projects, obviously, or initiatives or programs. We're talking about very, very general subject areas. However, when it comes to something like, I'll just use housing, homelessness, and health, especially when we're talking about mental health and behavioral health, it seems to me there's going to be an awful lot of discretion that will have to be applied by someone. I assume it'll be a mix of your team and this board to determine if we're moving forward. Let's say that these percentages are blessed today, and we're off to the races. At some point, there's going to have to be a process where we're going to have to gauge each of those programs as they do come in detailed form or initiatives and say, well, this is really more about homelessness versus mental health. However, it may be elements of both, and maybe even all three when you're talking about maybe some, permanent supportive housing with a mental health or behavioral health component, for instance. So can you maybe shed a little light on how you envision, with the assistance of our consulting team, how that will play out? And I know things will have to adjust, and there's some organic parts to this that no one can really foresee at this point. But just given the nature of the categories, I just see some of this being very, very flexible.
So that's actually a great question. And yes, first of all, let me be very clear that we will bring every proposed project back to the board so that you can affirm that that's what you would like to do. And we will be having conversations with you along the way. We're also going to bring in departments to really look at, what their needs are. We're looking at the community proposals, and so that we can blend all that together to create projects that make sense for this community. But in relationship to the overlapping funding sources, because you're right, there are going to be some overlap. And what we will just have to do is really plug in, okay, how much of this program is mental health and substance abuse, and how much is housing? And we can take money from each of those categories and blend it together to create a program. And we'll be doing a fair amount of that, I imagine.
Okay. That's kind of how I assumed this would be. It was, you'd have some, I don't know, weighting's probably not the right term, but you'd have some mix of sub-percentages of each category that together, can fund what we see as viable projects and initiatives. And then on top of that, of course, in terms of the district-wide allocations, and I know that too has got a parallel process ongoing to determine the kind of separate but similar process that each district will engage with the executive team and the consultant. But perhaps that might be considered at a different scale, or at least just because it's a smaller universe of total funding. That's at least one way to look at it. And then, of course, when we had the hearing on September 28th to discuss the merits of this proposal, we also made reference to the fact that it could be used for matching, and not just matching with the percentages you've given us for the different subject areas here today, but matching with regards to other sister jurisdictions that have their own ARPA allocation.
So not only for the district allocations, you too can work to blend resources in the categories, and you're not limited to the 4 categories that we are proposing. You can use any of the approved categories, and you can use money to partner with other jurisdictions as well. We can all use money to partner with other jurisdictions, and I assume that we will absolutely do that.
Okay, very good. Thank you.
Mm-hmm.
Thank you, Supervisor Cerna. On the categories that we're deciding on today, can they move at a later date, or can we make adjustments based on what may unfold, based on what we see ourselves needing?
Well, when you make decisions today, we will be using that decision to guide the development of our projects. If for some reason we can't spend what we had anticipated in a certain area, we would come back to you for potential adjustment. But when you decide today, these are going to be our marching orders about the percentages of funds in these areas, unless something drastically changes.
But I'd like to follow. Can I ask a follow-up about that?
Yeah, sure.
So, but for the second tranche, say for instance, you want to, hey, look, we need to put 50% for homeless initiatives and affordable housing. You could make the adjustment then.
We absolutely.
Okay.
These allocations are for the first $150 million, and we will revisit in May or in the spring how to spend the second tranche of
We'll
money.
basically have this hearing in the spring.
Yes.
Yeah.
Yep.
And
And we might do some additional community outreach as well.
Okay, thank you. Supervisor Natoli.
Yeah, just a follow-on question, and I guess I didn't hear the answer. So as it relates to the park districts, Ann, because again, I've heard from some of those too. I don't have the number of districts that Supervisor Desmond has, but they didn't receive any of the CARES money, and I know we at least held out the opportunity under ARPA that we would consider that. So where did you say that would fall within the framework here?
Economic recovery. And we do have multiple proposals from multiple park districts that, as we sort them, we'll be taking a look at those. And then as well, if you chose to do something in your own district, you could use district funds for that as well. But it does fall under the economic recovery category.
Okay. And then as it relates to the essential workers, those are negotiated distributions, assuming we approve what's before us here. Is that right?
We will be having discussions with our labor organizations around that topic.
Okay. Are we having any of those currently?
Some of them are scheduled. We
okay.
have not had them yet. We wanted to have this discussion with you first,
Okay. All right.
but those will be coming soon.
Okay. Thank you.
And are there other conditions to the money outside the categories at which we can grant and the audit requirements?
I'm not sure I understand the question. I apologize. Can you say that again?
Well, I went to the Treasury website that outlines, the allocations and the funding and everything. I'm wondering if Deloitte can say are there other conditions that we have to basically agree to in order to get this money?
So in the state and local fiscal recovery fund, no, not particularly. The minute you spend $1, you're agreeing generally to this idea that you're going to comply with 2 CFR 200 and every other code of federal regulations that applies to it. There's not like a attestation or something of that nature that you would need to agree to. Now, there are other grants that are coming from ARPA that will require you guys to produce a plan and show that you can maintain compliance and all those other kinds of things too. But this is
compliance on how we're spending the money?
For example, Damien, give us some examples, other monies that are coming. I didn't mean to interrupt, but I just...
No, it's all right.
No, so like previously there was a grant that came out of the CARES, and then the CAA sort of provided additional funding that was related to a healthcare need related to schools, right? And so what they said was before we allocate the funding, the applicant, i.e. you, would need to show that you have a adequate staff to do controls, an adequate subrecipient monitoring system, adequate reporting mechanisms.
For what?
In order to receive that funding.
Controls for the money, or you said something about
Fiscal
an
controls.
agreement with the medical system?
No, fiscal controls.
Fiscal controls.
Yeah.
And those are non-competitive types of grants?
So they're pseudo-competitive.
Yeah.
Right. So I mean, the reason I say that is there's a minimum.
Okay.
Right. And if you apply and are otherwise eligible, you get the minimum. But there's some other weighting because there's clearly not enough money in the bucket for everyone. Congress is never going to appropriate enough for everybody's ideas. But those programs are largely constructed around, okay, who's the most likely to be successful with this? Who's first past the post? Right. So what we would do, one of the things that we would do is if we started seeing a deadline pop or a change in regulation or something like that, we would notify Ann and say, hey, here's this grant. It does, I don't know, it buys new wing nuts for, buses or whatever, because they're that specific, right? And if you guys decide that's something you want to do, then here are the parameters and what you need to do and when you need to have the application in by, and when the application window opens, because you know that other jurisdictions are going to be ready to apply for that money too.
Okay.
And again, I know I'm using kind of a ridiculous analogy, but
No, that's fine.
Some of them are that specific.
So you're watching all categories. So if something came down from USDA for farmers markets or for farm worker housing,
so
you're watching all those categories. So you'd give a heads up. We wouldn't miss that. I mean, you heard the presentation earlier today.
So we would not miss a general, like a grant program that is going to apply to the county.
Okay,
Right.
that's what I mean.
We
I didn't even miss it. I mean, but you're looking out for this broad array. I can't imagine how big that universe is, but it's big, I'm sure.
498 grant streams, and we are monitoring across that universe grants that are like only for states, unless we have a state client, which we do. But it's sort of a you may hear of a grant that's available to the state of California that I haven't told you about.
Yeah.
But that's because you're not an eligible applicant, right? And so I'm not going to bother you with, unless at the same time you're like, hey, maybe we want to ask the state for money for this as a subrecipient to those funds. Then it's a different conversation and a different level of effort and a different everything.
But you're watching
yes,
anything the counties or local jurisdictions could potentially apply or qualify for. You're watching all those.
Yeah. And I have one state client. We're watching it for them too. We have a tool that does that for us. That we built ourselves.
So is that something that obviously you could work through Ann and Amanda and folks in the exec's office? Is that something though that we could get alerted to, because it may be that, a short timeline, but it, may require some community involvement, again, with the lead times. And so, just, not to miss the opportunities, assuming that it's a fit for us and that we've got whatever match, and they, like say, we meet all the criteria that, we're going to have, the accounting criteria in place, I'm sure of that, so.
I will tell you that of the 400 odd grants that are out there, about 50 are going to be available to counties.
Okay.
Of that 50, probably 30 are going to only be available to revenue sharing counties. And so they kind of get funny about the way this all works. But yes, the short answer to your question is yes, we are watching it all, because that's what you pay us for. And where we see things pop that you guys might be interested in, or where we see a program that's growing somewhere, a lesson learned in another jurisdiction. I have a nasty habit of sharing all my lessons learned with all my other clients.
Mm-hmm.
So you're going to get all of that. Well, you do get all of that, I can tell you right now.
So we're not a revenue sharing county, right?
No, you're not.
No, we're direct. We get block grants, and
Right, which is actually a shame, because the Senate Bill 3011 just passed, and it was by unanimous consent. I just want to point out that the United States Senate passed something by unanimous consent.
Must have been a good
it
piece of
sets aside
legislation.
$2 billion for hard infrastructure for revenue sharing counties. And assuming the House votes on it, and I suspect they're going to, that they're going to pass it, without tweaking it, then it's only going to be available to revenue sharing counties. I know there's a lot of pressure in the House to fix that, but just...
Yeah. When you get everybody in the Senate voting for it, it's going to be a little tougher. So, okay. I appreciate it.
So, thank you. So the fiscal side of it there's no relation to the medical mandates. In other words, for those of us that are advocates for medical freedom, accepting the money doesn't agree to.
No, you are not agreeing to implement a mask mandate because you accepted this money.
It doesn't have anything to do with the public health order.
I mean, you've got to spend the money on public health, right, as one of the eligible
It's
costs.
about economic recovery, but it's not, there's no conditions relating to public health or the medical side of the mandates for the money.
Not in the context you're asking it. Right, so again, their public health is one of the eligible costs, right? So you have to be ready to spend money on that. But if you're asking me, do you need to have a mask mandate or a vaccine mandate or something like that in order to qualify, the answer is no.
Okay, that's what I was asking.
Because half the Midwestern states wouldn't have any money if that was the case.
Okay, that's what I was asking. Thank you.
Yes, ma'am.
Thanks, Dana.
Uh-huh.
I don't see anyone else in the queue, and I think we do have some public comments in chambers, and we also have some public comments on the phone. So Kelly Newell? I don't see a Kelly Newell, but she may have left because it was a long wait today. She might be on the phone now.
Sorry.
That's okay.
I use my cell phone to communicate with Miss Lydia, and she thinks that they left. So we will move to the phones now. So if staff could just please transfer the first caller. We have about 10 or 11 callers in queue right now. Hi, caller. Please start with your comments. You have 2 minutes.
Thank you. My name is Lisa Klotz, and I am a resident and community advocate in Galt, and I work with the Sunshine Food Pantry. I want to thank you for allowing me this time to speak. I wanted to bring your attention to the submission of a written comment detailing the construction of a high-density, low-income housing for seniors and veterans in Galt, and the much-needed expansion for the Sunshine Food Pantry and Resource Center. We understand that the ARPA funds are to be focused on assistance for housing and economic recovery, as well as investments in infrastructure. And this project is exactly what fulfills those needs. Our year-long planning process has brought into life the development of a much-needed low-income housing for seniors and veterans, some of the most vulnerable populations on fixed income and facing the most severe economic hardships in our community. Our project will also expand the reach of the Sunshine Food Pantry and Resource Center beyond the borders of proper Galt into the more rural households of our area. For the past 2 years, the Sunshine Food Pantry has been serving seniors and working poor with enough food to make ends meet. And during the recession, those numbers rose dramatically, but during this pandemic, those numbers rose exponentially. The Sunshine Food Pantry has served to date on this year alone over 16,000 souls in the Galt area. That includes individuals, families, seniors, single parents, and grandparents that are raising their grandchildren. So our space we no longer have adequate space to meet the needs of Galt and the surrounding community. So we feel confident that in reviewing our written comments that you would embrace the value of supporting this critical project with ARPA funding.
You have 15 seconds.
To meet the needs of those in the most southern portion of Sacramento County that are far away from many of the economic resources. So thank you again for this opportunity, and I appreciate your time.
Thank you.
Please send the next caller. Hi, caller. Please start with your comments. You have 2 minutes.
Hi, good afternoon. Thank you, Sacramento County Board of Supervisors. My name is Cal Sapon. I am a Deputy Director here at Stockton Boulevard Partnership. I'm calling in today to talk about the ARP funds allocation specific to the economic response. Small businesses here in Stockton Boulevard corridor have really struggled through the pandemic and continue to struggle as they recover. Stockton Boulevard Partnership, in collaboration with the SAC IEDC, has provided tremendous resources and assistance to our small businesses through funding from the City of Sacramento. However, we need additional support to continue this effort for technical assistance, outreach, and additional resources to help our small businesses as they work to recover through the impacts of COVID-19. Our request is for the County of Sacramento, as part of the economic response, to adopt a similar approach to support our minority small business owners. We, the SAC IEDC, have the programs and infrastructure to put these resources to work on our aging corridor, commercial corridor here in Sacramento County. Thank you.
Thank you.
Please send the next caller. Hi, caller. Please start with your comments. You have 2 minutes.
Good afternoon. My name is Liv Moe, and I'm the founding director of Verge Center for the Arts, as well as the board president of the Sacramento Alliance for Regional Art. I'm calling today to keep the arts in front of this body as you consider various funding allocations in the interest of workforce development and economic response. Over the past several months, representatives from the SARA board have met with each of the supervisors in order to communicate both the benefit of what our sector provides to the county, as well as to express the weight of the hardship we've all endured as a result of the pandemic. The arts were one of the first industries to close and will be one of the last to reopen, or have been one of the last to reopen. A recent survey conducted by the Office of Arts and Culture in partnership with the Americans for the Arts documented COVID's impact on the county's creative sector, revealing that we suffered a lost attendance of over 1.5 million attendees, 1.2 million in unanticipated expenditures, 28 million in cuts to expenditures of our normal operating budgets, net financial losses of $39.9 million. We cut staff salaries by 46%, and we've terminated 37% of our staff. Individual artists saw an average of $38,000 in losses to their annual income. In contrast, prior to the quarantine, the sector supported 6,000 full-time jobs, generating $135 million in household income annually. Revenue to local government exceeded $9 million, and the average arts patron spends more than $30 per person in the community per event attended. That's money going to regional bars, restaurants, coffee shops, and creates economic stimulus that supports more than just our sector directly. Our sector is essential to the health and well-being of Sacramento County. We provide arts education resources to young people who have endured the trauma of isolation, produce activities that convene the community throughout the county, and employ thousands of creatives. Verge alone produces one of the largest free annual events in the region, Sac Open Studios, that extends to every county supervisor and city council district in the area. The arts and culture sector wants to be an active participant in getting the community back on track, and we hope that you will invest in our efforts to get us there. Thank you for your time.
Thank you.
Please send the next caller. Hi, caller. Please start with your comments. You have 2 minutes.
Thank you. Good afternoon, Chair Frost and members of the board. My name's Karen Humphrey. I am a resident of District 1 in the Midtown area, and I'm also been active with the Sacramento Area Congregations Together Housing and Homelessness Local Organizing Committee. So we have been involved in this topic for a long time. Appreciate your time today. You should have received a copy of a letter from the LOC that from our chairman, Mike Jaskey, that outlines some of our thinking about how this funding should be used, and a further note from him, a message to you that says that we are generally in agreement with the direction that this proposal takes, meaning the focus on housing and health are those we agree with. And I just wanted to... It's my job, basically, to be the person who keeps being the broken record on planning, on long-term and comprehensive planning. This allocation of funds from the federal government is both fortuitous and urgently needed, but you don't have a context to place it in because the county and the other jurisdictions within the county have yet to develop a comprehensive regional plan that is targeted to eliminate homelessness in total over a reasonable period of time. And therefore, when, as in this case, money drops on you to address some particularly pandemic issues, or in other circumstances when you're faced with just your normal budgeting process, the guidelines for how you should spend money really aren't there. So we encourage you to do the best you can and to follow the general direction that is going on with this particular allocation, and to review again and potentially make changes in the allocation in the future. Housing and health are clearly the most critical issues that you can spend the funding on. But we also urge you to please start working with your partner agencies throughout Sacramento County and develop that more comprehensive plan, so that when situations change, you have guidelines that help you address the most important items at the time. So I thank you very much for your support of this plan, and look forward to us continuing to work with you on the notion of a comprehensive plan for the whole region. Thank you very much.
Thank you.
Please send the next caller. Hi, callers. Please start with your comments. You have 2 minutes.
Good afternoon, Chair Frost and members of the Board of Supervisors. My name is Tracy Schall, a longtime economic development professional and program executive for the Sacramento Inclusive Economic Development Collaborative, a coalition of chambers of commerce and PBIDs all working together to serve our under-resourced businesses on aging commercial corridors. I am calling today to support Deloitte's recommendation that Sacramento County invest nearly $20 million into our small business community. Small businesses represent 92% of the businesses in Sacramento County, so it is imperative that we direct ARPA funds to offset the impacts of COVID-19. SAC IEDC's in-language, culturally appropriate programs have a proven track record for helping to stabilize our small businesses while providing pathways for them to grow their operations. SAC IEDC stands ready to support Sacramento County's small business owners with emphasis on helping our minority business owners. Minority business owners have been disproportionately affected by the pandemic, thus they need access to additional resources and expertise. Thank you for your dedication to our small business community.
Thank you.
Please send the next caller. Hi, caller. Please start with your comments. You have 2 minutes.
Yes, my name is Kula Koenig, and I'm a resident of District 3. I was just calling to really also try and put this conversation in context as well. I wanted to just remind the Board of Supervisors and Executive Ann Edwards-Buckley that this should be about building resilience and not just putting Band-Aids on things, because as she mentioned in her opening, that we're trying to go from relief to actually rescuing folks, right? And so that means people being able to recover quickly from things that hit them. And so just hope that as you're making these decisions, that you're thinking about using this opportunity to really, really build resilience and not just put a Band-Aid on things. To that end, I would like a commitment that none of this money is going to go to law enforcement. I don't know who that commitment will come from, but I think it's important that the public hears that. None of this money is going to go to law enforcement in any way, shape, or form through the categories that were set above. Also to think about decreasing the number in our jails and investing in alternatives to decarceration. I won't even go into all the things that the folks from Decarcerate brought up this morning. Also, as we're thinking about resilience, is thinking about housing, permanent housing, homelessness prevention, and like funding new and affordable housing development. That's some things that other jurisdictions are doing. I know the guy from Deloitte, I felt like there was a little bit of fear-mongering going on there as well, but to really think about innovative things that can be done. So thinking about funding new affordable housing development, we need it. And would like to see later on numbers and benchmarks. So if we're investing 39% of this funding, then we expect to see X, Y, and Z amount of housing, this type of housing. So as we move along the process, it's really going to be important that we have something to show this is what we expect to see from spending this amount of money. And as we're talking about resilience, thinking about breaking the cycle of generational poverty, the city of Sacramento and some nonprofits in the area have launched a guaranteed income program, which is really about
15 seconds
for folks. Sure, we know about 1/3 of people can't afford an unexpected $400 expense, right? So that's not building resilience right there. So think about a guaranteed income program as well, and partner with your other jurisdictions and your schools to really think about how y'all can all leverage the money you're getting. Thank you.
Thank you.
Please send the next caller. Hi, caller. Please start with your comments. You have 2 minutes.
Hello, my name is Michelle Hillen-Newfer, and I am the Executive Director of NorCal School of the Arts and a board member of Sacramento Alliance for Regional Arts. Thank you, County Executive and Supervisors, for your leadership during these very challenging months. And I'd just like to ask for your support to address recovery of the county's arts and culture sector, and a very important contributor to the region's economic growth and development, and a sector that has been hit extremely hard by the pandemic. On behalf of the artists and arts organizations in the county, I request that the county allocate American Rescue Plan funds to address the needs of the sector, which includes supporting a reopening of arts organizations, both nonprofit and for-profit in the county, many of whom have scaled down significantly to survive the pandemic and who require support to scale back up. We ask that the allocation of funds augment the Cultural Arts Awards program, which is a critical ongoing source of operating support for the county's nonprofits, and to support our sector's efforts to respond to the needs of youth through arts education programming in and out of school time. We know that the arts promote student creativity. The arts decrease student anxiety and depression and help students regain connection to self and community. Arts education in particular enables self-expression, which addresses mental and social-emotional health. And many arts organizations are strategically weaving in social-emotional learning in their arts programming to address the mental health of our students in the schools. Funding towards the arts and culture sector will help reach communities hardest hit by the pandemic through arts education and community programming. Funding towards the arts will also bolster the creative workforce. It will provide reasons for people to re-engage with the cultural civic amenities in our county, and it will also bolster tourism, which will contribute to the economic recovery of our region. Thank you again for your consideration.
Thank you.
Please send the next caller. Hi, caller. Please start with your comments. You have 2 minutes.
Thank you. My name is Nick White. I'd just like to comment on Deloitte's saying that 10% of the total is normal. That's $30 million to Deloitte for what? Taking and making sure you're spending the money correctly? I'm shocked that the county doesn't have an organization within itself, a bunch of lawyers and accountants that can take and manage and administer the funding. You have total funding for the county. You have a budget office. You have accountants. You have lawyers that can read what the federal government says. There's no reason for it to give Deloitte this money. And oh, by the way, all these grants they're going to find for you, they're going to take the 10% cut from those too. Thank you. Have a good day.
Thank you.
Please send the next caller.
You can comment on that later.
Hi, caller. Please start with your comments. You have 2 minutes.
Hi, my name is Mervyn Brookins, and I'm calling to ask the supervisors to please consider community-led violence intervention and prevention as a priority, as well as in finding a job that our sheriffs do. I think they will also tell you they can't do it alone. So please consider making this a priority so an investment today can prevent a tragedy tomorrow. Thank you. Appreciate your time.
Thank you.
Please send the next caller. Hi, caller. Please start with your comments. You have 2 minutes.
Yes, this is Julius Thibodeau. I'm the strategy program manager for Advanced Peace here in Sacramento. I just wanted to say that I was on the call a while back when Phil Cerner was addressing the survey that you guys put out. We already know that any options for addressing gang violence, gun violence, intervention, and we just know for a fact that there's been problems in Arden Arcade area and in North Highlands and other areas that are located in the county, and there are several community members who have concerns here, and we just would like to see that there be an investment in community gun violence and dealing with this issue that has been plaguing the county for quite some time now, and especially with the uptick that is directly connected to COVID-19. So that's pretty much all I wanted to say, is that we hope that we know that you guys have received a letter from the Healing the Hood and the collaborative of organizations who wish to address this area and make sure that public safety is addressed when we're talking about issuing out the ARPA funds.
Thank you.
And please send the last caller. Hi, caller. Please start with your comments. You have 2 minutes.
Good afternoon. My name is Christine Bailey. I'm a member of the Unitarian Church in West Arden Arcade and an Environmental Justice Committee and community, excuse me. I would like to urge the board to really focus on funding for community-led violence prevention, and I request that the board please commit to not spending any of this funding on law enforcement. Thank you very much. Bye-bye.
Thank you.
Madam Chair, we have one more caller that slipped in.
Sure.
I shouldn't say that. We have one more caller.
That's okay.
Jillian, can you transfer the caller when you get them through the queue, please? Thank you. There they are. Okay. Hi, caller. You have 2 minutes to make your comment. Please start.
Yes, my name is Les Simmons. I'm the senior pastor of South Sacramento Christian Center, one of the founders of the Simmons Community Center. I'm also a part of the collaborative Healing the Hood through Black Child Legacy campaign. And I'd like to thank Supervisor Kennedy and his leadership. Our organization is in his district. I'd like to thank you for prioritizing a lot of the things that are important to our community. What I'm calling for is in reference to the ARPA funding and how it's allocated. Because we know violence have went up throughout this pandemic, and before the pandemic, our collaboratives to Healing the Hood, Advance Peace, Brother to Brother, Voices of Youth, and folks like Jackie Rose were greatly impacting community violence. And as a result of our collaborative network, we're going to reduce violence. And we know violence has continued to rise throughout Sacramento and around the nation, actually. And I think it's important that we prioritize community-led violence networks, such as the one that we are a part of. I think prioritizing it means we put resources, we put funding, and we put that continued focus and effort to reduce retaliatory violence, reduce community violence by injecting opportunity. Now, through the Black Child Legacy campaign, through the work of Healing the Hood, through the work of Senior Health Foundation, which is address these key issues, the opportunity to do that. We have an opportunity to invest in our future. We have an opportunity to save lives. We have an opportunity to recreate a community that will come out of the pandemic vibrant and with the support needed. I'm calling to ask for your support in investing in the future lives of Sacramentans that are going to impact and have been. Thank you. Get support.
Thank you.
Chair, if I might say, if Pastor Simmons is still on, Pastor Simmons, it was very difficult to understand. You were breaking up there. So if you would like to send those comments in writing to the board, that would probably be very helpful, particularly the part where you said, thank you, Supervisor Kennedy.
I will say that. Thank you, Supervisor Kennedy.
We heard that. Yeah. That's good. Thank you. Thank you, Pastor Simmons, and thank you, Supervisor Kennedy.
Madam Chair, we have one more
Okay.
caller. Thank you, Pastor. I'm going to end the call. Please transfer the caller. Hi, caller. Please start with your comments. You have 2 minutes.
Hi, my name is Kalima Mutaki. I'm calling from Sacramento Access. I'm a community organizer. And I just wanted to, really bring attention to the need to fund community-based violence prevention and intervention. These are children, these are family members that we are seeing in our congregations, that we are burying. Our faith leaders really have just been trying to amplify the need. We need to find a solution to this problem of gun violence, and it needs to be community-based. So please, take seriously and allocate funding specifically to community-based violence prevention, intervention, and organizations such as Advance Peace and Healing the Hood that have been continuously doing the work in our communities. Thank you for your careful consideration of community input, and we are hopeful that we'll all come out of this challenging time stronger so that we can achieve the recovery that we all deserve. Thank you.
Thank you.
Okay, and I believe that is your final caller. Let me just do one more check. Yeah, that's your final public comment.
Okay, and I have Supervisor Cern is the first in the queue, and he has on his mind, I think, the same thing I did, so I'll just let him speak.
Great. Thank you, Chair. So I do have some questions I'll present them to Ann, but suspect perhaps she might want to have Damon assist if necessary. And these are questions that just come up from the testimony, so I feel we owe it to the public just to try and answer them as best we can at this point. Again, noting that this is a very high-level discussion today, and that there'll be plenty of further discussion, deliberation by this board as to the details of specific programs and initiatives. The first thing I want to make sure I understand is there was reference to the 10% administrative overhead cost. The gentleman that addressed the board mentioned that amounting to, from his perspective, $30 million that goes to Deloitte. I suspect what we're going to hear from you, Ann, is that is not the case, but please confirm that. I think that also includes the additional FTEs that we would have to bring on board to help administer the ARPA funds as well, correct?
That is correct. And the administration cost right now that we're talking about is $15 million, not 30.
Right.
And that a very tiny fraction of that has been allocated. You all approved 5 positions this morning, county positions, to do the work. We have the Deloitte contract in there, which is very small in comparison to the $15 million. As I think you heard when Damon was speaking earlier, and all the things we've talked about the complexities of, doing the right fiscal monitoring and having all the controls in place, we are going to be needing additional staff. And on top of that, if we contract with a community-based organization, they have administration costs as well. Mm-hmm. So we do not have a plan at this point for the full $15 million. That will happen as we roll out project proposals for you to consider, but the contract with Deloitte is less than $1 million in totality, both of them.
Great, thank you. There are also a number of speakers that demonstrated an interest in violence prevention. And while that's not necessarily spelled out specifically, I don't think in any of the general categories. I was wondering if you can maybe speak to that.
I actually am going to ask Damon to come up and address that
Okay.
one. I have some thoughts, but I don't know that they're accurate.
Okay. You don't know if your own thoughts are accurate?
Hey, it's a thought, but I don't know if it comports with Treasury guidance. Yeah.
Supervisor Cerna, thanks for asking that question about admin costs. I appreciate it. So on the topic of violence prevention and violence reduction, other things, they are allowable costs, generally under the well-being and health sort of category. So we would, if you were to say we want to do X, Y, Z in this space, then there's probably parameters, things you'd have to be careful about, but it is absolutely an allowable category.
Yeah, thank you for that. And the point's not lost on me from the 2 or 3 callers that did make mention of violence prevention being a priority for them. There are a number of initiatives that are kind of ongoing here at the county that probably, if they were presented appropriately, again per the Treasury rules, I could definitely see them, given what you just mentioned, being at least candidates for consideration. Specifically, our efforts in the context of the Black Child Legacy Campaign to address child abuse, neglect homicides, as well as third-party homicides for younger folks. So, appreciate that. Thank you.
Yes, sir.
There were a couple of speakers that mentioned this interest in a commitment not to fund law enforcement. And I think we all can understand in part where that comes from based on the experience last year, the unfortunate experience last year with the CARES Act and the circumstance around the board's actions and the then past CEO bringing forth a kind of a creative accounting scheme to balance the budget using CARES Act funds. But I think this is an interest that we cannot ignore given that experience.
I don't think that law enforcement is an eligible expenditure. I don't know that for sure. Is that accurate? I can imagine that there might be some of the feedback we got on the community survey was community safety as it relates to some encampments and things like that. But, law enforcement officers themselves, I don't envision we would be funding.
Yeah, so the Biden administration, or the Treasury, came back and released an update to the rule set that basically says cities, counties, in light of the rise in violence, can choose to rehire law enforcement they may have laid off recently and stuff of that nature, but there's not a, go out and hire a new police department or anything of that nature. You could construct it under the reduction of violence justification if that were a choice the county wanted to make. I'm not suggesting it is. But you would have to be very careful about how you constructed that.
Okay, I appreciate both explanations. I do think we'd be wise to just be sensitive to that as we go forward for, again, obvious reasons. And then lastly, a number of speakers brought up, I thought, were what I thought are very salient points around the arts and their interest in making sure that the arts is part of our local creative economy, like other small businesses. They too were obviously very adversely affected by the pandemic and continue to be so. So I'd like maybe to hear some thoughts, Anne, around where you see them conceptually fitting into what's in front of us today.
Well, my assumption would be economic recovery because they're a business that suffered as a result of the pandemic, and I'm just looking for a head nod from Damon. Okay, yes.
Okay, great.
I'm checking with him, but my thoughts were the same as his on the last one, so I think we're doing okay.
That's a good sign.
Yes.
Yeah. Okay. Well, those were kind of my general observations and inquiries following public testimony. And again, thanks to those that took time out of their busy afternoons to call in and let us know what's on their minds. Thank you.
Supervisor Stern, if I could just add on the law enforcement issue, I don't have any vision in my planning moving forward that we would be funding law enforcement. That's just not something that I have considered. I know that I'm one person and make recommendations to you, but that's not something that is on my mind.
Understood, and I appreciate you underscoring that. Thank you.
Thank you. Supervisor Desmond.
Thank you, Madam Chair. I just want you to know that Supervisor Cerna stole all my thunder. I have it written down here: violence prevention, arts, and the law enforcement comment. But thank you for raising each of those points, because those are also things that are very important to me too. And that was, even though I'm the law enforcement guy, I felt the same way. I can't see any situation where we would be looking for a law enforcement solution. Now, when it comes to violence prevention, which I also support very much, because I think we're all aware of even very recent stories where violence is dramatically affecting some of our neighborhoods in the unincorporated area, just even over the last weekend. There are some wonderful programs that are being done on a shoestring budget or just through volunteers right now in the unincorporated area. So I think that's something that is really ripe for building the resiliency in some of these neighborhoods that we heard. And also arts. And I was thinking to myself, as the question about arts came up, that may be one of those things where you could take some money out of health side too, if there's programming for mental health, I would imagine. And again, district allocation too for nonprofits, right? So that could be kind of a combination. But I just want to echo Supervisor Cerna's comments and just kind of highlight those as things that are important to me as well. So thank you.
Thank you, Supervisor Desmond. Supervisor Natoli.
Yeah, thank you, Madam Chair. So, Ann, you've received, as you said, a fairly sizable stack of proposals, concepts, requests, suggestions, whatever they might. So would you envision that you would, as you sort those and make all those available to us so we can have that as a part of, some of those have been transmitted from us, but there may be ones out there we're not familiar with, because as you're bringing recommendations through, you may make some decisions regarding that, but I think having the background would be helpful to make sure there's a clear understanding. And so is that something that we can go through the exercise, or are you just going to, again, I'm curious.
Yeah, so we'll be looking at all the proposals. In the first step, we'll be looking at outcomes that these proposals recommend. Because of the need to do a competitive selection process, we'll be looking at the proposals by categories and looking at what are the outcomes that people are looking for and develop an RFP based upon those outcomes. We will not be necessarily looking at the proposals and deciding which ones to fund, because we really need to meet the requirements of the Act by doing competitive selection process. There may be some that we are able to fund without doing that, but the circumstances are pretty narrow. We can, if you wish, provide a matrix of all of the things that we've received, but we're really, as we talked about with your district allocations, we're really going to be looking at what are the outcomes you're trying to achieve, and then do an RFP to solicit proposals to meet those outcomes. And I fully suspect that many of the proposals we have seen, people will submit an RFP and have the opportunity to be funded.
I do think a matrix, again, I don't know what sort of volume we're talking about. I don't think it's hundreds, but maybe it is.
Which,
is it hundreds? Okay.
Well,
so
I don't know for sure.
I've seen
but
some, I'd say
that
dozens.
they all come flooding through me, and then I forward them to staff, and I do think it's pretty voluminous, but they are working on that sorting process right now.
Okay. Well, I for one, again, in whatever format would be easiest for you folks to assimilate. I don't need to have it digested, but just to know the totality of the landscape that we're looking at here, and recognizing you're looking at, be competitively seeking responses. Now, government to governments, though, we don't have to go competitive. So if we did something with a water district, with a park district, with a sanitation district, with a city, or whatever, we have the ability to do that just as we do now, right? Government to government?
I believe so. Is that correct, Damon? Yes.
Okay. All right. So that'll be an important consideration, because but then if that's a piece of it, then, I don't say it comes off the top, but it becomes a part of however you excise that, if that's a recommendation, or if you compete everything in that category, and then those folks are waiting, well, I sent you a letter of interest, but how did I get taken up in the overall consideration of this thing? So
it will also give you an opportunity to see all of the proposals as you consider what you want in your district with your district allocations as well, because many of them came from your offices where your constituents sent a proposal to you, and we are keeping it.
One of the suggestions that was made by one of the folks on behalf of the Alliance for the Regional Arts was, we have a process that we use, the TOT tax, with the Cultural Awards Program. So are you able to couple that with an existing structure, so that you could either supplement, or you have to do a whole new?
We're going to do this is very, very different. The TOT money is general fund money. The restriction on it are your own restrictions, not any other federal or state funding agency. So it will be a different process.
Okay, but you do have a structure that seeks competitive proposals under that.
Yes, yes.
So you have some.
Well, and some of the
outline.
competitive proposals are going to come out by departments. So, for example, services for the homeless, we won't do that RFP out of the county executive's office. The Department of Human Assistance will likely do that because they operate the homeless program. So this is big and complex, and it's also important to note that there are many, many good proposals out there. I would argue that all of them have merit, and not everyone's going to get funded. And that's the big challenging piece when you have this much money, is the expectations are that everything will be funded, but we probably have proposals, we definitely have proposals that far exceed the total 300 million allocation. And so it's going to be, we're going to have to just be very careful and thoughtful about how we proceed.
So what about, how do P-bids factor into this? Property Business Improvement Districts, again, we have a process that we've assisted in the formation. Obviously, they're property owner driven in their ultimate creation, but will they have to compete, or will they fall in the category of kind of quasi?
That one might be a little bit different because a P-bid doesn't have any competition within their district, but that is something that we would have to dive in a little bit deeper.
Okay. And lastly, again, certainly recognizing, just as you're detailing some of the work that will go into this, that I know for the, you've said a maximum 10% on administration, but every 1% you're able to save is in this first tranche is $1.5 million that can go elsewhere. We need to have the accounting. We need to make sure that it's solid and such. But so I would just encourage us that, again, as I mentioned to you in my briefing yesterday, that 10% can that can be argued to be a norm, but I sent a couple of JPAs where 7 and 8% are they're capped actually at 8% at the Area 4 Agency on Aging. That's 8% maximum for administration. And then, as you noted in your comments, that there's some other administrative costs. So how that gets accounted for in the overall, if it's 10%, then that means if we give it to an umbrella organization, I would trust that we're going to keep that straight in the alignment, so that if they take, in order to administer, say $5 million, they take $500,000 to do that, then that comes out of the overall total. And so I trust there's going to be a column for tracking that.
Yes, and that's one of the significant administrative costs, is to really track all of this, because we have to track our own administrative costs. We also have to track the administrative costs of community-based organizations or whoever we give the money to. So there's a lot of tracking involved. But yes, we will be monitoring it carefully.
Okay. One other question, and again, it's not totally clear to me, but this allows some focus, but yet fairly broad discretion. It's kind of counterintuitive, but within the framework of the county for how we utilize dollars to some degree. And if, for example, we did I'll look at infrastructure, probably a good example. If we were going to do a water project, water agency is us wearing a different hat up here. We don't need to charge a separate administration for that, right? We in order to administer those funds, they already have, into what Mr. White said on the phone, we've already got accounting within the departments. We don't need to recreate the wheel in those respective departments, and whether it's DHA or one of the public works entities or whoever, it would seem to me that we have functionality already existing. You're going to have this other layer to make sure, but once it gets, we don't need to start pulling off a bunch of administrative costs. Is that fair?
Yes and no.
Okay.
So I'll just take DHA as an example, since you put that out there. If DHA is going to administer another, let's just say $30 million, I'm pulling a number out of the air, $30 million in homeless services, they have accounting and fiscal monitoring within their department, and there will be additional staff that they will need, because their staff are stretched right now managing the homeless programs that they have. And all of a sudden, we're asking them to take on, 10, 15, I'm making up the numbers, but additional programming. And programming requires program monitoring at the department level, fiscal monitoring, and so lots and lots of things. So that the admin will be spread really throughout the county, in departments, in our office, in consulting, and we'll be tracking, and we can report on that when we provide reports to the board as well.
Okay. Well, I think at a minimum, that's key to the reporting. I appreciate your offering that. I would expect that. Again, these are one-time monies, and when we got them, we're going to put them to use. But once they're spent, there's not anything coming behind it. And so I think it's important that in the context, if we, you only have so much ability to absorb and so forth, but to certainly make sure we're compensated, we got the coverage we need to do the work internally, or we pay for it externally, but make the best use of every penny. This is going to help our community recover as much as we can put into local economy, to local projects, to reinforcing all the things that we've heard about today, and many more we're going to talk about. I would just encourage us to get the biggest bang for the buck here.
I completely agree, and we will be as careful and thoughtful about the administration costs as we will the program costs.
Okay, I trust that. Thank you.
I'd like to just tag on to one of the points that Supervisor Natoli made regarding working with other jurisdictions, like cities or the cities each got their own allocation. And I know in my district, I met with the city of Folsom, their mayor and vice mayor, Sarah Kino, and the city manager. I learned that their allocation was much smaller than what they had anticipated, and it was very unfortunate. And I guess the question I have is relating to not just us partnering with other jurisdictions, but what about a regional approach for ARPA funds? Could we do, like they're working on a Northern California Innovation District that we've been, they've over time, they took a real hit they have a lot of small businesses in Folsom, and so, unfortunately they didn't score high on all the categories, I guess, that you have to score on to get the ARPA dollars. But the question I have is if they're working with other cities and GSEC and other entities for a regional approach that would provide not only economic recovery, but innovation and stimulation and funding. Can ARPA dollars go toward that, and would it be possible for us to try to maybe think about them as we're moving forward, because they got about half as much as what a lot of the other cities got, and it was disappointing. And I know they got the amount that I guess that they were due based on the calculations that were made, but I wanted to put a good word in for Folsom, because they have some really exciting things going, and they're trying to climb out of this, I don't know, definitely want to keep them in mind for economic recovery, but I'm hoping there's a way that we can help them, if not in this round, with the next round.
So I too have had conversations with the city manager in Folsom, and as I said earlier, we can certainly partner with other jurisdictions on eligible programs as long as they meet the Treasury guidance.
Thank you.
Can I just
Yes.
follow on, because again, I thought of a point as you were asking the question. So we heard from Lisa Klotz in Galt, and that project is actually in the city. But if we, whether it was Galt, I know Supervisor Stern asked about Save Sacramento, Supervisor Frost has asked about Folsom, we can look to partner with those municipalities, whether they're big or small in this county, which we have 7 of them. If there were projects that met our respective goals and could advance, and whether it's housing or some level of economic recovery or work for health services that we provide countywide but might be directed to a more focused area in the county. We have the ability to do that with these dollars. Is that?
Yes, we can partner.
Yeah,
again, just reinforcing on eligible activities.
Right. Mm-hmm. And along those lines, I was going to ask this a moment ago, was with fire agencies, we have, certainly some of our larger providers of first responders, but we have, rural fire districts, and a lot of them have, during the pandemic, continued to respond and so forth. If they had eligible activities, we can partner with them as well. Is that accurate? Or if they had some equipment needs?
The answer is yes, but on that one.
Okay.
Can you come up to the,
Yeah.
Thank you.
Yeah.
So the answer is it's kind of a yes, but.
Okay.
More closely a maybe.
Okay.
The fire departments, specifically rural fire departments,
Yes.
have a lot of other federal funds coming in, and there are things you can do, absolutely.
Okay.
It's just making sure that you are very nuanced about what you're doing so that you don't touch the other funds that are there.
Okay. I don't think the rural fire districts in this county, too many of them get many federal dollars. I could be wrong about that, Damon, but nonetheless, to your point, it's clearly a maybe, and
Right.
something we can take a look at. So, okay.
That would be something you'd want us to look at.
Very good. Okay, thanks.
I think Galt took a big hit also with their small businesses, from what I heard from friends of mine down there. I guess everyone did. Okay, thank you, Supervisor Natoli. Supervisor Kennedy.
Well, thank you, Chair. Don, Mayor Steinberg's on the phone for you.
I said hi.
If we do end up working with, and don't want to get in the weeds because I know this is high level, but today, but if we do get into working with PBIDs, might I recommend that you look at dealing with IEDC, who has the infrastructure, and there may be economies of scale there and efficiencies that would actually cut down administrative costs. Okay, thank you.
All right. I don't have any more supervisors in the queue. We've already taken our public comment, and so now we are at that place, the one we're entertaining a motion.
I'll move the item.
We have a motion from Supervisor Cerna and a second from Supervisor Desmond. Please vote.
Unanimous vote.
This is
Thank
a
you.
regular item on our agenda every meeting.
I'm sorry, I didn't hear you.
This could be a regular item on our agenda every meeting.
Probably not every meeting.
No,
But we're going to be doing, you didn't ask me about the timing of reports, but we're required to report to the Treasury quarterly, so we will be reporting to you quarterly.
Yeah, well, it's a pretty brief.
But we'll be bringing projects to you.
That's what I meant.
So it'll, yes,
we'll
it'll be
seeing.
frequent in the coming months.
That's what I meant, yeah.
I want to thank Ann Edwards, our county executive. I know working for 5 people who have all these different ideas keeps you hopping, and you're really good at being open-minded and flexible. And I want to thank Damon Armini for being here to support us and answer our questions. We really appreciate it.
Thank you.
I would like to echo the thanks to Damon as well. Thank you so much. It's been very, very helpful to myself and the whole team.
Thank you.
Good job.
Thanks.
All right, next item, please.
Okay. Item 41 is the COVID-19 update response.
That's as low as it goes. Okay. Good evening. I am not going to go into the slides right away, and in fact, at the end of my presentation, I'll ask the board if you want us to just hold the slides. Dr. Casirier and Dr. Damiano are both on the phone if questions come up that I can't answer. But I thought I would just start out with the outbreak in the jail, since I think that's top of everyone's minds right now. Adult Correctional Health reported investigation of a COVID-19 outbreak at the jail facilities the week of October 18th. An inmate at RCCC who complained of symptoms was complaining of symptoms, and staff completed a rapid antigen test, which was positive, and this led to widespread contact tracing, quarantine, and a large-scale testing in both jails. As of just this afternoon, late this afternoon, we were up to 191 cases of COVID in the jail since the outbreak. And not all of these are associated with the outbreak, but the majority are.
You said, through the chair, you said jail. That's just RCCC?
No, I apologize. So both.
Okay.
I'm talking both main jail and RCCC. Right. Yeah, thank you.
Are they all, but most of them are not, do we know how many are symptomatic?
We don't know how many are symptomatic, but the majority are not symptomatic. The majority are not. Yeah. I might get an answer on that here in a moment. So, like I said, not all are due to the outbreak, but most of them are. Some are from intake, some are newly arriving arrestees coming in, and others have been associated with the transmission in the jail. So following protocol, individuals with positive tests, close contacts, or new arrivals are being quarantined in one of 4 quarantine pods: an intake quarantine for new arrivals, a close contact quarantine for exposed but no symptoms, suspect isolation, which are symptoms but pending testing, and then confirmed cases. Any inmate exhibiting symptoms consistent with the CDC's COVID-19 symptom list are tested. Additionally, all patients exposed to the symptomatic individual are also tested. All confirmed cases, as of last Thursday, were unvaccinated except one. And we are checking the vaccination status on the tests that we got in today, and so I'll have more information for you on that later. All inmates upon arrival are offered vaccinations and provided education about vaccinations. And as of last week, 2,429 inmates did receive at least one COVID vaccine while they were in jail. We have an extensive protocol that's put in place in the jail facilities to detect, monitor, quarantine, and isolate inmates. Most inmates who get COVID-19 are asymptomatic, but we have seen more symptomatic patients during this current outbreak than we did during the last. For symptomatic patients, there are protocols for health checks by nursing and there are provider assessments, which include routine temperature checks, oxygen saturation checks, and symptom screenings. When needed, staff have patients transported to the local hospital for a further assessment by a hospitalist to determine the patient's treatment needs. All staff who work in the jail, this includes both correctional health and correctional staff, are under a state health officer's order to either be vaccinated or, for those with an exemption, to test weekly. To date, 95% of our correctional health staff have been vaccinated. Sadly, I need to report that we did have our first death associated with COVID-19 in the jails. That happened yesterday morning, of an inmate who was admitted to the hospital on October 25th due to low oxygen levels, where at the hospital he tested positive for COVID-19. The inmate was a 76-year-old male who was being treated for long-term, significant, and multiple underlying health conditions. While hospitalized, he tested positive. He had been vaccinated in June of 2021 while in custody. Upon his positive COVID test, correctional health staff immediately began contact tracing and quarantined him in the housing unit, and quarantined the housing unit that the inmate had resided in. All COVID-19 quarantine protocols are being followed, and testing of inmates who had contact with the deceased are being conducted. And I just did want to reiterate that this has been our first death of an inmate with COVID-19. I know there's been some thoughts that there may be others, but we've had that checked thoroughly this afternoon, and there have been no others associated. I know there was a death brought up this morning during public comment. There was a death of an inmate that occurred on September 21st, not October 21st, but that was not associated with COVID-19. So with that, that concludes my jail part of our report, and I would be happy to entertain questions before I move on.
Thank you, Siobhan. Mm-hmm. Supervisor Natoli, I was going to say Dr. Natoli, but I guess
you wouldn't want that.
That was not the right.
Thanks. Siobhan, thank you for the report. I wanted to ask a couple questions. Is there anyone in custody is currently hospitalized due to COVID-related symptoms?
Not at this time. There was another individual who did go to the emergency room and then returned back to the jail. The gentleman who was hospitalized did pass yesterday. That was our only other hospitalization.
Right. Throughout the course of time, have we had others hospitalized, though, and been returned to custody?
Through this outbreak, I don't believe we've had anyone else hospitalized, but I will ask Dr. Damiano if she can confirm that.
Good afternoon. This is Sandy Damiano. We had one person go to the hospital, which Siobhan reported on. One went to the emergency department and came back. That was during this outbreak. In the prior outbreak, we also did have some people that needed to be assessed at the hospital, but I can't provide numbers on that at this time.
And so to follow on to that then, so that all those, whether they're symptomatic or asymptomatic, are being housed in the jail, in the facilities. You said 4 different locations. I guess I'm curious, what's the sanitation protocol there? What is the priority given to folks who may get progressively sick and have symptoms that then are compounded. And again, I don't know all the details behind the gentleman that passed yesterday, but is there a certain priority given to that? One, obviously, protect the rest of the in custody population, as well as obviously those that tend to folks in the jail facilities. Could you elaborate on that a little bit, Siobhan or Sandy?
Sure, I'll ask Sandy to do that. Thank you.
Thank you. This is Sandy Demiano again. Custody, our Sheriff's Department is responsible for all of the disinfecting in the jail facilities, so that is their responsibility. It's actually way more than 4 areas per jail facility because we have numerous cohorts that are in quarantine in these 4 types of COVID housing in each particular jail. When they're in the jail, the nurses complete health checks on everyone. These are COVID checks. They are also seen by the doctor as needed. If people have deterioration of symptoms, they will assess them for need to go to an emergency department. That's part of our protocol. They do get their regular health services while they are in this COVID housing. And all staff, whether they're health staff or Sheriff's Department, has to wear PPE in these COVID housing units in addition to masking and hand washing and all the other protocols outside of the COVID housing units.
I guess, Sandy, my specific question regarding sanitation and hygiene was that one of the speakers this morning made a comment that their the party that they were associated with had requested a mattress and was denied that because of not wanting to, quote, I don't forget the word, something along the lines of contaminate. So again, recognizing that there are linens, there are other sundry items that folks have. So who's responsible for cleaning? Is that general services? You say the sheriff's staff? They're not in there cleaning. No. Yeah.
Yeah. Correct. So I believe there's a lot. The sheriff's department should really respond to this because I might get it wrong. But they use inmate workers in a lot of the areas, and then in some areas they use general services.
And so if the inmates are assigned to those tasks or volunteer for them, however that's decided, they're given safety protocols too so that their exposure is minimized?
Yeah, and then the Sheriff's Department also does this very thorough and disinfectant, but again, I believe it would be better for them to discuss this area because that's their area.
Okay, one last question kind of relates to staffing then. As I understood it, either Siobhan or you said that if they saw some emergent health issues coming on, obviously they can request to be attended to by, I guess, nursing staff initially. They can see a doctor. How quickly does that happen? If they need to see a doctor, again, that's part of the general complaints that we get about is, the number of times people request outside of COVID for other types of assistance. But now that we've had, the person identified as having passed away from complications or due to COVID, then it seems to me that this, if it wasn't already a high priority, which it sounds like it was from what you've explained, how can we assure the public that their loved ones, their parties that they're associated with, people that they care about, that we should all care about, are getting that level of attention? Because this is no ordinary disease. We're still in the pandemic, and we know that it has taken many, many lives in this country and certainly in our community. So I guess I'm curious as to, when you prioritize this, what's that mean?
So for the patients in the COVID housing, there are nurse health checks done daily, and then for symptomatic people, they are checked more frequently than that. We have nursing staff on 24/7. They are able to request the doctor see the patient, or they can do a physician consult, or if the nurse deems they need emergency care, they can contact and get them out of the jails quickly and to the local emergency department. In addition, if the custody staff deems someone that just gets ill, which does happen because they have all the video cameras and they have deputies throughout, they will also contact medical for a nursing assessment.
Okay, so custody staff doesn't make the determination about whether somebody sees the doctor or the nurse?
No, they do not.
Okay.
It's the medical staff that makes that determination. But if they see an inmate that's in maybe general population that's experiencing some symptoms, they will contact medical.
Okay.
Yes.
All right. Thank you. That's all the questions I had right now.
Thank you.
Thank you. And Supervisor Cerna.
Thank you. Siobhan, you mentioned that there are currently 191 that are positive in our spread between our two jails?
Not so, based on a point in time count, not currently 191, but since the onset of this outbreak, 191.
Okay.
Some are now out of quarantine and sort of out of the woods, if you will.
And you qualified it as being per this outbreak. So do we know in a previous, I'm assuming like a pre-Delta outbreak, what was our last highest spike, I guess, is what I'm asking. Do you know that?
Yeah, let me see if I can find that, or if Sandy knows right off the top of her head.
Yes, so we were doing pretty well until this recent outbreak, and I think the data right before we started surging on this particular one, let me check the data on that. I think the week of October 6th, for example, we only had 6 confirmed cases for the week. So a lot of times what will happen is when the community is experiencing higher transmissions, we will also get new arrivals with higher transmissions. So you can see on October 6th, that was quite low.
Okay, I guess the point I guess I'm leaning towards here is 191, and I understand that may not be today, that may be a few days old. That seems like a lot, and I know that between our two facilities we hold thousands of people, but it seems like an awful lot. And I'm wondering whether or not, given the order of magnitude of the outbreak, that's why I asked how does it compare relative to past outbreaks. But given the size of it, at some point, is there anyone that attempts to speak with the courts or coordinate with the courts to say that let's say of the 191, we know that those, let's say half, or let's say a third are pretrial, so they're most likely across the street, and they're being held on their misdemeanor charges. In other words, they're maybe lower risk charges. At some point, has anyone attempted to work with the courts to say, maybe in the interest of containing the outbreak, because of the nature of jails obviously is you're confining people, and oftentimes 2 to a cell. Maybe the best thing to keep the outbreak from growing any larger is to somehow work with some kind of release or home detention or something other than keeping them in an environment where you're more likely to have them continue to contaminate and infect others in the jail.
Yeah, thank you. That's a good question. And those decisions are really outside of correctional health's purview, under the district attorney and the sheriff's department purview. Sandy, if you want to speak to any of that, you can.
Yes, I would like to. So some of the cases that Siobhan was talking about go back to October 20th, so it's during the duration. We have lots and lots of people because we're doing such widespread testing and quarantine, so these numbers will continue to raise. It just spreads very quickly once it spreads. I can tell you, as part of our COVID protocol, We created a list of inmates based on their clinical diagnoses that are at risk or vulnerable for COVID. We have given those to the Sheriff's Department, and they need to look at that and then possibly talk with courts or public defender if any of those inmates could be released. We did that last outbreak as well. I'm not quite sure the numbers that were released. I do believe the Sheriff's Office has also increased home detention.
Is Dr. Kasiri also on the line?
She is, yes.
So this question's for Dr. Kasiri then. I mean, from a general public health standpoint, as our public health officer, is there anything that could or should stop you from, or your staff, quite frankly, from at least asking what may be the right question of the right group of people, namely the bench, to see if that is the best way to address further outbreaks? I understand it's not your call necessarily because it's in a correctional context, but if your charge is to obviously do what you can to contain spread of communicable disease, seems to me that we wouldn't want to be bashful at this time, and we'd want to have the right folks advocating or suggesting at least, perhaps even directly to the courts, not just through the Sheriff's Department, the possibility of getting maybe some of the worst cases or those that are immunocompromised or elderly inmates, high-risk folks that perhaps aren't vaccinated, so perhaps they're more likely to have the very acute symptoms. It just seems to me that there's the possibility of doing that. So I'd like to understand that a little bit better.
And this is Dr. Olivia Kasiri speaking. I'll have to work with County Council on that. We have not done it before because, as was mentioned, with the previous outbreak, there was already that provision to be able to release inmates early, but it's not the case now because that provision ended. I will circle back with County Council and we'll get back to you in terms of what we're able to do.
Okay.
I also will check back on the past outbreak and give you the numbers as to what was the peak that we had. I don't have that handy right now.
I appreciate that. Again, this is from a layperson's perspective, just trying to approach this at some distance, but apply some almost common sense to the fact that the more you keep people confined in a close quarter environment, it seems to me you're going to have a much greater challenge in containing the outbreak, despite all the initiative that has been taken to isolate and to categorize people that are at different stages of the disease or those that have been immunized or not, those types of things. So I think it's worth asking the question.
We will definitely follow up.
Thank you.
Thank you. I just want to do a time check and ask County Council. I know we had a 6 p.m. item. I don't know if we have to stop at 6 and take the redistricting item or if we can finish this item first.
Yes, you can finish this item. There's a provision in the election code that applies, and it says that you can continue the item that you're already considering, even though we do have a time certain for the redistricting matter.
Okay, thank you. And also I wanted to let the board know that we will be continuing our closed session to another time. So, I also wanted to ask a question. Regarding the jails, what is the treatment protocol?
Thanks. I will let Sandy answer that. Thank you.
Are you talking about the COVID medications?
Yes, I'm asking when they are tested positive for COVID. Are we doing any early treatment? Are we giving them vitamin D and zinc and C, or do we give them medications early on? What is the medical treatment protocol?
Okay, so for patients that are confirmed COVID, they could be either asymptomatic or symptomatic. They get all the monitoring. If they have other conditions, those are being treated. We are not giving them any of those vitamins. If they are deteriorating, that's when they go to the hospital, and the hospital will determine what types of medications that are specialty meds for the COVID.
So we're not treating them in the jails at all until they basically go to the hospital?
Yes, those are in-hospital treatments.
Okay, thank you. I do not have any other supervisors in the queue, and I don't know if you had further information that you wanted to impart on us, Siobhan.
I'll just say one last thing. This afternoon, the CDC did make recommendations for the vaccinations for kids ages 5 to 11. So that did get through the CDC process this afternoon. We are receiving supplies to Sacramento County now, and we will be working with our staff and with our partners to train them how to administer the vaccinations, partnering with the school districts to do that. So that's the most up-to-date news. And then the boosters, as I mentioned last time, have now been approved, and guidance has been issued for folks who have received all 3 types of boosters, and so that guidance is available as well. So that was it. Dr. Casserier was going to give you some numbers about cases amongst children. If you'd like her to do that, we've got some slides. Otherwise, we could certainly hold off on that till next time.
I'll leave it to the board. I'm not sure we can do that. That's fine. I know we're on a time crunch and it's been a long day, and Supervisor Natoli has a comment.
Madam Chair, I'd like to just hear the brief presentation. I know that in the last couple of days, my office has received from some of the school district folks, southern part of the county, regarding some of the exchanges at not just at the school board meetings, but concerns by parents and others, and they've requested our participation as a county, mine, but also health department staff to help address some of those questions. But as part of this, I'd like to just see, because I think this would speak to at least what we're seeing in cases and any spike that's associated with that, if so. But also, I think some clarification about what school districts are, what they're operating. We still have the emergency order here in the county, but any number of items have been required by the state, as I understand it. But there seems to be some confusion out there. Obviously, some very strong viewpoints and emotions regarding it, and what school-age youth are supposed to do or not supposed to do when they're on campus and involved in activities in the classroom and elsewhere. So, I don't want to get into all that right now, but I think it's important to have this, and if we could just have a general response, and I'll be reaching out to you and Dr. Casseri later in the week to see if we can help provide some solid information to folks that will help, at least in some of the discussions that are occurring at local levels throughout this country. But I know that there's been some recent school board meetings, and I know one of the superintendents reached out to me yesterday, and they're going to try to put together a community forum. So
that's great. So maybe Dr. Casserier can just go very briefly, high level, and then we can commit to sending you all a one-pager on the children and school-related vaccinations. And okay, Dr. K, do you want to take some slides here?
Sure.
I'll advance.
Okay. So one of the questions we've been asked lately is because in the past couple of weeks we've seen a little bit of an uptick in our numbers, and what we noted that that increase was mainly due to an increase in children being positive, plus also the outbreak that we have at the jail. So we put together a very brief presentation. It's just 3 slides. So hopefully you're on slide number 2 now,
Yes.
Siobhan? Okay, so slide number 2 just shows you an overview, and I've shown you these tables before, an overview of what the numbers are, the total cases, and what the cases have been the last 3 days, and this is broken up by age group. And what you notice is that for the 0 to 17, In the past, they've constituted about 14.2% of our cases, but in the last 30 days, it's 23.1% of our cases. And as you can see in the last column, this is the only age group that has shown an increase in cases as compared to the other age groups. Next slide.
Dr. Kassiri, on that last slide, could you tell me where this information is from?
That's from the information that we get from the CalReady, that's a database where all cases are reported.
Is that from the CDC or what is the source of the information?
This is Sacramento County data only.
So, this is just Sacramento County.
That's correct.
But what source is this from? Your data? Is it your database, our database in Sacramento County, or?
So the database belongs to the state, but every single positive is reported into that database, and so we are able to extract the information from Sacramento County, and that's what I'm sharing with you right now.
Okay, so it's CDPH is managing that database?
That's correct.
Thank you.
But we have access, a certain number of staff have access, and so they're able to monitor, and that's what we use to update our dashboard as well.
Great, thank you.
Okay, next slide.
Okay.
So this slide just shows you an overview starting from October of last year, and the line that you see, the orange line, just shows you the curve of the wave that we got in the winter time, and then the wave that we're just going through now. And then the colored bars that you see are the number of cases for school-age children as well as for staff. And so the light blue is for staff, and then the dark blue is students. And then as you can see for the last bar, which is the latest information that we had for this ending in October, is that we did have quite a large increase in the number of students that were testing positive. I do have to note that even though we have had some outbreaks in schools, not every single case is linked to school transmission. Oftentimes we do find that the transmission occurs out in the community, but then it's picked up in the schools because many of the schools are doing ongoing testing.
Do we know what percentage of these cases is symptomatic?
No. Most of them do not have symptoms, but some of them do have symptoms.
Thank you.
Next slide. And this shows the cases by school grade. And as you can see from the last bar for October, most of the increase has been due to children in elementary school, and then also in preschool and kindergarten. And as Siobhan just pointed out, the CDC just approved the vaccine for children 5 to 11. So we will be prepared to start being able to vaccinate that age group. As far as hospitalizations, we have had a little bit of an uptick in hospitalizations, but it is still in adults in their 50s and 60s. We have not seen an increase in hospitalizations for children. And that's the end of the presentation that we have. I know that Supervisor Natoli also asked about the mandate or the guidance that the schools have to abide with, and that's actually set by the state. We do not have any ability to change any of the guidance, and many of the questions that we've had come up have been about masking, especially for students that are engaged in sports and music and drama. We have put that request forward to the state, and they are reviewing if there's a way of being able to do more testing or also have the vaccination and therefore relook at what the guidance will be for the masks. But right now, we do not have any change, and we're not able to modify it on our end.
Thanks, Dr. Kasseri. If I could, Madam Chair, very quickly.
Sure.
Dr. Kasseri, if I understand correctly, then any of the rules which apply to schools are not under the emergency order the county has in place. They come directly from the state, and we're not the ones that are applying those. Is that accurate?
They come from the state, and we are not able to be more lax than the state. So the only thing that we can do is when we have gotten the requests from the schools, we have submitted those to the state for consideration.
Okay, but so they are included in our emergency order, the rules?
So basically, the state rule applies for all the schools throughout the state, and the only thing that we added in Sacramento County was an additional indoor masking for everybody, regardless of vaccination status. But according to the state guidance, school children and people within the school, the staff do still have to wear masks, regardless of vaccination as well. So that is separate from the local order that we have.
Okay. Again, I won't take any more time this evening, but I appreciate that, and I do think, Siobhan, having, if it's a side-by-side, or I can make it available to the superintendent so that those boards, school boards, and for any community forum, I know that, again, Siobhan, Dr. Kasseri, and others, public health staff have been very willing to participate, if not, by attending directly, certainly by Zoom, to answer questions and provide clarity around this. And you're right. I know at certainly at the level, at least the high school, middle school, that concern about some of the activities and wearing masks, indoor sports and music and such. I think generally for student population, K all the way up to 12, though, there's some other concerns that relate to the wearing a mask and how that affects people both in the classroom but outside. So, but anyway, we'll get that information from you, and appreciate the response here. Thank the board for allowing that information to be presented. So thanks, Christy.
Thank you.
Thank you, Dr. Kasseri, and also our doctor from the jails.
Dr. Damiano.
Dr. Damiano, yeah, thank you.
Yes, thank you both for being here. And Siobhan, we do have some public comments. I don't believe any of them are here any longer, but I'll see. Christine Abercrombie, Stephanie Sowell, Andrea Hedstrom, and perhaps they're on the phone. Oh, I don't see any of those folks here, so perhaps they're on the phones. They might have headed home because Maybe. It was a long day.
Maybe so.
So now we'll go to our phone public comments.
Okay, can you please transfer the first caller? Hi, caller. Please start with your comments. You have 2 minutes.
Hello?
Hi. If you have the meeting on in the background, can you please mute it and then start with your comments? You have 2 minutes.
Okay, great. Sorry. Good afternoon, board members, or should I say evening. This is Trina Latch again. I worked for hospitals off and on for over 20 years. Bugs were my life. With that said, with COVID having a 99.9% chance survival rate with children and 99.7% chance with adults, which has a greater chance of survival than influenza, why are you elected officials pushing these gene therapy experimental shots upon our most vulnerable? This makes no sense whatsoever unless this is about profit off the backs of the people. This is egregious and outrageous. Informed consent must be obtained from people, no matter if they're in prison or not, and from parents for their adolescents and their children. You do not have the right, nor does Health Department, Big Gov, or CDC to enforce a non-fully approved drug into our bodies. All this is against the new Nuremberg Code. It's unethical. We professionals swore an oath not to inflict harm. I feel sorry for the inmates you are forcing to take these experimental shots. Ex-Pfizer chief scientist for Pfizer has expressed his position on the mRNA technology, and he feels strongly that these will kill mass amounts of people. Do any of you want to be held accountable for this genocide? CDC has just reported that 9,143 deaths have occurred in the U.S. from these shots. The number is rising, and that is what has been reported. I would have to agree that we could potentially kill more people if we are not cautious. Simply, we do not have the proper safety tests and studies for proper duration of follow-up so as to exclude harm. We need to do this first. To me, this is simply
You have 10
reckless,
seconds.
and stupid. And if my children suffer or anybody else I love suffer because of your negligence, I will hold every one of you personally accountable for assault when you could stop this. Thank you.
Thank you.
Okay, next caller. Hi, caller. Please start with your comments. You have 2 minutes. Can you please mute the meeting in the background?
Yeah.
Okay, you have 2 minutes to make your comment, please, and you can start now. Thank you.
Good evening. My name is Kelly Haas. I'm a resident and a mom of an 11-year-old boy. What I was hoping to hear today was to hear elaborated on by Dr. Kassiri was how the shot that received the EUA for children is not the same as the one used for adults and is not the same shot as the one used in the clinical trial. In the FDA briefing document from the Vaccines and Related Biological Products Advisory Committee meeting, which is the Pfizer paperwork submitted to the FDA, Section 5 of page 14 states, Pfizer made a request on October 6th for permission to swap out phosphate buffered saline, PBS, in the shot formula and then replaced it with tromethamine, tris, I think that's how you say it, tris, in the formulation for the 5 to 11-year-olds. For those not processing that, the formula that was given to the kids in the clinical trial did not contain the tris. The FDA letter dated October 29th states that the EUA for 5 to 11-year-old explicitly grants authority to substitute tromethamine into the formulation. That's on pages 3 and 4. To get ahead of the propagandists that will cite misinformation that this was tested, the letter also states on page 3 that the two formulations, those with the PBS buffer, used in kids 12 and up, and that with the tris buffer for those aged 5 to 11, differ with respect to certain inactive ingredients only and have been shown to be analytically comparable. What does analytically comparable mean? The footnote states that the assessment of comparability came from laboratory testing, not a clinical trial. Laboratory testing. The formula with this buffer has not been tested in a trial, and this is what we're scheduling to give the kids. There is zero safety and efficacy data on it. Zero. Read page 7 and 8 of the FDA letter. I just called in to give that bit of information because I really was looking to hear more about that today. This seems to be information that we would want to know when we're making these decisions on how this is going to be administered to the kids. Thank you.
Thank you.
That's it.
Please send the next caller. Hi, caller. Please start with your comments. You have 2 minutes.
Oh, hi. Am I in Sacramento County Board of Supervisors? 5 hours past the agenda time. Am I in the right place? I just want to make sure.
Yes, you're in the Board of Supervisors.
Because sometimes I feel like I'm on the moon, especially when I listen to you people. So I'm going to give credit to the folk singer Roman. I'm not clever enough to write something like this, but he certainly is. And so you still insist that we need a proof of vaccination to exist. And so the lies persist. But some of us can tell, and you bet we will resist. Don't you know it's plain to see the pseudoscience you misuse on the TV and in the Sacramento County Chambers of Board of Supervisors? All the power you abuse to keep the people confused and afraid. How's this lie still going on? It's been going on for way too long. But what do I know? I'm just a mother and a goat farmer. But you know what? I'm not afraid to use my brain and my middle finger. You would have to be blind to not see what this is. And you know what? We do not consent. We will not comply. It doesn't matter if you take our jobs away. It doesn't matter if you take our driver's licenses away. It doesn't matter if you take our property away. You can round us up and put us into cattle cars and a gas chamber, and we will not comply. I'm not sure why you people are not getting the message, because the bullhorn out front doesn't seem to be convincing you. Do I still have time? Because there's other people sharing this phone line that would like an opportunity to speak. The design of this meeting is inherently discriminatory. Okay? We're so done with this. You're going to put these shots in the kids, except there's 5,000 people on the lawn of the Capitol every other week saying no to this. Your little charade is over.
10 seconds.
The parents are done. It doesn't matter what you do. We will not consent. We will not comply. Mandated medicine is a disgrace. Now and forever. We settled this with the Nuremberg Code.
Can you please
you
wrap
people
up
need
your
to read
comments,
up.
ma'am?
You need to read up on your history. You need to read up on the human rights agreements with the bioethics committees and the Nuremberg Code and all that stuff.
Can you please
because
wrap up
what
your
you're
comments?
doing is totally criminal, and we're done with it.
Thank you. Please send the next caller. Hi, caller. Please start with your comments. You have 2 minutes.
Thank you. To continue, Tris is a blood acid reducer. Even in small quantities, it is not advised for people who have asthma or certain underlying conditions. Contraindications include aspirin, cold medicine, cider medication, depression of blood glucose, thus dangerous for kids with diabetes, and contraindicated to a handful of common antibiotics, to name a few. So our babies are going to receive a drug formula that has not been tested on anyone, just lab studies, that has an ingredient in it with a long list of contraindications and risks for kids with certain health conditions. And if that wasn't bad enough, parents are not being given choice to sign their kids up for a vaccine trial, but are having the right to an in-person education for their child used as a tool of coercion in exchange for getting the new jab formula. Inject this drug into your kid that we don't really know what will happen with, but we say it's safe, so you must believe it's safe, in exchange for their education. Schools like those within the Sacramento County Unified School District. According to the county's data, there has been less than 5 deaths related to COVID in ages 0 through 18, less than 5. Tragic deaths, don't get me wrong. However, checking the COVID VAERS reports by state on openvaers.com, just in California, there have been 2 reported deaths for that age range, 33 life-threatening reports, and a total of 3,182 reports overall. This is for the Pfizer formula that does not contain Tris, a blood acid reducer. Yet we learn about none of that from our county public health officer. Why? There is no short or long-term safety study or surveillance, no long-term inert placebo-controlled randomized clinical trials determining safety, thus risk is infinite and unknown. It is not conspiracy, it's math, logic, and common sense. and I'm really concerned that nothing's being done about it. Thank you.
Thank you.
Please send the next caller. Hi, caller. Please start with your comments. You have 2 minutes.
Hello?
Hi, can you hear me?
Yes.
Okay, please start with your comments. You have 2 minutes.
Yes, hi. My name is Amy. I'm calling from Southern California. And I just have one thing to say. You guys are a bunch of scam artists, and you're liars, and you are despicable, and you're just a bunch of clowns. And you know what? Most Californians despise you guys. That's it.
Thank you.
Please send the next caller. Hi, caller. You have 2 minutes. Please start your public comment.
Hi, thank you so much. Good evening. I'm Courtney with Incarcerate Sacramento. It was good to be with you all briefly in person earlier today, but just calling to follow up just very briefly on some of the conversation around the COVID outbreak in the jails. And I do want to thank, Supervisor Natoli always being willing to kind of peel back those layers and ask those questions, and Supervisor Cerna for saying we shouldn't be bashful and figuring out where we can advocate and what's possible and what we can reasonably do in this public health crisis, and Dr. K for offering to talk to County Council. And just want to name that it feels like an elephant in the room, right, that Sheriff Scott Jones is not here at this podium or part of this conversation. And of course, the district attorney and SAC PD, other jurisdiction, of course, but are all not doing their part, and just are filling the jails, far beyond what is really necessary and obviously safe. And I just want to say that I think this is going to have to be a follow-up conversation, because I really don't like to accuse anyone of spreading misinformation or maybe too quickly, like just reading off policies that are written on paper, but maybe not unfolding the way that you claim that they're unfolding. And again, I think that Sheriff Scott Jones and the cops, the guards, the armed people in uniform in that facility really kind of call the shots at the end of the day. That's the power dynamic. We know that people ask for help over and over again. We all know about the red emergency button that people press over and over again, and they're just seen as like manipulators or an annoyance and are not actually treated. And so it's hard to reconcile the kind of two different realities we have consistently heard throughout this pandemic, and really tracing, again, speaking to dozens of people in various pods and really trying to map out what is unfolding, not like hearing one alarming thing and running with it. And so this is going to have to be a longer term reconciliation, I think, of what we're hearing and what we're being told. And I appreciate that this conversation is happening today. It needs to continue like tomorrow, like urgently. And I want to remind us all that
you have 10 seconds.
Thank you. Over 50% of the jail population has an average length of stay of 7 days or less. So again, for any of these actors with the ability to decrease the jail population, we can do this without any public safety issues. Thank you.
Thank you.
Please send the next caller. Hi, caller. You have 2 minutes. Please start your public comment.
Thank you. Seems to me that there is a total disconnect between jail medical staff and what the actual inmates are saying. I have spoken to at least 20 people on the inside who have tested positive over the last couple of weeks. 5 East has COVID. That entire pod is on quarantine as we speak. Even the pod workers tested positive. And I have advocated for people in there who were putting in several kites and were not being treated. Inmates have been told that the jail's medical department is short-staffed. And in the COVID pod on 4 East, there is a sign stating wear a hazmat to enter. That tells us how serious this is, yet they have to beg for masks and cleaning products. These inmates are left to fend for themselves. I definitely know the number we just received is the real new number. When will we let the people on the inside speak? It really pains me to hear Dr. Damiano downplay what is really going on. The Inspector General needs to come into the jails and see what is really going on. I mean, let's be honest. Do you really think the jail is going to admit the negligence on their behalf? Thank you.
Thank you.
Please send the next caller. Hi, caller. Please start your public comment. You have 2 minutes.
Hello?
Hello? Please start your public
Yes.
comment. Please start your public
I
comment.
am.
You have 2 minutes.
Okay. Hello, Board of Supervisors. I'm looking at your graph. I was there earlier and I did have to leave. I'm looking at your graphs where it says COVID cases as of 12/22/21 by the age groups. It does not specify when this started, be it March 1st, 2020. Then I'm looking down at 0 to 17. So I'm a little confused, and you can answer after the fact, or maybe you won't answer. But here's my statement. Why is the California Department of Public Health hiding the no-bid contract for the $1.7 billion for PerkinElmer testing lab, as each of you should be fully aware of? This has come to light this last March, and now 7 months later, the state says the investigation is still ongoing. A positive PCR has little clinical sufficiency and increase in case numbers without confirming the presence of an active infection. Without the expertise of a physician, there is no way to determine if this is a true positive result. The contract with PerkinElmer had requirements to return results within 48 hours and to process 100,000 tests per day, but they have only processed about a quarter of that. No longer recommending testing without COVID symptoms, but the governor stated that he would be adopting the would not be adopting the CDC policy. Now, this lab was not able to handle even 250 lab tests in the beginning. Laboratory Field Services, divisions of the California Department of Public Health, which regulates this laboratory in the state, our state, they found sufficient deficiencies. Again, sufficient deficiencies. So the results
You
from
have
the
15
positive
seconds.
PCR test should be considered as a preliminary result only and does not determine an active infection or hospitalization rate. Thank you.
Thank you.
Please send the next caller. Hi, caller. Please start your public comment. You have 2 minutes. Hello? Hello, caller?
Yes, I'm here. Yes, I'm here. I'm right here.
Okay, thank you. Please start your public comment. You have 2 minutes.
Okay. Hello, can you all hear me?
Yes, we can hear you. You can begin your comments.
Excellent, thank you. My name is Liberty, and as of October 22nd, there are 17,619 human beings murdered and 837,593 human beings had reported adverse events from the COVID technology. Theirs is a volunteer reporting system, and by the Lazarus report, it is utilized to 1% to perhaps a 10% capacity, which brings the deaths to 1.76 million. Therefore, we the people decline the vaccines. We the people decline the passports so we can live our lives. We the people refuse to murder our children to do our part in our country. We the people will not stand by until all of the freedoms in our country are lost and we slip into ruled by two companies and the metaverse. Those who did their part for their community in 2021 to flatten the curve now lost their children, brothers, sisters, moms, dads, grandparents, or their friends. The ones, the lucky ones, to be still alive today, who took the needle, they are paralyzed. They develop deadly blood clots. They have myocarditis or pericarditis.
You have 15 seconds.
Neurological problems. And you, Board of Supervisors, want to mandate this technology based on what? Based on the test, which by the inventor was clearly stated it is never to diagnose.
Can you
any
please wrap
disease.
up your comments, ma'am?
Yes, I'm wrapping up my comment. In addition to that, the vaccine, what was just approved, it wasn't approved. It is only emergency use authorized, under which every human being has a reason to say no. And we
Can
say
you
no.
please wrap up your comments?
I did.
Thank you.
Please send the next caller. Hi, caller. Hello, caller.
Yes.
Please start your public comment. You have 2 minutes.
Hi again, Board. This is Mackenzie. I appreciate you hearing the words that we brought forth to you this morning. I kind of want to say refreshing, but it was cool to hear that there like some sort of actions and the asks and like what can be done on behalf of county was like a question that was brought up today during that presentation. I call because the truth is, though, I can't sit idly by while slanted truths are brought into this chamber as a part of a presentation. Hearing 191 positives was jaw-dropping to me since October 20th. October 20th was 2 weeks ago. Let's not act like that was not just yesterday. Was completely appalling to me. I think what I wanted to highlight was the misinformation around who gets the decision on whether or not the inmate gets medical care. In order to even have a medical person notified, somebody has to speak to an officer. It is 100% at the officer's discretion on when, where, how, or if they turn those kites in. And to say that they're getting round-the-clock treatment, this is mind-blowing to me, considering that the average death, I mean, we've had 13 that we know of deaths inside the jail since the beginning of the pandemic. That does not mean that people have people at their bedsides. That does not mean that there are people who are coming and checking on these people frequently. That means that somebody is coming once around in a blue moon to make sure that you're breathing. Like these policies that are set down on paper are not the truth of what's happening. We have many reports from inside from folks who are telling us the truth. And the truth is, I mean, just reported this morning, our CCC has people who have tested positive in the same barracks as people who have tested negative.
You have 15 seconds.
That does not sound like the protocol that was put on paper and that Dr. Damiano is talking about. I think it's time that you guys go take a visit at the SAC jail and at our CCC and ask these folks yourself. Have a great night.
Thank you.
Please send the next caller. Hi, caller. Please start your public comment. You have 2 minutes.
Hello, my name is Heather Keller, and as we continue down this twisted path of mandated, quote, vaccines, I would just like to point out that numerous studies have shown that, quote, vaccinated people can get COVID and spread COVID at the same rate as unvaccinated. Even the head of the CDC, Walensky, stated that vaccinated and unvaccinated can carry the same viral load. This vaccine is not a panacea. A recent study shows that, quote, while vaccinations are highly effective at protecting against infection and severe COVID-19 disease, our review demonstrates that natural immunity in COVID-recovered individuals is at least equivalent to the protection afforded by full vax of COVID-naive populations. Additionally, the CDC just published on their website the following: a systematic review and meta-analysis, including data from 3 vaccine efficacy trials and 4 observational studies from the U.S., Israel, and the U.K., found no significant difference in the overall level of protection provided by infection as compared with protection provided by vaccination. Lastly, there are many people that are vaccine hesitant for many valid reasons. One group in particular has been subjected to forced medical experimentation without their consent over decades. With the constant focus of equity and equality that Sacramento County and California highlights, I find it unbelievable that they would commit medical apartheid. I am also very concerned about the new strategies for CDPH analyzing COVID cases in which they will omit how many tests were conducted and just show, quote, positivity rate, and will be combining confirmed versus suspected COVID hospitalizations as COVID hospitalizations without verifying with the faulty PCR test, no less, that it is COVID. Does that mean that anything such as the flu or pneumonia, RSV, would be called a COVID hospitalization without test verification? This seems like this is a setup as we go into the winter months where respiratory diseases are more prevalent to keep us in a state of emergency and build up cases. Thank you for your time.
Thank you.
And that concludes your public comment for this item.
Thank you. I want to thank Siobhan and Dr. Damiano and Dr. Kassiri for being here this evening, and we'll see you at the next COVID update.
Thank you.
And with that, we will move forward to our next item, please, and which is item 42. We're
Chair,
continuing our closed session.
I punched in.
Oh, I'm sorry,
right.
Supervisor Kennedy.
You mentioned, and I just want food for thought here. You mentioned the next COVID update, and I think we have seen and we have continued to pile on very, very, very important items. Not that obviously COVID is not important in the next 8 weeks, and for us to get the work done that has to get done between now and January 1st. I'd like to just, again, food for thought. It's not my decision to be made, but make the recommendation that we not hear the COVID report at every single meeting. It's really taking away valuable time that is needed for other things.
I am okay with that as long as my problem with this is that we're now in a situation where the state is mandating vaccines for children. I know it doesn't directly impact the county, but our county public health officer has stated herself that the county supports whatever the state puts down, and so that goes to the districts who look up to the public health officer, and it's important to people. I'm not sure how everyone else feels. I know Supervisor Natoli's in the queue to speak.
Yeah, I hadn't punched up on that. I go ahead and finish the conversation. I wanted to go back to the previous item on some direction on relative to the jail.
Okay. So how does everyone feel about the COVID updates? Why don't we go ahead and...
Well, I do think, I just say we should have an update. We're going to be meeting several times, whether we do it every time we meet, because we're going to be in session on the 16th and 17th. I would think of one of those days we'd have the COVID update, and then we'd come back in again on the 7th and the 8th of December. I don't know if there's anything between that or not. So I would think of one of those days we'd have a report. But not, I don't think it needs to be every meeting. Obviously, people can still call in under public comment. But I think in light, and I would just say that in light of what we've heard about as relates to the jail, and part of my comment was going to be, I was going to ask, Supervisor Kennedy suggested it earlier this morning, I'd like to make sure that the Inspector General is, given the opportunity to take a look at it. We've heard some rebuttal comments to the information was offered. IG isn't necessarily the decider on all that, but I think that would be useful. And in addition, I wanted to ask about, again, when our closed session got put over today, but we have monitors under the consent decree that are in there looking at all aspects of jail operations. And COVID, obviously they saw the incidents that occurred earlier in the spring. Those folks are there on a regular basis, and not that we need a lot of people looking over our shoulder, but I still think that they're experts, and they're certainly respected within the arena in which we are, working under the consent decree, and so I guess I would even go as far as that maybe the IG and the monitors get a chance to take a look at that, and we get some report back at some early time. But as far as the COVID report, posing the question, I think, having another time this month on one of the days that we're in session, recognizing the days are long, and secondly, at least once in December, and then we won't be back in until January. So I think,
I can concur with that. I think that seems reasonable. And can you request that the Inspector General look into the jail situation?
Yes.
Okay. Thank you. Was that all you had, Supervisor Natoli?
Yes. Thank you, Madam Chair.
Thank you. And so are you happy, Supervisor Kennedy? I thought you would be. I knew you would be. We worked it out.
Chairperson Frost, before we move on to item 42, we need to take about a 10-minute break to set up for the technology.
And do we need a motion to continue closed session, or can we just continue it without voting on it?
We don't need a motion.
Okay, and I knew that. I just forgot. It's been a long day.
Well, we're just going to reschedule them till the next meeting or a meeting in the future.
Okay, and at this time, we're going to take a 10-minute recess to prepare for our redistricting workshop, and we'll be back at 6:30. Meeting is back in session, called back to order, and we're excited to address our last agenda item of the day, I think. So with that, I'll ask our clerk to please reestablish quorum and call the next item, please.
Yes. Good evening, Supervisors Kennedy.
Here.
Natoli.
Here.
Desmond.
Here.
Cerna.
Here.
Frost.
Here.
And you have a quorum. Item 42 is the 2021 redistricting discussion of proposed draft district boundary maps.
Good evening, Natasha.
Hi, good evening, Madam Chair and members of the board. I'm Natasha Drain, your Governmental Relations and Legislative Officer. We're here tonight to discuss the first round of draft redistricting maps. Doug Yoakum with NDC is the demographer that drafted the 3 maps attached to the board letters. Those are maps 201, 202, and 203. Doug will provide a presentation in just a moment, and he is eager to hear your and the public's feedback. We also have Douglas Johnson with NDC here to assist with your questions. Before I hand it to Doug, I think it's important to briefly note the meetings we've held since we officially started this process in April. We've held 2 board presentations in April and in May, 2 official public hearings in June and August. Today's hearing constitutes our 3rd public hearing under the Fair Maps Act. We've held 2 virtual workshops in June and 6 district workshops, 1 in District 1, District 2, District 3, and District 4, and 2 in District 5. Those were held in July, August, September, and October. This list does not include all of the outreach and engagement that Kim Nava and Courtney Bailey and their teams have done through other outlets, including news releases, social media, the county's mailed newsletter, as well as attendance at community-based meetings. I would also like to note that we added an additional virtual workshop this Saturday, November 6th at 1 p.m. to get the public's input on the proposed draft maps. The public can find more information about this workshop and redistricting generally on the county's redistricting webpage at www.redistricting.saccounty.net. That concludes my remarks. So with that, I'd like to invite Doug up to the podium to begin his presentation. Thank you.
Good evening, Doug.
Thank you, Madam Chair. Thank you, the supervisors, and I'd like to thank the staff of Sacramento County that we've been working with. It's been a really good cooperative effort. I'd like to thank all of you and your staffs as well as we have moved along here. We're getting there. and we will continue to go along. Here's what we're going to do today. We're going to run through a summary of the online comments that we received from the public, and there's a summary of the input that some folks have put in about particular neighborhoods. Look at the submitted maps from members of the public, and look at the draft maps drafted by our company. And then we'd like to hear public comments, and of course, comments of the supervisors providing us direction as to where to go next. Quickly, these are the rules that we go by. We've seen this before. Number one, of course, is equal population. We will follow the Federal Voting Rights Act and the Fair Maps Act, which has these 5 criteria in priority order. And to the extent possible, we have traditional redistricting principles that we will also be following at your discretion. There we go. Here's the summary of some of the online and workshop comments we've received about redistricting. First of all, Rancho Murrieta belongs in District 5 and Gold River belongs in District 3. We've received a lot of comments from communities such as in the unincorporated area that they would like to be kept together. Specifically, we've heard from folks in Fair Oaks, Foothill Farms, and Carmichael. We also got a comment describing a Castlemont Ranch community, which is just north of Elk Grove. They told us what their community boundaries are and expressed a desire to remain in District 2. That happens to be in the Vineyard area, just for your information. There's a map on the website describing the West Arden Arcade area and distinguishing it from Arden Oaks and Sierra Oaks, and a desire to keep that particular part of Arden Arcade together. And as an example of differing kinds of comments that we receive, Gold River in District 4 is not compact. That's the famous arm that we talk about from the map of 2010. We've also heard that Rosemont and Gold River belong with Rancho Cordova, and the old Cordova planning area should be kept together. We also received a comment from the LGBTQ community, and they submitted a map showing where their community is, and that's this slide right here. Thank you. You'll recall, Supervisor Cerna, at your meeting we had some comment on this, and this is the map, I think, that reflects that commentary. You'll see some of the communities that the LGBTQ community believes, and I'll just read their submission that they put in online. Evidence of LGBTQ plus concentration shows a common community of interest in the following neighborhoods: Central City, Upper Land Park, Curtis Park, East Sacramento, parentheses, particularly the Thrifty 30s, Elmhurst, Med Center, and McKinley Park. There are also pockets of LGBTQ plus community of interest in Southland Park and Tahoe Park. Most of these concentrations are located in District 1. I wanted to read specifically what their commentary was that they submitted. We also received some commentary about what particular neighborhoods and their boundaries are in Sacramento County. We heard from some folks in the Vineyard community. There was a map submitted regarding what is historic Rancho Cordova and logical Rancho Cordova. And if you look at the two maps that are on our website, you'll see that those two maps are almost identical. We also received the West Arden Arcade community commentary that I spoke about earlier. The Tahoe Park Neighborhood Association Land Use Committee submitted a map of what they consider Tahoe Park to be. There was a submission regarding North Oak Park, a submission about the Franklin area, and there was also a very interesting comment, Madam Chair, from the Antelope community. They specifically highlighted approximately 800 people right around Roseville Road, and they said, we are Antelope, we are not Citrus Heights. And they requested a change in their zip code.
That's not a new. It's not new.
I wanted to put it here because they put it on our redistricting website, and I wanted to highlight it so that your staff knows that perhaps there's somebody out there that they need to call.
Thank you.
We received 8 submissions from the public with a full map proposal. 3 from Mr. Andre Ramos that I'll show you in a minute. 2 from Sophia Cardenas. She represents the Central Labor Council of Sacramento. And there were 3 other district submissions on the website from members of the public. And then there's our 3 map options that we'll be showing you. Here are the 3 submitted by Andre Ramos. And I'll try to describe them quickly. And ignore the district numbers on these things, because the program that we were using online automatically assigns district numbers, and it's not necessarily in the order of current districts.
Madam Chair, Doug, can I just ask you on that, because my briefing asked yesterday, irrespective of the program automatically assigning, I think it was a little confusing to folks. There was an explanation, and certainly people could read that, but ever how it numerically put those in, and I know you didn't have a chance to check the intent, but it wasn't like we had hundreds of maps submitted, so I guess I would just say that my expectation would have been, and I'm saying this in a nice way, but that you could have assigned the district boundaries so that it didn't look like 1 shifted out to northeast area, and that 5 shifted out to the northwest, and that 2 shifted down to the Delta or down to Herald. Just from the standpoint of if you had folks that actually, we encourage you to go to the website, there should have been a way to do that pretty quickly. I mean, Andreas submitted 3 of the maps, Sophia had submitted 2, you had 3 others, and then you had yours all fit the thing okay. So I just, for future, as we're going through this, any iterations, whatever your program spits out, I would hope that you would make sure the assignment so we could see exactly what those districts are that would reflect the supervisorial number, not just the geometrics that are on the colors on the map. So okay.
We will see what we can do.
Okay, good. I understand the explanation. It just seemed to me that, again, if you had hundreds of maps, I would get it. But for the handful, the 9 that you had, it would seem that you could have verified with the folks who submitted what their intention was, and I think it was understood. But you didn't take the liberty of doing that. I understand it, but anyway, I offer that as a comment. Thanks.
Very good. We will look into that,
okay,
Supervisor.
Thank
you.
You bet.
Quickly describing what we put on here is map 101. District 1 moves into the Rio Linda, Alberta, and other areas in the north area. Maintains McClellan Park and stops at Highway 50. District 2 then goes basically into the South Sacramento area as it currently does, but doesn't touch Vineyard like it currently does. District 3 is actually District 4 on this map. It starts in Foothill Farms and comes down into Arden area and maintains Carmichael. District 4, which is number 1 on this map, Citrus Heights, Folsom, Orangevale, Fair Oaks, all of Rancho Cordova, and all of the Mesa area. And 5 is the remaining part of the South County, which is Elk Grove, Herald, and Ileton, and Wilton, and Rancho Murrieta.
Well, excuse me, did you say District 3 would be District 4? Because if that was the case, I would not live in my district.
I understand. District 4 on this map would be mostly comparable to current District 3.
Oh, I see. Okay. I
And
must have
District
heard it wrong.
1 on this map is most comparable to current District 4.
Got it.
And I just wanted to read Mr. Ramos's description of this map. This map moves Florin and Vineyard into the Oak Grove South County District. They have much in common, geographically close together, common social and economic ties, and keeps the large Asian Pacific Islander community of interest together. It also puts Rancho Cordova Folsom in the same district. They share a school district, and there is a community of interest because of their children go to the same schools. This map ensures that every district has a substantial amount of unincorporated area within their boundaries. However, it maintains Supervisors District 3. His map 3 that doesn't describe this, but as predominantly unincorporated to ensure the voice of the unincorporated community, arguably a community of interest, has a district voice on the board. I think he meant the current District 3. Just quickly describing his second map, 102. Again, District 1 goes into the Rio Linda, Alberta, and north area, maintains McClellan Park, and again stops at Highway 50. District 2 is very similar to his first map. Then he changes District 3, which is 4 on this map, and takes Carmichael and Arden Arcade and adds Mather and Rancho Cordova. District 1 on this map, which is comparable to District 4 currently, starts in Foothill Farms, Citrus Heights, Fair Oaks, Orangevale, and Folsom. And District 5 is the same as his district as District 5 in his first map. And I'll read you his description very quickly. This map moves Florin and Vineyard into the Elk Grove South County District, same as the last map. It puts Rancho Cordova in the same district with Arden Arcade, Carmichael, and Rosemont. Rancho Cordova and Rosemont are in the Cordova Recreation Park District, and they share common amenities, recreation programs, and other interests relating to recreation public services. These communities are all next to the American River, share and use common natural resources, such as walking and biking, and shop in the same nearby commercial centers. By putting Rancho Cordova into the current Supervisor District 3, the map ensures that every supervisor district represents a significant amount of incorporated cities along with unincorporated areas, resulting a city, non-city balance of representation in each district. Quickly describing his third map, which is 103 in your, it has the same configuration. Well, it actually changes District 1 significantly. Goes in, District 1 now takes in almost all of Foothill Farms and all of North Highlands. Again, stops at Highway 50. District 2, no, I'm sorry, it stops at the American River. So District 2 moves into downtown and takes in everything south of the river, and maintains its current configuration on the south border. District 3 in this map, let's get this right. District 4, well, in this map, it puts Carmichael and Citrus Heights in the same district.
To Supervisor Tully's point, if you had the numbers the way they should be, it'd make your job a lot easier.
That's right, Doug.
Make it all.
Yeah, on this one, we're not going to be able to distinguish between District 3 and 4 because both territories are in the same district in map 103. It has Citrus Heights, Arden Arcade, and Carmichael in the same district. District 1 on this map is, I guess, could be current District 4. Rancho Cordova, Folsom, Orangevale, Fair Oaks, all of Mather, and all of Rancho Murrieta as well. And District 5 is the Elk Grove, Herald area and goes up into the Florin area. I'll read his description of 103 very quickly. This map moves Florin and Valley High North Laguna into the Elk Grove South County District, current District Supervisor 5. They have much in common, are close together, share common social and economic ties, and keep the large Asian Pacific Island community interest together. Also, these areas are all in the Elk Grove School District, so their kids go to the same schools. The map puts Rancho Cordova and Folsom in the same district. They are in the same school district. So there's a community of interest because their children go to the same schools. It keeps Rancho Cordova and Rosemont in the same district because they are in the Cordova Recreation and Park District, and they share common amenities and other interests relating to recreation and public services. It creates a Business 80 corridor district of Arden Arcade, Carmichael, Foothill Farms, and Citrus Heights. These communities fall along the freeway and share much in common. This map also ensures that every supervisor district has a balance of city/non-city. So I've described Mr. Ramos's districts. And here are some other public map submissions. Map 104, if you saw it on the website, it's named the Dillon map. It has District 1 again it's District 5 on this sheet. District 1 goes into Rio Linda, Alberta, and Antelope, Foothill Farms, and North Highlands. Stops at the American River. District 2 on this map, numbered 1, goes east to Rosemont and portions south. District 3, District 2 on this map, has Arden Arcade, Carmichael, a significant portion of Citrus Heights, and Fair Oaks. District 3 on this map, which is actually District 4, has Orangevale, Folsom, Rancho Murrieta, all of Rancho Cordova, and Mather, all the way down to the South County. And the leftover, the rest of the county goes up into South Sacramento, which is District 5, now 4 on this map, and it has half of Elk Grove, half of Galt, all of the Delta area. This map succeeds in dividing three of our unincorporated areas, three of our incorporated areas, and divides the city of Sacramento instead of the current 3 ways into a 4th division. Number 105, if you saw it on our website, it's called the Intact City Boundaries Map. Again, it has a 4-way split of the city of Sacramento, but if you go on, District 1 would be District 3 on this map, starting at the airport, encompassing Natomas and downtown, and going into almost all, well, it stops at the pocket area. It has a little pocket and all the land park area in it. That would be District 1. District 2 in this map is District 4 on this map, and starts in the pocket area, includes all of Meadowview, North Laguna, and goes east, encompassing all of the vineyard area, pretty much all of it, and then comes up and gets Rosemont. That's District 2, numbered 4 on this map. District 3 on this map is probably District 1, which starts in Arden Arcade, Carmichael, Fair Oaks, and encompasses Orangevale and Folsom. Then District 4 on this map would start in Citrus Heights, goes all the way over almost to the airport, and also encompasses this part of Sacramento the Del Paso Heights. It also has Del Paso Heights in it, along with Rio Linda, Alberta, North Highlands, and the Foothill Farms area. That would be District 4 on this, which is number 2 on this map. District 5, again, starts in the Delta, contains all of Elk Grove, continues to have all of the city of Rancho Cordova and Mather, and Rancho Murrieta contained in the 5th district. That's map 105. Map 106 puts Antelope in District 3, which is numbered 4 on this map. So that necessitates District 1, number 2 on this map, taking in Rio Linda and Alberta, almost all of North Highlands and Foothill Farms, comes down to Highway 50 in Sacramento. That would be District 1, which was District 2 on this map. District 2 on this map is District 1, which again starts right around Land Park and goes east all the way to the Mather area. District 3 is District 4 on this map. It adds Antelope, portions of Citrus Heights, and has Carmichael and Arden Arcade. District 4 is numbered 3 on this map, contains the rest of Citrus Heights, Fair Oaks, Orangevale, Folsom, the city of Rancho Cordova, and the Rosemont area, and I believe La Riviera. That would be District 4, numbered 3 on this map. And District 5 is Elk Grove, Olive Vineyard, Rancho Murrieta, and everything south.
It actually comes into the North Laguna Valley High area, if I'm not mistaken.
Yes, it does.
Yeah.
Yes, it does. Which is why I mentioned that it splits the city of Sacramento 4 ways.
Yep.
Map 107, submitted by Ms. Cardenas on behalf of the Central Labor Council. I'll describe it. District 1 has the airport. It stops at the river on the south end, goes to Rio Linda and Alberta, contains a significant portion of North Highlands and Antelope. I think it contains all of Antelope. It's numbered number 3 on this map. District 2 is numbered number 5 on this map and is basically a Sacramento city district, very centrally located in the Sacramento area, all the way down to, I don't think North Laguna would be included in District 5 on this, which is District 2. District 3, well, we have a 3-4 combination here because Carmichael and Citrus Heights are in the same district in this particular configuration. District 4 is how it's numbered on this map. District 2 then starts in the Florin area and contains Vineyard and Rancho Cordova, Orangevale, Folsom, and Rancho Murrieta. And, let me get this right, Fair Oaks. It would also have Fair Oaks in it. That's District 2 on this map. Then District 1 on this map is the south area, again going into South Sacramento, containing all of Elk Grove and all the way down the Delta. That's District 1 on this map, which is District 5. Map 108 I'll describe very, very quickly because it's again, District 3 is District 1, contains Rio Linda, Alberta, part of Antelope, part of Foothill Farms, contains McClellan, and then comes down to looks like Highway 50 in the city area. District 2 on this map comes all the way down to the Elk Grove border, including North Laguna. Then looks like perhaps this splits Rosemont. I can't tell from this from this map. That's District 2 on this map. District 2 currently. District 3 would be District 5. Has half of Rancho Cordova, all of Carmichael, all of Arden Arcade, and a very small portion of North Highlands and Citrus Heights. Fair Oaks appears to be split in District 5, which is would be the current District 3. District 4 has most of Citrus Heights, half of Antelope, looks like most of Foothill Farms, then contains Orangevale Folsom, and half of the city of Rancho Cordova. And the District 5 is the South County, starting at the Rancho Cordova border. That would be Jackson Highway there, and then south Rancho Murrieta, Elk Grove, and a significant portion of the South Sacramento, the Florin area. That's 108, which was also submitted by the Labor Council. Now here's some draft maps that I put together, and let me state at the outset, my maps are no better than any of the others that you've ever seen. In fact, some of them are probably worse. It's intended as a story to try to illustrate what the population problem is in Sacramento County and getting everybody to an even number. And one thing I should have said on each of those maps previously is that they are population balanced to an extent. Some of them are higher and lower than others, but they are technically balanced population-wise. So these three maps are intended to tell a story as to what the problem is regarding population in Sacramento. Map 201 holds District 1 and 2 static because technically they are both balanced and equally populous. We don't need to change them for a population reason. District 3, which is short of population, in 201 simply adds Gold River, and that takes care of the population problem that District 3 currently has. Then District 4 goes into, which has a population deficit currently, goes into Rancho Cordova. But I was trying to figure out how to do that because Rancho Cordova is too big to encompass all in one district if we keep the current line pretty static, which is what I did on District 4. So it takes the northern half of Rancho Cordova, and by eliminating the quote arm that we talked about earlier that reaches into Gold River for District 4, we create a new arm which reaches into Rancho Cordova and only takes half of the city. And District 5 maintains its current border pretty much, and goes, excuse me, and goes up to, because District 4 currently contains Rancho Murrieta, and I kept it there and used Jackson Highway as a southern border, and it encompasses, in order to get its population, it takes, the District 4 took Mather and half of Rancho Cordova on the southern end from District 5. Then the 202, I should describe the arm there because the arm is not Rancho Cordova in 201. The arm goes into Rosemont by maintaining that portion of District 5 and only taking the necessary population for District 4 from Rancho Cordova and Mather. So District 202 again holds 1 and 2 static. District 3 takes in the Gold River, and 4 in order to get its population, takes it from northern Rancho Cordova rather than southern Rancho Cordova, which leaves Rancho Murrieta, Rosemont, and that whole area still in District 5, and the populations are balanced here, but Rancho Cordova is split in half, basically in both 201 and 202.
Excuse me, Supervisor Cerna.
Let me correct you, Doug. NDC 202 does not keep what is today District 1 entirely intact. There is a change in that it would hand over Alberta on either side of, and Rio Linda on either side of the northern part of McClellan Business Park to District 4.
That's correct. In 202, I did take the unincorporated portions of North Highlands into District 4, and McClellan remained in District 1.
No, not Foothill Farms, Rio Linda, Alberta. Foothill Farms stays in District 3. Just want to point that out.
In 201 and 202,
Excuse me.
yeah, there is a slight change in Rio Linda. You're correct.
Supervisor Desmond, please.
Thank you, Madam Chair. And thanks, Doug. Also, in 202, I notice south of I-80 there in Foothill Farms, it carves out a little tiny piece of, I think that's Old Foothill Farms south of I-80. Did you notice that? Very small little sliver. And I was curious if you're aware of that, or maybe, you know, was that intentional?
I'm not aware of that.
Oh, okay. All right. Got it.
Anyway, let me look. But between 201 and 202, District 3 is in 201. District 3 is 2,500 people over, and in map in 202 it is 500 people under. So there are differences in District 3. I just can't remember what they are specifically. But the basic one is adding Gold River to District 3. So the problem is illustrated here is that Rancho Cordova is too large to take care of if we encompassed all of Rancho Cordova and kept everything else basically static, Rancho Cordova is too large to add to District 4 to make up for its deficit. So, what do we do? If we'd like to keep Rancho Cordova together, which is a requirement of the Fair Maps Act, if we possibly can, let's put it into District 3 in its entirety. And that's what Map 203 does. And again, maintaining Arden Arcade, Carmichael, and Fair Oaks as the basis, and making up for the population deficit in current District 4 by adding Foothill Farms and portions of North Highlands into that district. And it maintains Folsom, Orangevale, and Citrus Heights in their entirety in the district. But instead of going down to Rancho Murrieta, District 5 then takes over Rancho Murrieta and the areas around the city of Rancho Cordova, including Mather, and District 1 and 2 are changed in this configuration because I wanted to reduce the three-way split of Sacramento into 2 by adding Campus Commons into District 1. I also attempted to unite the Oak Park area, which some have noted is currently split, and Oak Park, Curtis Park, and Land Park are all in District 1 in this configuration. So in District 2, I was trying to get it out of Vineyard because there was some commentary that District 2, that Vineyard is more belonging with District 5 rather than District 2. So I tried to do that, but what I made sure of that I stopped at the Elk Grove border so as not to split that community, and I didn't want to take District 2 down the Delta. So I stopped in the Vineyard area, basically at Castle Ranch, which is Elk Grove, Florin Road, and said, here's where we're going to split Vineyard, and it's less of a split than it currently is, and there's less of it in District 2 than currently, and District 5 gains most of the Vineyard area.
Excuse me,
yes.
excuse me, Supervisor Cerna.
Thank you. I thought I heard you say just now, Doug, that currently Oak Park is split.
No, I meant to say Land Park.
Okay, all right, thank you.
And Supervisor Natoli.
Yeah, Doug, just to be clear on 203, you do encroach into the delta, Freeport being the beginning of at least the unincorporated portion of the delta. There's a portion of the city of Sacramento that is in the legal delta, and I don't get why on that map. And then the other area that's currently in D5, which is the buffer lands, which is largely uninhabited. It's not in the city. It's unincorporated area. Population-wise, it doesn't carry, but probably just a handful of residents, and won't. It's in the floodplain. It's protected area. So I guess I'm curious because, and that's at the headwaters, at least portion of the headwaters, as it relates to areas west of 99 and adjacent to I-5. So why in that map you retain the existing boundaries again, which where District 5, District 2 meet, but it keep those district boundaries and your two previous maps keep the delta wholly, at least the unincorporated rural portions, the rural towns together. So why did you, population-wise, it probably didn't make a smattering of a difference, but.
Yeah, here's my thinking in this drawing of District 2, and I may repeat myself a little bit here, because I drew one and I said, okay, let's unite the city into District 1, and let's unite Land Park. So I completed that process. Mm-hmm. Then I drew District 2, starting at basically Greenhaven, and going down to Elk Grove, and taking in significant portions of South Sacramento City. Then I got to the border of Elk Grove, and I said, okay, I'm not going to cross that. And then I started working on Vineyard, because there was some commentary that Vineyard belongs in District 5. So when I started withdrawing District 2 from Vineyard, it told me I needed more people, and that would have sent me past Elk Grove down the Delta. And I don't think that's something I wanted to do. So I stopped trying to remove all of Vineyard from District 2.
No, I get you. I heard you on that. I just wanted to say, though, whatever little adjustment you made over there on the west side, southwestern corner of your map on ND on 203. Mm-hmm. I don't know what you picked up in the population. You got 80 people or 100 people in Freeport.
There's not much folks down there, which means that if you start sending that district down there, it's going to very quickly reach Alton.
No, I wasn't sending the district. I'm saying take it back. You're not following me. If you went back and you just retained it with the current boundaries is what I was saying. You didn't. You're not losing or picking up more than a couple hundred residents. Mm-hmm. So I get your point. But you changed. I'm not kind of tweaking it from what it was previously. In the other two maps. So the other two maps, you retained it, but you don't pick up the population by doing what you did on this one. To speak of, a couple hundred folks.
Right, and if you look at the difference between 202 and 203, I think you'll see that it moves north. District 2 moves north because District 1 moves south.
Okay, yeah, but you're in a different part of the world. I'm talking about where D5 and D2 meet, and if you just use the existing boundaries which you retain in these two maps, if you keep the delta entirely in District 5, the population of the town of Freeport and a smattering that are out in the area between Franklin Boulevard and south of Delta Shores there, that's what I don't know why you moved it there. I guess that's what I was asking you.
And the reason I did that is because I was trying to withdraw District 2 from Vineyard, and it was picking up population. And you're correct. I picked up Freeport, and if the consensus is that Freeport doesn't belong in District 2, it more properly belongs in District 5, we should work on that on the
Yeah, and
next
again,
draft.
I'm just asking because the population is so small. I get it, you're doing it with models and so forth. I'm just trying to have some understanding because you understand what you did on the eastern side of it. I was just trying to get some sense because trying to keep communities whole, and I want to have a conversation in a moment about Rancho Cordova. But
Right.
I was just looking as I was looking at the map and, the overall here, so.
Right. While I was drawing, I didn't know how far past Freeport I was going, but I said to myself, I don't want to go much further than this because the Delta probably doesn't want to be in a Sacramento City district.
Yeah. And I'm not reflected on that. I'm just saying your current boundary here, shifting, if you kept it static, you didn't pick up or lose much population either way with your map 203 because you held those in 1 and 2. You moved them slightly, but again, the population shift is got to be measured in a few hundred at the most.
Understood.
Yeah.
Understood.
Okay. Yeah.
So let's get to the main problem, which is...
Well, before you move on, was that relating to your conversation with Supervisor Natoli? Or because Supervisor Cerna had some comments as well.
No. Please, and then we'll move on.
Okay.
Great, thank you, Chair. So I would like to ask a fundamental question of you, Doug. I know that in the slide that you presented this evening in your introduction, as well as I think the first time you presented to us, you explain carefully what's required of us legally, and then you also explained some of the more important principles to follow when going through an exercise like that. One of those principles is kind of understanding and respecting the cores of existing districts. What I didn't see, but I kind of assume, and tell me if I'm off base, is I think there's something to be said for continuity too, in terms of not the people that represent the districts, but the geography of the districts, regardless of who is in the chairs, in the seats. Because remember, there's a certain infrastructure around how we represent our constituents that includes our district staff, that includes our departmental staff. In other words, there is a lot to be said, I think, for kind of institutional memory and history of what issues that are geographic in nature are important to that district regardless of who is representing the district. And so, especially as it regards districts 1 and 2, which you've already mentioned could already, they're already equalized essentially, or at least they're well within the margin. So, some of these maps, most notably the public maps, they go very far in changing the boundaries, extremely far, I would argue, in changing the boundaries for arguably 2 districts that don't need much change at all, if any. But I get the nature of this. I've been through this exercise once before, and it's like a puzzle, right? You move something over here, and you got to counterbalance it with a shift somewhere else. But what we haven't really heard from you or council or others is kind of what is the import of kind of respecting the continuity of the geography involved.
I believe is very important, and if that's the direction you want to maintain, then we will do that. We should do that. That's why we mentioned it again in the first part, and in every iteration of our talk about the rules that we're going to follow here. So I hear what you're saying, and we will take that.
Sure. Thank you.
Thank you, Supervisor Cerna.
Thank you.
I agree with that. Supervisor Natoli.
Yeah, Doug, I know you're going to go to the point that I think we all need to talk about this evening. And again, I want to thank you for your effort. I mean, again, I know that you've done models, and we've had the suggestions from members of the public.
I think what I said was I was trying to tell a story.
Yeah.
And there's an ending to the story.
Right. There will be. There's going to be a period at the end of this when we get done at some juncture. I guess what I wanted to put out there before you kind of talk about the issue of division, you're aware of the correspondence that came in this afternoon?
Yes.
Okay, that's good. I want to because I know we made sure that the incorporated cities within the current District 5 all got the information sent out to them, and I trust all the jurisdictions got it maybe from a couple different sources. But in that communication, there's a specific request and then some suggestions, and the underlying request is to keep Rancho Cordova whole. And then there are areas of which they are tied either directly or by other community lines together. And so whether it's school district, park district, long-time affiliation with Mather Air Force Base, formerly Mather Airport, and currently a portion of that is in the Commerce Center. The front portion, remaining portions in the unincorporated area, but nonetheless, there's certainly identification with the city. What I wanted to ask about was that in your map 203, if you could project it up there, what that does do, and again, you can't take into account people who aren't yet living there, but you have major growth areas there and so whether it would go to in 203, whether as shown on your map or something that would be along the lines of the what City of Rancho Cordova has asked. They didn't submit a map, but it made a request that you could plot on a map. Is that you've got growth corridor in the county along the Jackson corridor. There's been submittals for somewhere upwards of 25,000, probably closer to 28,000 residential units. And then to the east of the boundaries of Rancho Cordova, where District 4 and District 3 in this map abut District 5, the eastern area, the Aerojet property, which has had entitlements for any number of years now, and as they've worked through their various milestones, have yet to come out of the ground with the residential portion, but that will include several thousand homes as well, and then of course the vineyard area, which you play with quite a bit in the models, which is a continuously growing area and one of the fastest growing areas, certainly in the county, but anywhere in the state, census over census. So I guess what I wanted to ask about is that, can you take into account future growth areas that have a certain level of entitlement, or you're not able to do that because I think it's relevant to maybe helping make some of the adjustments here, and I don't know if you took that into account or not, so maybe the answer simply no. So
we can. As I mentioned at the very beginning, we can take that factor into consideration if we so choose.
Okay.
However, we want to maintain, as much as possible, equally populated districts.
Got it.
So there are many reasons that folks want to underpopulate a district simply because they don't want that district to go into an area.
Got it.
Or they overpopulate a district because they want to add some areas. So there are all sorts of reasons to draw a district.
Okay.
And let me then proceed to what I was trying to get to.
Sure, that's fine.
Which is the end of this story, because this is directly relevant to what you're saying. What I did in map 203 is I said, okay, we're going to solve District 3's population problem by moving it into the city of Rancho Cordova in its entirety, so as not to split it, as my previous maps did. Right. And we're going to take care of the problem that District 4 has in its population shortage by adding from District 3 the Foothill Farms area and significant portions of North Highlands. So, however, the district, if you look at your population sheet for NDC 203, it looks like this. You'll see that I haven't finished this process because District 4 in map 203 is over by approximately 14,000 people. That's 4%. We don't want to. 4% is not ideal. We'd like to be closer to 1 or 2. And then District 5 in NDC draft 203 is under by 16,000 people. So it needs more people added to it because its percentage of deviation is 5.25%.
Just give it 10 years, it'll grow right back into it.
That's what we're talking about here. We can,
Yeah.
if we so choose, take that into consideration. However, we don't recommend that because a 5% overpopulation is might be a problem. Might be someone who would say you're not equally representing each of these. Not all these districts are not equally represented in the entire plan. So, as the decision makers, what should we do? Should we split the city of Rancho Cordova? Should we split the city of Folsom by adding 16,000 people to District 5 and taking care of this population problem? Or is there another way to do this, which is perhaps if you add portions of Rancho Cordova, the southern 16,000 people in the southern portion of Rancho Cordova, that would push District 3 north back into District 4, and then that population problem, on this map, that population problem would be addressed.
But Rancho is then split again.
I didn't hear what you said, sir.
But then Rancho is then split again, correct?
Right. You would split Rancho, or in another scenario, split the city of Folsom, which I don't think either one would like.
No.
So give me ideas, give me suggestions.
Well, if I could, again, we want to hear from the public on this, but I think in light of the correspondence from, Doug, in light of the correspondence we received from City of Rancho Cordova to, maybe run some models that, again, at Mather, you've got Independence at Mather, population probably of 2,500, maybe 3,000. There's, you got the numbers, but 1,200 homes. And they've asked to include that area, and I don't know. Again, I for one don't want to split the cities if at all possible.
We don't want to.
I just certainly don't want to split Rancho Cordova. And if you can't, I'm be very frank about this. If it can't be retained in District 5 because of all the other logistics, then I understand that. But I think keeping cities whole. And some of those are relatively new cities, certainly Folsom.
Yeah, and we are required to do that to the extent possible by the MAPS Act.
Right. And then areas in common, recognizing that Rosemont has 23,000, La Riviera has about 10,000, Mather probably has 3,000. I don't know what that does for Districts 3 and 4 on this map, or potentially District 1, and I can imagine that colleagues looking at this, District 2 changes fairly dramatically as it relates to District 1 on that map. So, but I guess some sort of a model that would look at what Rancho Cordova has suggested, but recognizing that keeping the city whole is a very important premise, and so that's why I look to your map 203, because I get it on the other maps. Otherwise, you begin to ever how you cut it, you start dividing it up, 2 or potentially even 3 ways. I guess your maps don't reflect that, but. And the vineyard area has already been shared. It's been shared between District 2 and District 5 that changed over the last two census. And so you've kind of, but I think some continuity there, but that's a growth area. There's no doubt about it. That'll continue to grow as well. A lot of approved development that's, building out as the years go by here. So. But again, I think that I'll just say for purposes, I think, a good place to start from here, and I appreciate the input that, others have suggested that might provide some tweaks that don't throw things out of a corridor.
That's the intent, is to start.
Yep.
And as I mentioned to one of the supervisors earlier, nobody ever likes the first draft. It's one of my rules of redistricting.
Yeah.
So tell me give me other ideas.
Okay, I'll wrap up for now, but I'll just say I take what Rancho Cordova incorporated in their letter, or put into the letter, and then, you might run some variations on that, because they basically, as Mr. Abhar has laid out, he said they think it would be logical to include Mather, Rosemont, Large Rock, Riviera, College Greens, East in a district, but that may begin to throw things off significantly because you add all the population of Rancho, you have all of Rosemont. But I think maybe some, iterations of that, maybe just as you've shown it here, you take the entirety of the city of Rancho Cordova, maybe you incorporate Mather as a part of that, and run those scenarios so we get some sense on the numbers and how much we get out of whack. But I would think that would be the area that we would want to look at in District 5, but to maintain, I think, city of Rancho Cordova together as a whole. And then I would just suggest, as I said, that tweak on the Delta, that you keep Freeport in District 5 as well as the regional plan buffer lands. But I think that's enough for now. I mean, I want to hear from folks because from comments I'm sure we're going to get from people either on the phone or here this evening. So
Absolutely.
Okay, thanks, Doug.
Thank you, Supervisor Natoli. I have some ideas too, but there's still Supervisor Cerna would like to speak.
Thank you, Chair. And I'm eager to hear from those that have been waiting patiently on the phone, as well as my colleagues. This is one of those interesting instances where you may get wed to a certain geography here as being optimal with while forgetting that no choice or contribution you make happens without affecting everyone else. So I'm doing my best here to be very respectful of that. So the reason I asked about the continuity question earlier really has a lot to do with NDC 203. I think, as even my colleagues could attest, because they've heard me say it so much, that District 1 has represented very intensely the South Oak Park, unincorporated South Oak Park area for a number of years now. And again, I'm not suggesting it runs with me. It could, the next representative for District 1, should that stay in, might do the same thing, or if it goes to a different supervisor, it may happen seamlessly. But
can you tell me what you mean by South Oak Park?
South Oak Park.
South Oak Park. Okay.
Yeah, it's what's typically referred to as the South Oak Park Fruit Ridge Finger. It's the northernmost unincorporated peninsula that comes north of Fruit Ridge up to 14th Avenue and stretches east to Stockton and west to MLK. In NDC 203, you show it in District 2, and then to the west, you show District 1 extending from its current boundaries to include Land Park proper, but not Southland Park. So it takes, and Southland Park, because it takes it all the way to Fruit Ridge. So,
right. Is Southland Park, do you believe that Southland Park considers itself south of Fruit Ridge Road as well? Because the map 203, District 1 stops at Fruit Ridge Road.
I think it depends on who you ask, and I'm sure Supervisor Kennedy could probably answer a lot better than I could. But growing up in the area as I did, I always thought of Southland Park beginning at its northern boundary being Sutterville, and then continuing down to Fruit Ridge.
We have not heard of it. No one drew a map for us and said, here's my comment about Southland Park or Land Park in general. Sure. So I, again, living here for 40 years, I made the assumption that Fruit Ridge Road was putting Land Park together.
Okay. I would also note that the city of Sacramento actually does have a pretty good and very extensive neighborhood map that you can consult to at least see how the city of Sacramento as an institution looks at its neighborhood geography. In any event, so again, that South Oak Park area would go to District 2 under this scenario, and it would also add to District 2 Elmhurst and Tahoe Park. And while I can understand that connection and trying to keep that in the same district, in this case District 2, I would argue that the Elmhurst area and the Tahoe Park area have grown considerably much more connected over the last 10 years to the UC Davis Medical Center campus, especially as a project called Aggie Square continues to blossom. And in fact, if you go back and look at the redistricting exercise the city of Sacramento went through in 2011, there was a massive fist fight over 2 blocks down as it relates to whether UC Davis Medical Center belongs in District 6 or District 5. And it was actually reversed, if I'm not mistaken. So in any event, these are kind of adjustments around the edges, which I don't know that they actually have would result in huge shifts in the deviation. In fact, I don't think they would necessarily. But in terms of this particular iteration, 203, I don't feel comfortable yet kind of saying this is where we ought to start, because in fact it poses much greater changes, I think, for the history of District 3, not the history of Supervisor Desmond, but the history of District 3, because it includes just a massively new population, Rancho Cordova. So, I mean, I'm really curious to know from the current District 3 representative his thoughts, and I know he's queued up right after me, but that to me is kind of why I think this is probably the map that we start from, at least in my humble opinion. I do...
Which one, sir?
NDC 203.
Okay.
I do concur that in any of the iterations we consider, I think I mentioned it briefly earlier, that I do believe the Rio Linda, Alberta area that is on the west and the east of the northern tip of the McClellan Park does belong in District 4. That gives District 4 a little bit more population, albeit not much, because that's what they need to do, given the deviation currently. And then, again, to Supervisor Natoli's point, I do agree with him in terms of the Delta being a community that I think needs to be kept intact in a singular supervisorial district as much as possible, even though it's not a city. It's certainly, a very historically well-known place name or in geography of Sacramento County. So those are kind of my original thoughts. And then lastly, I assume the only reason you threw in Hagen Oaks Golf Course into District 1 is simply to stay with your theme of respecting the city boundaries, because there's obviously no population there.
You're correct.
Okay. And I think that's it for now.
Thank you, Supervisor Cerna. Supervisor Desmond.
Thank you. Did you want to comment on anything? Thank you, Madam Chair, and thanks, Doug. Appreciate the comments from my colleagues, certainly Supervisor Cerna. Yeah, it is a big change for District 3, because District 3 has historically been known, I think, as the unincorporated district. I do think totally agree, keeping Rancho Cordova together is important, and it seems like that's only going to happen if it's District 3 or District 4. I think that, Fair Oaks, Gold River, Rancho Cordova communities, there's a lot of similarities, but there's a lot of close identification among those communities. I do, in 203, I do like actually that you took out some of the areas of the city of Sacramento, so now the city of Sacramento is really just Districts 1 and 2 by removing those little pieces of the city from District 3 there. The one thing I don't like in that map 203 is, when you're splitting up both the communities of Foothill Farms and North Highlands now with that map, I think that's problematic for those communities, because those are not really, really large unincorporated communities, and I think it might actually dilute the effectiveness if they had 2 supervisors there. So I was wondering, is there a way to, maybe as a proposed map, to look at keeping either North Highlands or Foothill Farms in District 3, because it looks like you split up both of them in this map. So I'm just curious if you could maybe look at the numbers to see if something might work. That would be one suggestion. And then the other thing, if maybe another proposed map or an idea for a map, I know Supervisor Cerna mentioned Alberta and Rio Linda staying in District 4, but I mean, if you wanted to put all of Rancho Cordova in District 4, is there a way to look at District 3 at the north end going over and picking up Rio Linda and Alberta? I don't know. Maybe just something to explore if you wanted to fool around with some of the population numbers to keep District 4 or keep Rancho Cordova. Give another option of keeping Rancho Cordova in one district and that district being District 4. Just some thoughts. I mean, certainly equalizing some of the incorporated area is probably a good thing for the staff of District 3 in years to come. But those are some of my thoughts.
Okay, thank you, Supervisor Desmond. I also have some thoughts that I just wanted to put out there. I agree with Supervisor Cerna that maybe starting with the 203, it seems like seems like the best map to me. There were a couple of adjustments that I was thinking about. It's my understanding that Vineyard and Florin have a shared community plan, so they're kind of a community that has historically been linked, and so keeping them together by by keeping them in the Supervisor 2 district might be a good thing. I agree with keeping Rancho Cordova whole. It's really important to them, and I can understand. I think all the cities should be kept whole if we can. And also Rancho Cordova and Mather, they're connected in a lot of ways. So keeping Mather with Rancho Cordova, but maybe possibly moving La Riviera and Rosemont into District 3. The other changes could maybe adjust the population enough to make it work. And so basically keeping Rancho Cordova whole in District 5, but maybe just those two areas that La Riviera and Rosemont into District 3. I don't know how the others feel about those changes, but those were just some ideas. That keeps Florin and Vineyard together, Rancho Cordova and Mather together, and the unincorporated La Riviera and Rosemont connected to their together.
Let me, I've written down that suggestion. We'll check it out.
Thank you. Oh, excuse me, Supervisor Desmond.
Yeah, thank you, Madam Chair. And I would actually, not prefer that and for District 3. I mean, I think getting back to, taking District 3, taking Rancho Cordova is obviously a large change. Mm-hmm. And if District 3 were also to go further south to take in Rosemont, it currently includes La Riviera, but to take in Rosemont means District 3 would shed additional population somewhere else, which I think gets back to the points that Supervisor Cerna was making, is if we can keep the rest of the core of the districts together as much as we can. Plus, I think if you did that, if District 3 took those additional highly populated unincorporated areas from District 5, you'd have a bigger problem with District 5, which is already pretty low on the population on this map 203. Mm-hmm.
And I think I was thinking leave Rancho Cordova whole, just to make sure I was clear on
right, that was number one priority.
I understand.
Got it. Just for your information, Rancho Cordova, as a city on that map right there, not including Mather, Rancho Cordova is 79,000 people.
Mm-hmm. Okay, food for thought, lots of ideas, and now Supervisor Natoli has comments.
Yeah, just back to the focus again. Certainly want to speak to Rosemont. I know that when we talked 10 years ago, there was discussion about that community. It's currently obviously wedged between the city of Sacramento and the city of Rancho Cordova, and there are commonalities that relate to school districts and park districts that, certainly and community plan area, which again is important, and you accounted for that, Doug. So if you're looking at that iteration, I wanted to suggest that you look at Mather with Rancho Cordova as a part of that, and you probably took that note. And there is the in the current boundaries right now, you show College Greens East is west of Watt Avenue, and that area is currently in District 3. So this would shift it back, and I can say historically that used to be in District 5, going back about 3 census cycles ago. But as you're looking at that iteration, if it was it's currently in District 3, and then I don't know what's in that pocket. That's that Butterfield Riviera East Community Association. I think it's about 10,000 in there. That area that's in between current district boundaries. That you would you see what I'm looking at? It's a small scale.
I'm familiar with the community college greens. I don't have a definition of the boundaries in my head. Can't.
But what I'm saying is that La Riviera, if you're going to look at moving Rancho Cordova, that keeping that area north of Highway 50 together there. I mean, that's a distinguishable neighborhood and community, and so it would be Rancho Cordova from Bradshaw Road into city of Rancho Cordova, La Riviera, Butterfield Riviera East, down to now down to La Riviera, that area there, Mayhew Canal. Yeah, that's the
you just say that areas north of Highway 50 belong with Rancho or not?
Yeah, the area north. I would say if you were looking at school district and park district commonality in Folsom Boulevard, but basically north of 50 has to be north of, because it crosses 50 crosses over there, so you account for that. So basically, north of 50 from Bradshaw Road down to La Riviera, which is and there's a little jog in there because of the Mayhew Canal. That's District 3, District 5 in there. So, but include that. Look at a scenario that would take that in with the city of Rancho Cordova under the scenario with District 3.
What would you backfill District 3 with then? You're saying take
no,
those
I'd say put it in. I'm not.
Put it into District 3.
Yeah.
Okay.
And to account for it, run the scenario, and then Independence of Mather is about 3,000 people too. And Doug's very good about giving us guidance on the deviation, but we have the ability to take certain things in consideration up to that maximum of 10, which you're never going to advise us to. You want to keep it at 1, but in trying to account for growth and keep communities together, which again I think you've done a good job here, and certainly in your modeling. I would ask that you take a look at that. I know you had a virtual workshop on Saturday, so again, maybe people can get a chance to react to that once you've run a couple models. I don't know.
I'm sure we're going to hear from a lot of folks in the public on Saturday as well.
Yeah, you certainly do. Yeah. Okay, that's all I had.
Can I?
Okay.
I'm sorry.
Doug.
Can I say a couple? I just
no. Actually, okay. Yes, and please.
I'm just curious. So, in Supervisor Natoli, were you thinking that it would be then in map 203 would include Mather, Rosemont, and La Riviera?
No, not Rosemont.
Oh, the La Riviera portion?
Yeah, just that notch down
north
to...
of 50.
Right. But it's deceiving when I say north of 50 because 50 crosses it, so there's a juncture at which 50 crosses right there at La Riviera.
And I think because I already have part. I have part of District 3 already has part of La Riviera.
Yeah. So
that would probably require an adjustment somewhere in the north. Again, probably Foothill Farms, North Highlands, District 3 being taken out.
Well, it might or might not, depending upon what the
number
is.
Right.
Yeah. And again, you look at you can run one or the other, take a look at it. But I think it's important. And it goes to the letter that we received from Rancho and retains Rosemont in its entirety.
In District 5.
In District 5, correct.
Okay, we now have Supervisor Kennedy.
Okay, I was going to wait till the end, but now I got tired of sitting here as a spectator. All right, so if we're kind of focusing on District 3 right now, I'll just tell you where my issues are. 203 would in District 2. First of all, I wholeheartedly agree with the comments of Supervisor Cerna earlier in some of that area over there that you've added on the east. As much as, being a former Oak Park resident, it does make a lot more sense in the current configuration in my mind as far as contiguous neighborhoods and all of that. That's number one. It would also remove from District 2 Hollywood Park, Southland Park, the Little Pocket, and Land Park, which I think has a lot more in common with from say Broadway down than it does Broadway up, or putting that in a downtown district doesn't make a lot of sense to me. I do appreciate trying to keep Land Park together because it has been a source of confusion as much as I enjoyed walking one side of Vallejo and Mr. Cerna walking the other. But it does have some confusion in there to have a historic neighborhood like that having two representatives. So that has been a problem. So whether it goes north or south, that's an issue. But I just do think that it draws a really strange part of the area that you now have between Fruit Ridge and, say, Broadway. Doesn't make sense to me.
Okay.
Thank you. Supervisor Cerna.
Thank you. Yeah, I agree with most of what Supervisor Kennedy just mentioned. The only thing that I would remind those other than Supervisor Tolley, because 3 of our supervisors were not here in 2011 for this exercise, is that again was the time, at least to my knowledge, where the concerted effort and question was asked about the LGBTQ community. And at the time, as was indicated with the map that they submitted from Mr. LaFazo, that's what drove, at the time, bringing District 1 down to Vallejo to capture Upper Land Park, to be respectful of that community of interest with downtown, with Midtown, with other parts north of Broadway. So as far as I'm concerned, the treatment of that whole southern boundary between districts 1 and 2 could stay as far as I'm concerned. And if we need to talk about whether or not east of Power Inn, north to 16 should go to District 2 or remain in District 1, I think that's fair. That's a fair discussion, or that's fair game. I don't know how much population change you're going to get out of that. But I understand what kind of drove this for District 1, because you included College Greens, which isn't currently in there. You include Campus Commons, Sac State. So again, remember where we started in NDC 201 with regards to Districts 1 and 2, which is what it is today, essentially.
Supervisor, I toggled back to the map that Mr. LaFazo submitted.
Right.
The dark areas are the what he is saying are LGBT communities.
Right.
Are these the city areas that you were talking about?
Correct. Yeah, the dark line that goes east to west there, in the
North Oak Park, Central Oak Park,
where it cuts across Upper Land Park. That's Vallejo Way. And
over the Elmhurst, and that's the old fairgrounds there, right?
That's I would call it Oak Park. Elmhurst is to the north. Tahoe Park is to the southeast.
Oh, okay.
So again, I think that, it'd be interesting to see what would happen if you took NDC 203, and you simply left intact the southern boundary of District 1 and the northern boundary of District 2 where they meet, to see how much deviation you get with that.
Okay.
All other things being equal, then you can go address
I was thinking that in my head.
Yeah.
Okay. You can proceed. We don't have anyone. Oh, you have a question? Oh, please.
I forgot to say it last time when I was speaking before, and I don't have a huge amount of heartburn over what Supervisor Serna just said. But I did want to comment on, you did talk about the vineyard area being in District 5, and I will say that there is some sense to that. It is much more rural and not even suburban, compared to the rest of District 2. As beautiful as it is, it really makes a lot more sense being contiguous with District 5 in my mind.
And if I could just speak to that, I think that as you looked at the Castleman Ranch request, Doug, I know that, again, the last go-around as we were looking at it, that, we were at Elk Grove Florin Road, and then we were looking to go to Bradshaw, and then the population, because of some of the shifts that occurred in District 3 and 4, went out all the way out to Vineyard Road, and obviously Mr. Kennedy's represented that district now for better part of a decade almost. But you could pull that back again, reflecting that as you get closer to Elk Grove Florin, you have built neighborhoods and that are contiguous. Certainly in the Bradshaw Road area, still a lot of development yet to occur, and it does, there's still rural portions of that. But again, if you're looking at population-wise, you might be able to, again, to avoid maybe some of the adjustments that come because of, trying to pick the population up, and then it affects the city portions that Mr. Serna and Kennedy were talking about. So again, it might be an area, you kept Castleman Ranch together, but maybe you go down or move it back this way, keep it together, although the preference, I guess, by folks was to stay in the District 2. I think you have some ability in that notch, which was a large part of what happened after the district lines were changed for 3 and 4. The last go around is the District 2 needed to pick up more population, so that came out, marched out quite a bit further. So there may be a ability to retract some of that and keep Vineyard largely, if not wholly, together in D5. So.
Yeah, not being here at that time, I wasn't involved in the conversation.
You're fortunate.
Yeah.
Vineyard,
Yeah.
Vineyard. Interestingly, and
yeah.
I worked on this with your staff. Vineyard was 25,000 people 10 years ago. It's now 45,000.
45,000.
So, and growing more.
And growing,
as
right.
we go along.
Right. So you might have some ability though to adjust that and maybe pull back, as Mr. Kennedy was saying. So anyway.
Okay, thank you.
You want to hear from the public?
I don't think he's done with his
Oh, he's not?
presentation. We keep interrupting him.
I just made a mistake. I need to go back. There we go. Yeah, I think I'm basically done, but there was one thing. In other words, what do we need to do now? And we just had a board discussion of these maps and wait to hear from the public. And you've given me some ideas on what to focus on, and I will do that, and the direction. And I just wanted to remind you what the timeline is as we go forward. We're having a virtual community workshop this weekend, Saturday specifically. Then we come back here on the 16th for our second review. In other words, we'll have new draft maps, a new draft map for you at that time, and hear from the public. And at that next meeting, which is 2 weeks from now, we'd like you to focus on making a decision of some sort. And we've reserved the next day, the 17th, as another discussion where you can finally finalize. And December 7th would be adopting a resolution. Just so that I just wanted to go over that for your information. That's all I had for now.
Thank you, Doug, for all the comprehensive work that you've done on this. That was a great presentation, and we do have 3 or 4 callers on the phone, and we do not have any people in the board chambers to speak. So we'll move forward to public comment on the phone.
Okay, I'll have staff get them transferred over. Please send the first caller. It may just take a second because Hi, caller. Please start with your comments. You have 2 minutes. Can you please mute the meeting in the background before you start talking?
Yes, hello. My name is John Merchant. I live in Rancho Murrieta. I've been there for 35 years. I wanted to point out first that when you do this process again, we will have 9,000 people. We have 400 houses presently mapped and another 795 behind that. Importantly, I think to note is that we are inside the urban services boundary. We were put there back in the 70s, and we are surrounded by A2, A5, and A10 zoning. I think we have problems that are unique to us, and what concerns me primarily tonight, and we will be back for the workshop, is in the summary of online and workshop comments, it makes a statement that Rancho Murrieta belongs in District 5. I wanted to point out to you that none of the comments that you received from us indicate that, and none of the maps that you've reviewed tonight were made by people from Rancho Murrieta. There is some concern there. There's a lot of discussion already about using NC 203 as a benchmark, whereas if you look at NC 201, the bottom of that purple line on there is really the wheelhouse for Rancho Murrieta. All of the things that concern us the most, the urbanization of the Jackson Road, the Scott Road, the 30-year ongoing relationship with the landfill, the connector, are looking for suitable emergency evacuation routes, our economic ties to Folsom are kind of not in sync with what we're proposing here. The other part of that is Supervisor Sermon's comments about continuity. We've had 3 supervisors in 10 years. I'm just hoping that, again, this 6,000 population is not just a convenient dump off to satisfy what becomes the permanent map. We will be back for the workshop, and we will make sure you understand what the people of Rancho Murrieta really are interested in. And until then, I really thank you for the time.
Thank you, John.
Please send the next caller. Hi, caller. Please start with your comments. You have 2 minutes.
Thank you. My name is Amr Shergill. I live in Elk Grove, closer to I-5. I want to thank, first of all, the supervisors for recognizing that as much as possible, we need to keep all the cities together in single districts. And I might even raise the stakes a little and say that that has to be a requirement and not just a priority. And second, I'd like to just highlight for the supervisors the growing connection in the API community between Elk Grove and South Sacramento. That's something I see discussed occasionally, but certainly not enough. And it would be really good if that community of API in Elk Grove and South Sacramento were kept together. And as I can see the maps, I see 102 and 107 being the ones that accomplish all of the above. So thank you all for your work on this. And just one final note. At some point, maybe we should agendize a discussion on the boundaries of the cities versus the county, because it seems to me that a lot of the discussion today is dependent on some boundaries which might be anachronistic at this point. Thank you.
Thank you.
Thanks, Mark.
Yeah, that's a good idea.
Okay, please send the next caller. Hi, caller. Please start with your comments. You have 2 minutes.
Thank you. Good evening, supervisors. My name is Andres Ramos. I'm a resident of Sacramento County, and I submitted 3 of the public maps that were shown in the staff presentation. And first of all, let me thank the presenter for going over my maps and reading my comments on why I thought the maps might work. And so I just want to emphasize that the reason I submitted those three is because I think any of those three maps would be good and would generally abide by the criteria many of which has been articulated tonight by the supervisors yourselves. Ultimately, the maps do attempt to keep the cities together. I did notice that I think on a couple of them, they accidentally cut a little slice of Citrus Heights. That was unintentional. I couldn't find the border in the mapping software. But ultimately, from my perspective, as was said, I do believe that Elk Grove and the South County areas like South Sacramento, Flora, and Vineyard should be kept together. So you see that consistent in the map, given that currently they are not fully together, even though historically they used to be. I think it's good to have a good balance between city and non-city. And so 2 of the 3 maps there do that. Ultimately, if I had to pick among the ones that I submitted, I think map 102 and 103 would be preferred, although 103 and 107 are actually very similar, so that one could be in the mix as well. So I would ask the board to please throw those 2 maps into consideration so that they could be considered at the future hearing, and so there's more opportunity for the public to weigh in with further options beyond just the NDC 203, which it sounds like the board really likes. And just lastly, just want to thank you all for the opportunity to submit maps. I would note, I was surprised that more public maps weren't submitted. The October 15th deadline wasn't anywhere on the website. It was only in the PowerPoint that you had to click into. So that's probably why there were more public submissions. But I'm thankful that I was able to submit, and thank you for your consideration. Good night.
Thank you.
Thanks, Andres.
Okay, I think he was your last caller. I'm just double checking. And that was your last public comment.
Okay.
Close the queues now.
Okay. Well, I just want to say this is not an easy process. I have not been through this process before, but it hits close to home because you care about your district and you hate to make choices about lines, but it's something we have to do every 10 years. So I want to thank so much Doug Yoakum and Doug Johnson for being here tonight and for all of your hard work. And Natasha, you've also been a key player in all of it, and everyone who's been involved. I know I want to ask about the public. Supervisor Desmond has some comments, but I just wanted to ask about the public meetings that you're going to be having. Will you be announcing those? Will that be like a webinar, or will it be an in-person public meeting? Will you do it throughout the districts, or will it be one big meeting?
The only other public meeting we have scheduled at the current time is this Saturday. It's a virtual workshop where we hope to hear from city representatives, members of the public, just a reaction to these maps. I will give them the same presentation I just gave you, give that workshop the same presentation I just gave you.
Okay.
So they understand what was submitted, and hopefully we'll hear from them, from the public, what they think of various maps and what they think of what should happen to current districts if they have those opinions. Hopefully some good ideas will come out of it, like we've seen here, and hopefully we'll move on from there. Because in 2 weeks I have to be back here with another draft, and actually because of your deadlines, it has to be quicker than that.
So you'll take all of our comments and come back with 3 new maps, or 5 new maps, or
what do you think?
I don't know. I'm just curious.
I would like to consolidate it into one, see if that's possible.
Okay.
If I run into problems, obviously I will give you other alternatives.
Okay. Supervisor Desmond. Oh.
I just wanted to ask on that point, since we have this great iterative tool, why can't you bring it into his chambers while we're talking and put it up, and then you can, and have the population charted out. You got all these other demographics in there, and actually portray it so we can see. And if you subtract over here, you add over here, you draw a line over here.
You watch state commission meetings.
No, you haven't. I haven't. And I don't want to make it too complicated, but I'm just, again, because it puts a lot on you, and, you know, we're getting into some detail, and you've got the public maps, you got, you know, the comments here this evening, the comments you're going to get on Saturday. So if you had somebody that could assist, you know, like voter registration is pretty good. I know they've helped in times past. You plug it in and you move this census tract, that precinct or whatever, and you start. Maybe you're going to do that anyway. But I offer that suggestion because it may help you in trying to.
Let's see what I can come up with draft-wise, and then I'll discuss with their staff whether we should bring the tool in here and actually draw while we're talking.
Yeah, the maptitude. I've been to Tasha, Madam Chair. I'm sorry, she was.
Okay, thank you. Oh, sure.
Is it okay if I address that too? Supervisor Natoli, your comments are well taken. I do want to talk with our staff and see what we can do to, you know, bring the technology as you suggest into the chambers on the 16th. So we'll see what we can do to do that and accommodate that request.
Thanks.
Thank you, Natasha. Supervisor Desmond, you had your.
Thank you. I just want to say, you know, Doug, I'd rather you don't come back with just one map. I'd like to see a couple different ones because, you know, I just want to make it very clear, you know, I would prefer one or two because that preserves, you know, really the heart of District 3. And it preserves two unincorporated areas that, and I know I'm only a temporary occupant of this chair, but North Highlands and Foothill Farms, keeping them together in District 3 is important. If we have to, if it's the will of the board that District 3 takes in Rancho Cordova and making such a big change to Rancho Cordova, I would really see if we could endeavor to keep either North Highlands or Foothill Farms still within District 3, at least one of those communities still within District 3, so it's not as disruptive to the remaining unincorporated area. And I know you're going to be, you know, making some maps based on Supervisor Natoli's suggestions, but I just want to be clear. I'd like to see a map that preserves the southern boundary of District 3 as the American River to the south for everything west of the city of Rancho Cordova. I'd like to see that and see what those numbers look like, if that makes sense. Because Highway 50 is a divider, but the American River is also dividing. Is also a natural.
Say that again.
I said I know Highway 50 is a dividing line, but also the American River is also a natural geographic boundary. So I'd like to maybe see some of the numbers based on Supervisor Natoli's suggestions, but what the numbers would look like just keeping the American River as the southern boundary west of the Rancho Cordova city limits, while also trying to retain either Foothill Farms or North Highlands within District 3 and not break up those unincorporated communities. That make sense, Doug?
Mm-hmm.
Okay. Thank you.
Okay, and Supervisor Natoli.
No, I spoke already.
Okay, you're done. Yeah. Supervisor Kennedy.
You know, what it comes down to at the end of the day, it's going to be which one of these do we hate the least?
Yeah.
But I do think that I have to agree with everything Mr. Desmond said for the reasons he said up in the north. I also think that maps 1 and 2, and I know we focused a lot on 3, but I do think 1 and 2, the Rancho Cordova thing, of course, is an issue. I agree with that, but overall, 1 and 2 maintain neighborhoods more than 3 does. It doesn't split as many neighborhoods, doesn't split as many traditional areas of interest, is, in my opinion, in 1 and 2 than 3 does.
Thank you. Supervisor Cerna.
Thank you. So I'll conclude by saying I too think in this order, NDC 201 would be my top preference. NDC 202 would be my, I'm sorry, other way around. NDC 202 would be my top preference. NDC 201 would be my second preference. And then NDC 203 with some of the adjustments that I tried to articulate earlier as it relates to the southern northern boundaries of District 1 and 2. But those 3, I think I'd be okay with just as starting places. Obviously, Supervisor Kennedy and myself would have the luxury with 1 and 2 basically having the districts be the same. So we have that the ability to say that, but that's why I wanted to hear from Supervisor Desmond kind of early in the discussion, because I have a feeling this is going to really boil down to the discussion around Rancho Cordova, and that's I want to certainly be respectful of his comments that he just made, because I can appreciate them.
Understood.
Okay. I think we've exhausted comments from the board and the public, and we thank you very much for, it was a great effort. I don't know how you're going to go back and pull all that together, but I'm glad it's you and not us. So with that, I believe we are ready to move forward, and we have some direction, and I'm very excited about completing this process, and we'll move to the next item, please.
Your next item is your nominations, item 42. You're continuing to November 16th. Carmichael Old Foothill Farms Community Planning Advisory Council, Vineyard Area Community Planning Advisory Council. You're continuing to December 14th, the Cemetery Advisory Commission, Children's Coalition, Developmental Disabilities Planning Advisory Council, Rio Linda Alberta Community Planning Advisory Council, Sacramento County Mental Health Board, and the Sacramento County Youth Commission. Your first item is Adult and Aging Commission. Supervisor Frost.
Please continue to November 7th.
December 7th?
I have November 7th.
We don't have a meeting on November 7th. It was probably...
Okay. Whatever you say is what I have.
Okay. Thank you. The next one is California Department of Corrections and Rehabilitation Citizens Advisory Committee. Mr. Natoli.
Yeah, we continue to November 16th. We have another interview to do.
Okay. Then we have the Community Review Commission. Supervisor Kennedy.
Yes, I'd like to nominate Michael Whiteside and waive the process.
Second.
Who was the second? I'm sorry.
Cerna.
Mr. Cerna, okay. And please vote. And that's a unanimous vote. And then Supervisor Desmond.
Please continue to November 16th.
And then Mr. Natoli.
I don't have any applicants, so continue to December the 7th. Please.
December 7th?
Yes.
Okay.
We'll try to get another applicant.
Gotcha. All right. And then your last one is the Fair Oaks Community Planning Advisory Council. Mr. Desmond?
Please nominate Catrail Wood.
Okay. And you have one seat, so that's that. So we're done with that. Your next item is county executive comments.
No comments, thank you. I know it's been a long day.
Yes.
And then you have your supervisor comments and announcements.
I have Supervisor...
I'm sorry, I can't hear.
Supervisor Cerna, please.
Thank you.
Great, thank you. I just wanted to say thanks publicly to the Mutual Assistance Network. Danielle and all her staff did a fantastic job this past Saturday. They held their annual Fall Harvest Festival out in El Paso Heights at the Robertson Community Center, and it was, again, a drive-through event this year because of the ongoing concerns about the virus. But judging by the traffic jam that it caused, it was a great success. I had a chance to say thank you personally to a number of our partners, including, and this was both in my capacity as with First Five and representing the area on the board, but Black Child Legacy Campaign, Black Infant Health, SMUD, a number of others, even our local California Breathe campaign was there giving suggestions for how to build fans with filters and make sure people have clean air indoors. So it was a huge success. Thanks to all involved. And that's all I have, Madam Chair. Thank you.
Thank you, Supervisor. Supervisor Desmond.
Thank you, Madam Chair. I just wanted to announce I had the opportunity to go visit the Haven for Hope facility in San Antonio last week with a delegation from the city, and Emily went as well. And I know that my colleague Supervisor Kennedy's been there, and our county exec has been there. And to me, it was just really inspiring to see some of the things that they're doing there, especially in terms of getting such great coordination among the service providers. And I think one of my biggest takeaways is that results in real coordinated entry, a coordinated front door, where there isn't a delay in getting someone out of the situation they're in and right into the treatment and the housing they need right away. So, it's not the only solution, certainly in San Antonio, and they have other challenges too, but really excited to having a discussion certainly with both of you, but certainly as a broader board about policy ideas we can take away from that and maybe implement some portions of it here in Sacramento. So thank you.
Thank you, Supervisor Desmond. Supervisor Cerna.
Yeah, forgive me, I had one other thank you I wanted to make mention of, and that is to Deputy Chief Jim Barnes. Last Friday, I had a chance to do a half-day ride-along with the Chief Deputy, and we managed to, I think, be on his supervisorial patrol in 4 out of the 5 supervisorial districts. So I had a chance to talk to some of the deputies that were on calls and really understand a little bit better their protocols for how they respond. And I would just note in particular their mental health crisis teams that were out, and we had a chance to see for ourselves a response to a call that could have ended badly, but didn't, and had a chance to engage in some pretty deep conversations, both from the clinician's perspective, but also the partner deputy that patrols with that clinician. So thanks to Chief Deputy Barnes for the time and the exposure to what our men and women in uniform are doing in the county.
That's great. Very nice. Okay, thank you, Supervisor Cerna. And this meeting is concluded, and we are adjourned.